Okay. So a very important thing, how, I mean, psychiatry, what all, we deal with, has underpinnings to genetics. Developmental issues are very important. The environment in which the child is brought up, and remember, 8 hours of their day they're spending with you. Influence of society and culture, that is the psychosocial factors. Biological factors, that is the underlying neurochemicals. Okay. For example, I always say stress plays a role in everyone's life. So we can't say that none of us have stress. I think all of us face stress. The way we process the stress is very important. And that is decided by the temperament, how the person takes it up. Also, a lot to do with the brain circuits or the biological factors. In children, the neurons, they keep dividing, just haphazardly. During adolescence phase, the neurons, they undergo pruning. Okay, so you see a hedge, no? The hedge keeps growing in all directions. Then the gardener comes and, he prunes it off and it looks so beautiful. In adolescence, that pruning of neurons actually takes place in these children. And that's how, they come up to be, competent adults later on in life. So the biological factors, the temperament or personality of a child plays a big role in these, and stress. A child, who faces stress, say, for example, 3 children failed in a class. One says, I'll see it next time, big deal. Okay. The other one says, oh no, I'm very scared today to go back home. He runs away to his grandmother's place and hides over there. The third one goes and attempts suicide. Okay. Maybe there's a fourth one who doesn't care at all. He goes home, he laughs, and his parents also laugh along with him, and they say, okay, no problem, give it next time. So there is the process of stress, how it behaves in each individual is very different. So giving our examples in each case, I think won't really work out very well, because you should help them in identifying when the stress is taking place and how to process it and how to react to it. That should be our role, not just telling them that, you do this, or why aren't you doing that? That's very authoritarian. Okay. So how does child psychiatry differ? Because children are usually brought to us by elder people. I mean, the elders of the family, the parents bring them to us. Why? Because they perceive that there's something wrong. So in a highly disciplined family where, the child is supposed to sit, stand, laugh, eat, whenever the parents expect him to do, and this child is a little, he just doesn't listen to anyone. He wants to do things his way. That child, even if he stands within the normal limits, will be brought to us saying that, he's indisciplined. So it is for us to decide whether the child is actually indisciplined, or is it the role of the parents that is being too disciplined. We have to find the balance between them. Greater attention should be also paid to the stage of development. A child at 2 years, sometimes, he's brought, and sometimes they complain to us that, oh, the child can't write even a single word, or they can't write a sentence properly. We have to sit and explain to them, this is not the developmental stage for a child to be writing a single sentence. So just hold on, wait, give them some time. Then they'll start comparing. No, but the other child in his class is writing. Why can't he write it? We have to explain that there's a spectrum, okay? There's a range. And, in that range, if the person lies, it's okay. And you can just let go. It's not moving. Give me the laptop here otherwise. You move it otherwise. The next slide. Yeah. So children are generally less able to express themselves in words because, their linguistic capability of expressing emotions is less. A lot of our therapy involves around reassuring or changing the attitudes of the parents itself and retraining the children. And techniques of psychotherapy have to be changed. We can't employ the same techniques that we employ in adults. Next slide. So we use these various diagnostic criteria, not that it's of importance to you. It's like we psychiatrists, we base our diagnosis on ICD-11 and DSM-5. Next slide. So there are 3 kinds of disorders that are present in children. The emotional disorder, or we call them as internalizing disorders. So in this, the child keeps thinking, keeps relating to stress or whatever they suffer from is quite internal. Yes, there will be external behavioral changes, but not so much. So internally, they start processing things in a different manner. And that's how, they lead on, it leads on to anxiety, depression, phobias, or obsessive compulsive disorder. They are known as emotional disorders or internalizing disorders. The second one is the disruptive or the externalizing disorder. So in which there's more of harm being caused to outsiders than, the person himself. And these are the conduct disorders, oppositional defiant disorders, and attention deficit hyperactivity or the hyperkinetic disorder. And the third one is the developmental disorders, in which you have the mental retardation, you have the autism spectrum disorders, and the learning disabilities. Next slide. So in emotional disorders, next please. I'll just give you some case vignettes so that you understand a little better. There's a 14-year-old girl who was socially very apt earlier, good at studies and actively participated in class activities. She's being noticed to be dull since 1 to 2 months, doesn't talk much to others, remains aloof, and doesn't take part in discussions in the class like before. Her grades are also slipping down, and teachers have observed marks on the left, the cut marks on the left wrist. What could be the case? Emotional, yes. What in emotional? Maybe depression, yes. So this is sign of self-harm. And usually it will be on the left hand because right-handed individuals. If it's a left-handed individual, it will be on the right hand. Next slide. So in cases of depression, we see sadness of mood of a duration of 2 weeks or more. See, all of us face sadness on a day-to-day basis. That does not mean that it is depression. So if that sadness is, prominent enough to be affecting your day-to-day lives, and if it is present most of the time in your life for over a period of 2 weeks, only then it is categorized as a depressive disorder. Anhedonia is lack of interest in doing anything. Energia is lack of energy. So this child will be, appearing very lethargic. There's disturbed sleep, appetite, concentration. There could be crying, anger issues, when they can't handle the frustration too much, low self-esteem, helplessness, hopelessness, death wish, and suicidal ideations may be present. Next slide. The other category is the neurotic stress-related disorder under the emotional disorders itself, in which there is phobia. Phobia is nothing but a excessive, there's like out of proportion fear of a situation or a particular thing. So the phobia could be social phobia, that they're scared to come and stand in front of a gathering or take part in assembly or explain, experiments in your science education. Or it could be a panic disorder in which they just feel this intense panic, intense chest pain, breathlessness, tremors of hands, sweating. They feel as if they're going to faint. They feel they're going to pass out or die immediately at that time. You may be getting many such patients, cases in your school in which you see that they are hyperventilating and suddenly, their hand becomes like this and they become fine on their own after a while. They're conscious throughout, or they'll be fluttering their eyelids, or they'll be speaking or answering to you, ha, na, no, ha, but they'll not talk properly at that time. Then there's generalized anxiety disorder in which there's tension throughout the day. So throughout the day, the tension. And then there is post-traumatic stress disorder in which there is significant trauma to the child. Okay, so I had this patient who came to me many years back, who saw two dacoits entering his farmhouse when he was alone with his grandparents. His parents were not there.
Good morning, madam.
Tried to come inside the house and they killed the two dogs in front of them. Okay, they tried to enter the house further. By that time, naturally the police was called and they came and they saved them. So that was the trauma that the child was facing. So such severe trauma. These days, trauma has become a very, very commonly used term. Okay. If a parent scolds the child, it's trauma. If the teacher makes the child stand in one corner, that becomes a trauma. For us, in post-traumatic stress disorder, that is not trauma enough. The trauma should be significant enough to be causing an impact, like a sexual, assault on a child. So such kind of trauma would lead on PTSD. And then there's dissociative disorders in which the child has, some kind of, fainting spells. Or they say that, as if Devi is coming on top of them. They start speaking like someone else. They're not doing it on purpose, remember. It is some underlying conflict that makes them behave or react in that manner. This is another case of a 12-year-old boy, shy by nature, good at studies, avoids all extracurricular activities, especially if he has to give any presentation, like the stage. He starts trembling at that time. He designs great projects for science exhibition, but avoids explaining it to public when it comes to that. He insists that his friends do it for him. When he was once forced by the teacher to give presentation in the assembly, he made an excuse that day and he didn't go to school at all. What could this be a case of? Phobia, social phobia. Okay. So in this, there is excessive and unreasonable fear of a situation, exposure to the object. I mean, that social situation is provoking the anxiety, and there's avoidance of the situation. Next slide. Then this 12-year-old girl who gets sudden attacks of palpitations, giddiness, breathlessness, sweating, fears that something fatal is about to happen to her. She becomes normal within 15 minutes, is scared that she may get another episode, and she tries to hang on to people around her. What could this be a case of? Anxiety. What kind of anxiety? It's panic disorder. So it's coming suddenly out of the blue. And the child is thinking that she may die or she may faint or she may pass out at that time. Next slide. So next slide, please. So this is a 15-year-old boy who's seen doing repeated actions like touching his book 3 times before opening it, keeps scratching and rewriting in spite of having written it right, comes back to check his desk if he's left something behind after going out of class every day. Okay, it's every day, remember. He cannot concentrate on studies like before. What could this be a case? Very good. So in this, and usually remember, OCD starts actually in adolescence. Okay, we get to see them, maybe after 10 or 15 years when they come to us in clinics. But here the child starts suffering at such an early age, and they don't know how to explain it to them. They don't know that there's something wrong going on. I don't need to do all this, but some thought that keeps coming, intrusive thought that keeps coming into his head, and he has to do it just to quieten down those thoughts in his head. Next slide. Then there's this 11-year-old girl who's been absenting herself from school very often, complains of stomachache often, has seen several doctors, all investigations are normal. What could this be? This could be a somatization disorder or somatoform disorder. Next slide. In which you get several physical complaints, all investigations are normal. So symptoms, remember, are not being feigned. So this is not malingering. She's not making up the symptoms. The symptoms are actually being experienced by the child, but there's no underlying physical problem to it. But there's some kind of underlying stress. Okay, so we have to find out what the stress is and then work upon it. The second category of disorders is the disruptive disorders, in which I said there are oppositional defiant disorder, there's conduct disorder, and there's ADHD or the attention deficit hyperactivity disorder. So there's this 15-year-old male child. He has been breaking rules very often. He gets into fights with others, has signed his father's signature on a report card, and he was caught later, but he had no remorse for it. He had stolen an expensive pouch from a classmate. Sounds very familiar? Yes, so it's either oppositional defiant disorder or conduct disorder. They both are very similar to each other, only that conduct disorder is much more in magnitude compared to oppositional defiant disorder, in which this child will lose temper very often. He argues with adults, refuses to comply with requests from adults, blames others, gets easily annoyed with others, spiteful and vindictive, and gets angry and resentful. Conduct disorder, like I said, all the other things of oppositional defiant disorder are there. Along with that, it's higher in magnitude. So there'll be cruelty towards animals and other people, destructiveness to property. Okay, so they'll be going and setting fire on things, stealing, repeated lying, truancy, severe temper tantrums, persistent severe disobedience. Drug abuse is very common in these children. They may bully or intimidate others. They may even run away from home. Next slide. Conduct disorder children, they are more likely to perceive hostility in others' actions. So if you ever ask them that, why did you hit the other child? They'll always try to magnify, what the other child did and always try to minimize what they have done to the other child. They exaggerate their peers' aggressiveness and underestimate their own aggressiveness. Aggression is very frequent in their families as well. They have difficulty in solving social problems. So you give them a problem to solve in a social context, they're very poor at solving it, and that is why they resort to that. aggressiveness because they think that that is their way of dealing with the problem. Next slide. We teach them self-monitoring of behavior. I'll just talk about all these things later on. Next slide. This is an 8-year-old boy who disturbs the class by fidgeting, moving about restlessly, talks excessively and disturbs others around him, tends to lose his belongings very often. So every other day he'll be losing his pencil, eraser, scale, whatever. Speaks out of turn, gets hurt often in the class and in the playground, because of being fidgety. What is this? ADHD. So it's a case of hyperactivity. Yes. So hyperkinetic disorder or ADHD, there's impaired attention and hyperactivity. So there's 3 varieties of it. One is the inattentive type. Okay. So this child will not have too much of hyperactivity, but just lack of concentration. Hyperactive type is like a very obvious type in which, he'll be running all over and very fidgety. And then there's the mixed type. Next slide. In the inattentive type, the child fails to give close attention to details, especially coloring and all. You'll see the colors always going out of line. Difficulty sustaining their attention, and they'll make very, very silly kind of mistakes, especially in mathematics when they're trying to, do the basic calculations and all. They do not seem to listen. So the whole instruction, they will not have the patience to listen to the teacher through. And they have difficulty in organizing. So organization skills are very poor. They often lose things. They get easily distracted by external stimuli. So whatever's happening outside the class is more interesting to them. The hyperkinetic or the impulsive type, they are fidgety. They often leave the seat in the classroom. They run or climb excessively. There's difficulty in engaging in leisure activity quietly. So you give them even a movie to watch, they find it very difficult to sit. They have to get up again and go back again. They talk excessively. They blurt out answers even before your question is complete. And they interrupt and intrude others. Next slide. Next slide. Then the last one is the developmental disorders. Next slide, in which we have the mental retardation, we have autism spectrum, and we have the learning disabilities. So in pervasive developmental disorders, now we see a lot of these children who are on the spectrum actually, remember. So an autistic child, like how we used to define or we used to remember seeing an autism, we could identify them from a distance. There are a lot of them who lie on the spectrum. So they'll be very good with their, ability to sit, read, write, and, do their academics very well. But the social interaction with other children will be very poor. So language skills also somewhere they compensate for it over time as they grow up. But somehow, just to integrate with others, have a group kind of a coordinated effort in the classroom, they find these things very difficult. You see abnormalities in communication and social interaction, restricted repetitive activities and interests. So, whatever they feel they are comfortable with, they don't want to explore something new, or even when they're told to do something new, they hesitate and they come back. It usually manifests before 5 years of age. Next slide. Boys, it's more prevalent. So there's impairment in reciprocal social interaction. Like, you see a child coming to the class every day, he'll be saying hi, hello to the other children, or, patting their back or saying something. This child will be on his own, okay, in his own world. Autistic aloneness is there. Absence of eye-to-eye contact. So this child is not shy. Now remember, the social phobia child, he was shy. You could make out that, he's looking, he wants to be a part of the class, but he keeps looking down, then again looks up and, looks down again. But an autism child, okay, he's like, he will not make that eye-to-eye contact, not because he's shy, but because he just doesn't know how to do it. Lack of response to others' emotions. Okay, he does not know how to react to other children when they're angry, when they're sad, whether to go to them or to talk to them. Speech is poorly developed. Repetition of words is very common in them. Similar kind of words, similar kind of language over time. Obsessive desire for sameness. So if there little bit of change is there in their surroundings, they get very disturbed. Bizarre behavior and mannerism. Sometimes they'll be just nodding their head or just flapping their hands in a bizarre manner. Not all the time they are associated, but low IQ and seizures are commonly associated with autistic children. Next slide. Mental retardation. This is defined as significantly sub-average general intellectual functioning, and it should be accompanied by at least 2 of limitations in the following areas, like either communication self-care, home living, social and interpersonal skills, work, leisure, health and safety. Next slide. So this is how we calculate the IQ. We say mental age upon chronological age into 100. And the categorization of mild, moderate, severe, and profound is this. There's another category called as borderline, which is from 70 to around 80 or 85, 90. We see a lot of these children struggling in their academics. Next slide. A 10-year-old boy, he has good communication and social skills, good self-care, but he has problems in studies. He's able to follow what the teacher teaches orally, but he's not able to read by himself and understand that well or write well. There are a lot of spelling errors in this child's notebooks. What is this a case of? Learning disability. Okay, next slide. So they have specific learning disorders like in reading, writing, arithmetic. The child will be very good at other skills. So, you tell him, go out, play a game of football on your own. So he'll cycle on his own. He'll go up to that place. He'll play with his friends and he'll come back. He'll know how to recharge a phone. He'll know which channel, what comes. He'll know all your phone apps very well. He'll know how to call the electrician when, the light is gone from the house. He'll know all those things. Okay. But his reading, writing skills will be impaired. So usually we advise assessment in these children and training goes on after that. They have certain privileges in exams also. This is an important thing. I think if you all can get hold of this questionnaire, this is what we tell teachers to make assessment of. Okay. So it's known as Strengths and Difficulties Questionnaire or SDQ. This is how you identify in which area the child is lacking and what to focus on in each child in a classroom. Next slide. So I'll just get on with the interventions because, I feel the first part is something that I think all of you are aware of. The interventions that, we all falter. Yeah, next slide. So cognitive behavior therapy or CBT is actually, the main thing that we all use, especially in children, depending upon how psychologically or emotionally adept they are. Suppose the children are very young, okay, we do less of cognitive work, we do more of behavioral work, okay. If the child is also not psychologically very oriented, okay, they do not understand emotions very well, whatever we explain to them, that is also not understood, then again, we do more of behavioral work. But usually in adolescence, okay, where the child can cognitively correlate, they can understand, they have their thinking abilities, in those children, we usually advise that we do more of cognitive work along with behavioral work as well. Okay, so that is how we take care of the cognitive behavior therapy. The foundation of behavior therapy is very simple. Okay, so we don't say that each child, the child is totally bad or good. It is the behavior of the child, right? So we never say that you are bad. We say this behavior is bad, okay, or this behavior is good. We don't label a child good or bad because of their behaviors. So there's always a positive and a negative behavior in each child. There could be multiple positives, there could be multiple negatives. The aim of behavior therapy or CBT is just to enhance the positive behaviors and to bring down the negative behaviors slowly. And this we do by various kind of methods. So we don't take the event as such. Say, for example, a boy A has hit a boy B. We see, what has happened before that. That is the antecedent of what did boy B do to boy A. Or boy A, was he upset about, certain things that went on in his home today morning, early morning when he was leaving home? Was his auto late to school? Was he scolded by the teacher today? Okay. And hence he was all disturbed. And in that frustration, some boy B comes and hits him slightly, because of which boy A falls down and he gets the boy B badly. Okay. So there's so many antecedents to that one particular behavior. Don't look at that one event as such. Look at all the events that have gone on in this child's, maybe even a week before. We don't know if he's being troubled by something even gone on for 1 week or 1 month before. So there are events leading up to that behavior. And then there are consequences of it. That is what the event causes. So after hitting that child, he's called to the principal's office, he's punished. The unfortunate part is that, when you all call children for some kind of event that takes place, it's announced on mics in the schools. Okay, so and so come to the principal's office. Now, children already know that, something has gone wrong in the school that day. He's going to get scolded today. So, a lot of gossip that goes on behind over there. And when he enters the classroom again, a few people, who are actually concerned will just leave him. There are a few who want to know what gossip went on in the principal's office. Then they'll go surround and find out more and, instigate the child more. So let us start doing it in a more confidential manner. Let us stop announcing these things on mics. Not even in the classroom saying that, so and so you're being called to the principal's office. Just very quietly, as if, it's just a day's work, something is going on, and not make it known to other people. Okay, so there are a lot of consequences to that because, the parents will also be called, and maybe even worse of consequences like being suspended from school. So a functional analysis or assessment is done in which all these variables also which are maintaining the behavior are identified. So if the child comes from a background or from a home where aggression is being used as a common modality to solve these problems, the child has learned that. Okay. Sometimes the parents will say, oh, very good, you gave him back. No, this is what I want my son to be. Okay. So there are many variables that actually continue the behavior. And then there are children who come from those backgrounds wherein they are taught that, you should not raise your voice. Come what may. Okay, you should always remain quiet. Just remain quiet and just follow whatever you're being told. Okay. These children become completely submissive. So if anything is happening to them, they don't even stand up for themselves. So that total submissiveness is also not, to be entertained, and total aggression is also not to be entertained. Let's make them assertive or firm. Okay. And assertiveness is nothing but telling them, okay, teaching them, in fact, that you have to express what your feelings are at that particular point of time without hurting the other person or without blaming the other person. The latter part is more important, okay? Without hurting or without blaming the other person. So, okay, something like, okay, ma'am, I was walking down the corridor and I just felt I was being pushed, and I saw he was standing behind me and he started laughing and it made me feel upset. Okay. So you're talking more about your emotions at that point of time and why those emotions occurred, but not saying that he pushed me. Okay. So teach children, a kind of assertiveness or being firm, standing up for themselves. Then there's reinforcement to increase their behaviors. Token economy, this is generally done with younger children. Adolescents also, it works out sometimes. It doesn't many times. Behavior with tokens. Okay, so suppose there's a child who's being taught to say please and thank you. Okay, simple things like this. So when I, as a teacher, notice I want to sit next to you. Okay, or please could I keep my bag here? Saying that please word itself, say that I'll give you 1 point for it. Okay, someone does a nice thing to that person. Okay, he thanks him. So saying that thank you, he earns 1 point for it. And then say that, after you earned 20 points together, I'll get you a chocolate. So that is token economy. Now, all these things have to be spoken to the child beforehand because there are many things that, we take away also. When they are not behaving in a proper manner, we take away. And when you suddenly take away these tokens, they suddenly become very low or very aggressive, or they want to just give up on this token economy system. So we'll tell them that, okay, we'll give you a point for each good behavior. But for each, defined bad behavior, defined means you have to define the bad behaviors and the good behaviors first. So for each defined bad behavior, I'll take away that 1 point also. Okay. So all these things have to be done before you start with the behavioral intervention. Otherwise, suddenly you say that I'll give you 1 point, I'll take away 1 point. The child is clueless about what is happening in his life. Then there's differential reinforcement of other behavior, in which reinforcing appropriate behaviors we do while ignoring the bad behaviors or the negative behaviors. Now, when I say ignoring means actually ignoring. It doesn't mean that, the child is being disruptive in the classroom over there and you're still looking at him, you're doing this. Either verbally or non-verbally also, you're actually giving attention to the child. and the child is doing it for that attention only. So when you are actually providing, even in that non-verbal cue, you're giving attention to the child, what is the point then? So let us not give, ignoring means total ignoring. And it's very difficult as adults, try it out in your classrooms. I think ignoring is a very, very difficult task for us to do. Okay. Whether it comes to our own children also, it becomes very difficult. Okay. So, but ignoring really means total ignoring. It doesn't mean that even responding by some way in a non-verbal cue, you should not respond. Then there's shaping. So you gradually reinforce the gradual approximates of the behavior. Now, suppose there's a child with LD. So we say that, okay, today you'll write down 2 sentences. And the day you start writing down 2 sentences without any error in spelling, I will give you 1 point. Okay. Then you slowly increase it. Okay. So for the past 1 week, you've written 2 sentences. Every day you've earned a point. Now we'll make it 4 or 5 sentences. So in the middle, the child knows that the child may make mistakes and she may not get, that point. But later on, once she achieves that 4 or 5 sentences also, she is going to get points for that 4 or 5 sentences. So that is gradual shaping of the behavior. Next slide. Then there is overcorrection. Suppose the child is very disruptive in the classroom. He goes around throwing, pencil boxes of other children or his own place. He starts disrupting things. And you know that, you've tried to make him do, cleaning up and all that process for a very long time. And still the child is not understanding. We call something which is known as overcorrection, in which not only what he has disrupted over there, okay, he has to go and clean some other part of the classroom as well. Okay. So, but this again should be talked to or told to the child beforehand. If we suddenly give him that task, the child is not going to comply. Okay. So say that next time you do this, you have to take care of this. Plus, you have to clean the cupboard in which notebooks are lying, or you have to clean that cupboard in which the tiffin or the lunch boxes are lying. So the child knows it already. So slowly, he'll realize that, oh, not alone this, I have to go around correcting all those things. Why spill over something? Let me mind my own business. Then there's response cost, in which we remove the previously earned reinforcers as a consequence of negative behavior. So like I said, in token economy, when you're giving that point, also have that thing that, okay, if I see this particular bad behavior, please define it. Remember, define the negative and the positive behaviors. You can't be, impromptu telling that this is good and this is bad. Okay, it should always be defined. Then there's timeout. This removing all sources of reinforcement for a period of time. We tell mothers in home to do it, okay? And the best place that they find to do is, probably putting them in the washroom. The child is happy over there because he's playing with all the water. So you have to put the child in a place where actually there is no entertainment for the child and the child actually gets bored, okay? So in your classroom, probably, just facing the wall and sitting on a bench or a chair. Just make him sit over there so that he can't look back and yeah. So there's no source of entertainment. There's no source of interaction for the child with other children or gaining any kind of entertainment. Then there's extinction to decrease the behavior. That is removing previously available reinforcement for an appropriate behavior to decrease the probability that the behavior may occur. So over time, what we do is we say that, okay, we are going to keep removing the reinforcement, whatever we've been given. Okay. Also, you can change the reinforcement. So initially, like probably you had chocolate as a reinforcer. Later on, slowly you can make it a verbal reinforcement. Okay. So slowly, when the child gets adapted to these things, okay, the shaping of the behavior usually takes place. Now, remember, the shaping takes several months' time. It's not something that's going to take place in one day. It's not a paracetamol tablet that we give for fever, and the next day the child is going to be okay. Expect it to go up and down. Okay, especially initially when you're trying to change things in the child will be wanting to do again the same thing and trying to prove to you that you are going to be wrong or you have to give up or I will not listen to you. Okay, so they know it that the instance I start misbehaving again, the earlier pattern is going to be followed by my parents or teachers. So be very, very persistent, be consistent, but remember to continue doing it. Then there are behavioral experiments that we follow, especially in cases like social phobia or panic disorder. In panic disorder, we tell children that whatever panic comes at that point of time, nothing is going to happen to you. Okay, nothing threatening is going to happen to you. So go through it. I'll be sitting by your side. You don't have to rub hands or anything. Just hold the hand of the child slightly and say that I'm there with you. Nothing will happen to you. So slowly the child gets that confidence that, okay, in spite of the panic, in spite of whatever, I'm feeling so threatened at this time that my life is going to go away. I am coming out of this. And this is how the child learns over time. Also social phobia. Okay. So expose that child not directly to go to the assembly. Okay. So start saying that in a group of 2, okay, come and say something in front of the classroom, or in a group of 4, okay, you stand behind and you sing. So small things like this make it a graded exposure. Don't suddenly try to expose the child to a situation that you want him to achieve. Okay, do it in a gradual manner. Next slide. Then we have, many relaxation techniques like breathing techniques, or Jacobson's progressive muscular relaxation, or even mindfulness these days. Next slide. Exposure techniques are used in children who have these phobias and OCD and panic disorder. So in phobia, we expose them to whatever thing that they are afraid of. So if it's heights, again, we expose them gradually. So it's not that we take them to the 4th floor of the building directly. We make them, go up to the 1st floor, look down for about a week or 10 days till the fear totally goes away. Then take them to the 2nd floor. Again, do that for a process of a week or 10 days, then 3rd, and then 4th. Okay. So it should be done in a very, very gradual manner, not suddenly. And just don't think that one day the child is saying that he's fine. You can take him directly to the 2nd floor. Okay. Let him keep exposing himself to the 1st floor and then gradually up to the back. Yeah. OCD is one thing in which, it's a very distressing disorder. Imagine, that, what you're doing is wrong, but still you're not able to give it up. So that, touching this table 3 times is not going to make any difference in my life, but that thought is coming. Do, touch it 3 times. Going out to the door, then have I done it properly or not? Let me go again and do it. 1, 2, 3. Okay. It's very distressing. I know in my head, I don't need to do it. I'm doing something absolutely illogical, but I'm a child. How do I explain it to anyone? Such an abnormal thing is happening to me in my head. What do I tell others? Will they laugh at me? Will they call me a cuckoo? Okay. And these are the reasons why these children of distress or don't report of their problems. But we see that happening. So what we tell them is that those recurrent thoughts will keep coming. You don't go and do the compulsion. So the thought is the obsession, okay, which keeps coming and hitting you. And what you go and do, touch that thing, okay, or you say in your mind, thank you, God, or sorry, God, or whatever, is a compulsion. The compulsion is done to reduce that thought. I'm telling you not to do the compulsion at all. What will happen initially? He'll say, no, my thoughts will increase. I can't stay like that. I will say, yes, I know the thoughts will increase, but will the thought do anything to you? He also knows that the thought will not do anything. Slowly, we start exposing them to the situation and preventing them from doing the compulsion repeatedly. Okay. So that again takes a very long time. It is done in a graded manner and very, very slowly. Next slide. The changes that we expect from a family when we are taking up children for therapy are multiple. Okay. We have to speak individually to the family members because and together as well. Because when we speak to them individually, there are many things that we come to know from the family. And why we have to speak to them as a group is because we come to know about the family dynamics, about who's the decision maker, whom do the family members look at and say that, okay, we'll follow whatever you're saying. So all the family dynamics we come to know when we are taking a closed session or the session together. Please don't sound authoritarian. So if there's a change in behavior of the child, saying that, what your child has done, is it right or wrong? Okay. Now, when we're already saying right or wrong, we're not inviting explanations for the behavior. We are just saying, is it right or wrong? So instead of that, just say that, have an open-ended questioning and say that your child is found to be behaving like this. What do you think about it? Or what explanations do you have about it? And again, don't sound authoritarian. So let them know that, I'm here to help you out with the child's behavior. I'm not here to punish the child, or I'm not here to, pull you down, or, say that you've been having a bad parenting. speak with firmness and specifically about the changes that are required by the family. Now, what we say is, the child may come and say that, my parents don't care for me or my parents don't love me. What is it that, love and care means to that child is very important. Also, at the same time, when you talk to the parents, if you say, please start loving your child, please start taking care of your child, what will the parents say? What are you telling me? I already take care of the child. I already love my child. Who are you to tell me? Right? So there is a problem in the expectation and the supply of that love and care. That is all. Okay. Every parent probably, loves their own child and takes care of them the way they wish to. The child is not perceiving it. So there's a discrepancy between the two. You need to find where the discrepancy lies and work on that instead of talking about, you need to do this. You have brought up your children in a particular manner. That's fine. It has worked out for your family. It may not work out for their family. Find out what dynamics are there in that family. Address that as a therapist. Give specific home-based tasks. Okay, so again, give them small tasks for each week. Follow it up and then review where they've gone wrong. Why, what was the difficulty in following the task? Yeah. So, like I said, academics, you all do beautifully. I think as this generation, all of us, not alone teachers, I think as parents, as society, we have to teach them about lessons of life. Next slide. Now, a lot is being talked about emotional quotient these days, right? And we all are aware that, there are, when we look at a class, we know that, okay. But if I give him a task, this guy will execute and get it done, right? So we know the difference between IQ and because we know that, toppers aren't always the most popular kids in class, right? Okay, they may not be liked also, in fact, sometimes by other children. And toppers may not always be at top in their professional ladder as well. So it's not for sure that, a person who's getting the gold medal from your institute is going to be at the topmost position 10 years or 20 years down the line. So why is that? Okay, because there's something which is lacking in them, and that is the emotional quotient. So EQ is the ability to understand and manage your emotions as well as recognize and influence the emotions of those around you. Okay, so I am getting angry because this person is talking aggressively to me. Okay, recognizing that first, and also recognizing and addressing why the other person is getting angry. Let me modify his anger also so that he calms down and I can make the situation better right now for us. Okay, so that is a very, very important aspect that, all of us have to recognize. Maybe even we may be lacking sometimes in it. So there are 5 categories of emotional intelligence. Next slide. Can I continue? If there's any repetition, please let me know. Okay. Yeah. So the first thing is about self-awareness, right? That's the ability to recognize and understand one's own emotions. Recognize the impact of those emotions on others around you. Okay. So today morning, mother makes uppit. The child does not like that upma or uppit. Okay. Immediately one disgusting face makes. Okay. Instead of that, teach the child saying that, Mom, I don't like to have uppit. The day you're making it, can you give me bread and jam only? I would prefer to have that. Okay. Easier for the mother, easier for the child. Okay. That early morning, mother's mood is also not spoiled. She also has to go for work. The child's mood is also okay because the mother doesn't shout at him that I am working day in and day out. You are not, appreciating what I do for you people, and all that lecture will go on. So no one else. So I think teaching that skill to a child at a very young age is very important, because they know then, how to put my point of view across to the other person without, creating some kind of negative emotions in the other person. So self-awareness is not alone how you are feeling, it's also how to react in that situation so that, you can recognize and you can know the impact of your emotions on the other person. The second is self-regulation, ability to manage one's negative emotions. Okay. Now, many of us know, we'll say, oh, don't get angry, don't cry. How many of you know Bharatnatyam? All of us know. We know the Navrasas. We know all the emotions in life. Emotions are actually protective. Okay. So we can't say that emotions are good or bad. Okay. They are life saving things for us. If we were not to get anxious in front of a lion and run, we would be attacked by the lion and we would be killed at that time. Right. So emotions are always, they are all having some kind of life skill behind it. Okay. So some life saving effort has gone on for, the Lord to give us those emotions. So when we say don't get angry, are we right in telling the child not to get angry? Anger is an emotion. We should tell them how to process it and how to express it rather than telling them don't cry, don't get angry. Okay. So this is self-regulation is just an ability to manage one's negative emotion, teaching them that, okay, anger is not a bad emotion, but when it's coming, recognize why it is coming and express it correctly. Okay. So, you know what? You pushed me quite badly. I have gotten hurt. I don't know whether you did it by mistake or not, but I really don't appreciate it. Okay. Just telling that and stopping at that. If the child were to be shouting at another child, okay, that would create more of consequences for this child A rather than sorting out the problem. Okay, it would create a lot of ill will. Gangs start off in classrooms. Okay, my gang person was hit by my gang. All those things start off. Minimize it as much as possible. Adapt well to changes in circumstances. This is something that the younger lot is not learning, right? I think we as parents are also accountable for it because we tend to give in to all their demands, whatever they wish to do. Sometimes saying a no to a child is also important, and it's fine to say a no. The way the no should be said, I think that is again important from the parents or from the elder point of view. Okay, so the child is demanding a bat which his classmates have got, and he goes. The father just shouts, "Why? Just last week only I bought you one new bag. No, now you're coming asking for one bat. What is wrong with you?" Okay, explaining to the child that okay, we can provide you with it, but give us some time, or we cannot provide you with it because it's out of our budget. Okay, explaining to him your economic background also is important. It's fine to let him know at that young age also that what you can provide for and what you cannot provide. Okay, so say that I wish I could do it for you. I mean, I really care for you. Can I get you some other bat probably by next month? My salary would have come, and maybe I can't afford this one because it's quite expensive, but I'll get you something else. So the way it is said to the other child, to your child, is very, very important rather than just shouting or being offensive at them. So make them adapt well to changes by saying a no occasionally to them, by letting them know that you may not get everything in life. Okay, everything that you crave for or that you strive for is not there at a platter. Sometimes you have to, because see, up till school level, I noticed that even up till 12th, I noticed that children are they know that I have to study, I get what I want. And this is like people who are very high achievers as well. Okay, so they get, okay, they somehow they manage to get that, like I said, those Fahrenheit scores of 100 and 99 and 98. When they go into the college situation, they don't alone have to deal with academics. They have to deal with a lot of interpersonal relations. They have to deal with where my food is going to come, where the mess is, okay, where my laundry is going to go, or I have to go to the town to buy this for myself. Next, they go up to a level wherein they're in a job where they are working in a team of say 100 or 200 people, and they're dependent on others for their job. So they do their bit, but the other person hasn't done their bit, and hence their work is getting delayed. How to express to that person that please do it fast because I have finished my work. We need to submit it in time. So it's not alone that getting those good marks till class 12 is enough for the child to survive in life. Okay, it's very important for us to teach them how to adapt well to circumstances, okay, to do things. So once in a way, getting less marks is also okay for them. Teach them that as well. There are children who come to me who don't want to go and give an exam because they're afraid that they will not get 100 out of 100. I mean, I know this child who's gone into her dental college now, and she's refusing to go and give her exams. She's still stuck at her first semester for the past 2 years because she has that concept from class 12 that, I've always been a topper. Here, what if I can't be the topper? Okay. I mean, wasting 2 years of your life in just thinking that, I don't know where these children are going. The self-regulation helps in managing conflict, and these children are more likely to take up good amount of responsibilities in life. So managing their family also tomorrow, they get a bad wife, they get children who are really demanding, they get a husband who's coming back drunk home. Okay, everything they can manage in a beautiful manner. They can stand up for themselves, okay, for their own selves, and they can say no to certain things, and saying that this much is permissible, beyond this is not permissible. Okay, so all those things they manage very well. Next slide. The other point about EQ is motivation, the ability to self-motivate. Why should there be always an external agent to be motivating you? Why should there be always a teacher or a parent or someone telling you, do this, come on, go ahead, we are there. There should be some amount of self-motivation. That self-motivation is important because again, you're not comparing yourself to too many people, so you don't get bogged down by who's achieving what. You're achieving with your own, you're comparing yourselves with your previous achievements, and you want to motivate yourself to go further in life. So self-motivation should be taught to children right from a very, very young age. So instead of comparing them in classrooms to, oh, look, you're getting only this much came, okay, where you are going wrong. Last time you got this much, this time your grades have fallen down. Where is it that you're finding that difficulty? Or from the last time, you climbed up these many marks. Very good. Okay, next time let's see you doing this much. Okay, so always have that self comparison rather than making him compare to external things. And these individuals also have a tendency to be more committed and goal focused because they don't get diverted by what is happening in the external environment. They depend on themselves. Next slide. Empathy is a very important tool. I think all of us should have, which is totally lacking in at least the next generation. I hope the generation after that at least has is more empathetic. And empathy is nothing but the ability to recognize and understand how others are feeling. Now, there's a difference between empathy and sympathy. Okay, so something has gone wrong in the other person's life. You start crying with that other person is sympathy. That is not empathy. Empathy is just recognizing, okay, this person is feeling this way. How can I help him out, or how can I console him, or how can I comfort the person in this? So consider those feelings before responding in social situations. Responding thoughtfully and kindly, okay, is important in empathy, and it helps one understand the dynamics that influence relationships. So they ultimately, tend to have stronger relationships, not alone with their friends, but with their family members, with their spouses, with their children later on in life. Next slide. Social skills was the other factor in EQ. That is ability to manage others' emotions and using this to build rapport and connect with people. So you see a person who's feeling low, going up to that person and saying that, hey, you're looking low today. What happened? Do you want to talk about it? Just a simple sentence like this would actually brighten up the other person's day, that, I have some support. I have someone who is ready to listen to me and whom I can, talk to easily. Active listening should be involved in it. Okay, active listening is not that okay, you're looking on the phone and you're doing the other person is talking. Having eye to eye contact, okay, appropriately nodding, looking at the person, okay, saying a yes or no, paraphrasing what the person is saying that, okay, you must have been quite troubled at that time, I can understand. Okay, or saying something like, okay, yeah, I totally feel for you, I have gone through the same. And it helps in forming and again maintaining long-term relationships. Next slide. So how to improve the EQ? Notice your response to others. So the child should be taught that, whenever you are responding. So these days, in fact, we tell them that, you can even record yourself, video record yourself. Okay. and see how you are actually interacting with other people and see how you can make changes. Imagine if you are in the other person's shoes and if someone were to be talking to you like this, what changes would you want the other person to do in his conversation with you? Okay. So that is how you teach the other person how to bring about those changes in expressions, language, and in tone, uh, and how to respond to others. So this could help modify the behavior of the child. There's positive language like communicating using the right words and method. Okay, saying that, look, I want this thing to be done. Go ahead and do it, or please do it. Okay. Now that please do it doesn't sound very pleasing enough. Using the right tone also should be inculcated in the way they start talking. Keep going is one very, very important factor in social skills. It's realizing that all of us have temporary setbacks. Look for changes in direction and keep going. Okay. So I see this generation, because like our generation has provided them with everything. So one setback and they think, I'm totally down and out. Telling them this is a part of life. You can't go away, like please quote Rabindranath Tagore's poem if you all want to. Saying that, God, I'm not asking you not to give me troubles, but give me the strength to face those troubles. So I can always tell the junior population, I tell them that you have to choose your struggles in life. Struggles are going to be part, okay? Let us choose them wisely because we don't know, what is going to come. So I have to anticipate that in future, this is going to go wrong. In future, to safeguard myself, I can do this, yet I may face the struggle. So which struggle am I ready to face in future? Let me decide that and work towards it rather than saying that, oh, this problem has come, I can't face life. Okay. So choosing your struggles is very, very important. Show compassion, practice kindness and empathy is very important because when you are kind to others, when you help out others, it becomes easy for you to ask for help, which is a very important factor in mental health. Okay. Most of the people suffer because they don't ask for help. They think that, it's below my dignity, or what will others think? What will they presume? What will they talk about me? Asking for help can have helped other people. So if you helped others, you feel, I have the right to go and ask others for help. It's okay, right? So it makes you more open to ask for help. So how to achieve this mental well-being? Creating positive classroom environment of cooperation over competition. Okay. So do not compare, do not highlight those children who are academically doing very well. Highlight them for their behaviors. Okay. So if the child is also well behaved, okay, highlight again for the behavior of the child rather than the marks that the child is scoring. Fostering self-esteem and agency like realistic expectations. Okay. So, many children who have, who are not doing too well in class, they are given, unrealistic expectations by parents or by, their family members that, you have to score a 95. This child is unable to. Okay. So let us have some kind of realistic expectations also set for them. Praise for their good behavior. Focus on their strengths rather than going on talking about the negatives. Teach them communication. I'll talk about social, cognitive, and emotional skills in a while. Anti-bullying programs also should be there in place. Many children refuse to go to school because of that. I mean, even in class 11 and 12, believe me, even if they've studied in the same school right from class 1, there are children who come to me who say that, I'm being bullied at school. So it's not that, a new child only will be bullied or, a new child to a new environment, but they are the older children also who are being bullied. Sensitizing students about mental health issues, how to identify it and how to seek help. Like I said, open your mouth, seek help for any mental health issues. Digital literacy is one thing. I believe you all have had a session on digital addiction yesterday. Yeah. So see, when we give 1 rupee coin also to a child when he is, 6 years old, we tell them, oh, you will get 2 chocolates out of this, or 2 chocolates. These days, 1 chocolate only. So you will get 1 chocolate out of this 1 rupee. So if I give you 10 rupees, how many chocolates and all that we teach them? Big thing, right? Before giving them even a single pie in their hand. And here we give them a phone in their hand without telling them the pros and cons about the phone. I mean, how much of a dangerous situation we are leading the child into? Okay, they go and they get into all sorts of problems related to being bullied. Uh, all of it. Okay, so money gone sometimes. Sometimes photoshopped nude pictures are put across, and all those things are put across on the phone because of this reason. So let them know that there are the advantages, there are disadvantages as well. Don't give them the phone directly like that. Okay, have a time limit. Up till class 12, at least, I would really suggest this to continue. Beyond 12, we don't have control. Okay, so I mean, at least till class 12, try to keep the time limit on. At home, if you all have laptops, tell parents to encourage them to put it in a place so that the laptop screen is facing the rest of the family, and not encourage them to go to a particular room and do their studies over there. So put it in a dining area or somewhere where the child is, child's back is towards you, but the laptop screen is towards everyone else in the family. Okay. So these very, very few things that you can, tell your parents to modify and change will bring about a definite positive change. Also, giving them the phone sometimes because, oh, the child is crying, oh, he's not listening. Obviously, when you've given it to him for so many days, now he's not going to listen to you. So right from day one, when you're giving the phone in hand, say that this phone is in my name. I'm giving it to you because, I feel okay. You need to use it for certain things, either for entertainment or for game or whatever. But I'll give it to you for 45 minutes a day or an hour a day. You can divide it and take it, or you take it at a stretch. It's up to you. And during exam time, I may take it away totally. Okay. So all those rules, have it before giving the phone in their hands. Next slide. Academic difficulties, like people who are slow learners or who have LDs, they may require extra hours after class. Small group teaching helps out, these individuals. Psychoeducation of parents is very important, especially in case of learning disabilities. They think that, oh, the child is so smart enough. He's just being lazy because he doesn't want to study. Explain to them that this is a problem in the brain. So that area of the brain which requires mathematical skills is not working in this child. And when we are pushing him, obviously he's trying very hard, but he's losing all the more interest because we keep saying that you're lazy, you're not working hard. So all the more he starts hating that particular thing like mathematics. So how do you expect the child to change? So let him know that, okay, you do whatever. Scale down the expectations of the parents at that time. So let them know that probably your child may not be a great academic achiever, but then everyone doesn't have to be a great academic achiever to achieve something in life. Let's see, by the child's education goes, what he can achieve. Next slide. About emotional problems, increasing awareness about mental health among students is very important. No one wants to talk about it in schools. I do believe now they have started off, but a few years back, even we as psychiatrists, we were considered to be, as if socially unacceptable in schools, coming and talking about it as if everyone would get a psychiatric disorder. So, I mean, have, more talks arranged in your school so that people come to know that, okay, this is what the difficulty that I'm going through. Have discussions in the classroom about it. Okay. So just give them any artificial event that, okay, if this happens, what will you all do? Ask them for their responses. Okay. Or if you're feeling low, whom will you go and talk to? Okay. Things like that. Give them those things to have discussions. You can even screen films that have a basis on mental health disorders. Because like I always say, we have to remove stigma of mental illness. And if we don't start it at that age, okay, that's going to be very difficult when they reach our age. So no one chooses that I need to be ill because of a physical, ailment or a mental ailment. Mental ailment also just comes like, any person has a physical ailment. He or she is not to be blamed for it. Okay. All those things should be taught right from childhood. Discuss the problem if the child is having some kind of an emotional problem or even a hyperactive child. Discuss the problem with the student alone. Okay. Again, without announcing it on the mic. Keep it as confidential as possible. Don't go around talking to other teachers also about it, because other teacher may know some parent, who the parent may know some the child's parent. It may again go like Chinese whisper. Okay, be very careful about it. problem solving techniques should be taught. Okay, so problem solving is nothing. You just expose them to a situation and ask them to brainstorm about the number of solutions that they can generate by themselves. Okay, so then ask them that, okay, in this solution, what are the pros and cons? Ask everyone again to brainstorm in that solution. So make it a very, very live kind of an interaction with children and give them examples which happen in day-to-day lives, okay, about problem solving. So then discuss the pros and cons of that particular situation, discuss pros and cons of all other situations, and ask them, okay, so now we'll take up this situation and we'll go around and solve the problem like this. Now we are stuck at this stage. What do we do then? Okay, so in reality, you're actually discussing those problems, you're generating solutions from the children, you're not giving them solutions. Okay, for any problem, there's no quick fix solution, there's no fit enough solution for anyone, even for us in life. What happens in one person's life may not happen in my life, and vice versa. So who are we to give solutions to someone? They should be generated from these children and let them know that you may fail. So telling them that, okay, we are getting stuck again over here. What do we do then? Okay, should we go back and follow the other solution? Okay, and in every situation, there is going to be a positive and a negative. Accept it. So we'll try to find out where there is more positive, less negative, and try to follow that solution slowly. That is how you teach them problem solving skills in a classroom situation. Also, if a child has come to you, please check for death wish or suicidal ideas. If the child is reporting of low mood and saying that he or she is not doing very well, because if that is reported, please speak to the parents directly and ask them to take mental health professionals' help. We cannot ignore it. Just thinking that, oh, the child is manipulating us or the child is just threatening us is not the right way to understand it, because many attempts happen after the child or even an adult has expressed their suicidal wish. Next slide. Behavioral problems, I've talked about it already, the positive or the desirable behaviors, the undesirable behaviors. The desirable behaviors can be reinforced with verbal praise or with stars. Undesirable ones like timeout, taking away privileges. Playtime is one thing that, all the school children really cherish. So you can use that as a levi and, take it away whenever their negative behaviors are increasing. Don't shame them. That is one thing. Talk that, your behavior was not all right. Don't say that, what are you thinking? You are like this, you are like that. Okay. So always talk about the behavior and not the person. Also discuss how to improve the child's behavior and not alone talk about his undesired behavior. So don't keep talking, you did this, you did that. That is done. Talk about how next, if a situation like this arises, what can the child do or how should he react? Bullying, like I said, is very common in schools, and we come across, cases like this, and usually school refusal happens in these children. In boys, it's like in the form of hitting and beating and all. In girls, it's through words, and now the latest is through your phones. Okay. It's a very common cause, like I said, of school refusal. There should be zero tolerance policy of any school towards bullying. And this should be reiterated every time. Okay, whether or not any bullying has taken place in school, keep it in your school calendar that every 2 months I have to, or every month beginning, I have to remind the children in the assembly that, no bullying is acceptable. We have zero tolerance policy. So that it keeps repeating in their mind. I mean, in adults, we all know about the POSH law. Okay, why do we train individuals in POSH? Okay, we tell them about sexual inappropriate gestures. Why? We have to keep reminding them that this is not acceptable. So bullying is not acceptable, has to be reminded to these children. Playgrounds and other common areas should be well supervised, and systems of reporting bullying should be also, kept as an anonymous box. But let them know that, this is like a bullying box and, a drop box wherein you can put your complaints, but you have to mention your name. Unless you mention your name, we'll not be able to take any action. Okay. So have it known to the children that there'll be a drop box available. While coming, you can just drop in your complaint. The bully should be talked to in private without, again, humiliation. Okay, listen to his side of the story also. Okay, it's not always that, the other person who's reporting may always be right. And the bully should be asked how to modify his behavior, then again by the problem solving skills. Sexuality, relationships is something that, we come across now very rampantly. And they say that, what is wrong about it? Yes, as adolescents, they have sexual curiosity, and it's absolutely right. The way it is being addressed, either by them or by us, is where we are going wrong. So I know CBSE has started, sex education now in classes, and which is a very, very welcome step. Let us not, make the child feel guilty about, being curious about sexual education. Everyone has their limit of curiosity, and everyone satisfies it in a different manner. So you talking to them, or some elder person whom he trusts, talking to that child is very important, because then he'll go to all the internet sites and then gain information which may not be, totally right. So let us try to give them the right kind of information, rather than encouraging them, or shouting at them and then encouraging them to go to various internet sites and getting the information. Now, gender identity and gender role, sexual orientation has become a big problem these days. So, because they want to feel that, they are one among the others. So this new thing of, I am they, or I don't belong to a male or a female gender, I belong to the other gender. Again, nothing wrong in it, but they don't realize what it is. Okay, sometimes just to be acceptable in the society, because the younger generation is talking so much about it, and they say that, okay, we support it and everything else. The child wants to be included in the group, and they start saying that, I want to identify in the LGBTQ community, without even realizing whether the child actually identifies or not. So let them know that gender also at this juncture has a fluid kind of a role. You don't know which gender do you belong to till you're a little more grown up. So give yourself some time, and if really you belong to the LGBTQ community, I mean, there's nothing wrong in it. Okay, don't shame the child. It is another gender, and we all have to accept it. Our generation people are taking very long to accept it, but please, I think someday or the other, I think all of us have to accept it and just let go. Menstrual hygiene for girls should be taught also in schools. Uh, do not make moral judgments, especially when about sexual curiosity or gender identity. Be supportive to the child, whatever come may. Okay, so that the child is then, he knows that I can speak to this person openly, whatever queries that I have or whatever doubts I have in my mind, rather than hiding it again and going to the wrong kind of sources to gain information. Next slide. Adaptive and positive behavior should be taught. Next slide. I'll just yeah. Sorry, the previous one. So I'll just talk about the cognitive skills. No. Brainstorming, I have already spoken about. Role play can be done with them. Okay, so give them a real life situation and tell them that, okay, you're boy A, you're boy B. And the best thing that I would suggest is, the aggressive boy should be put in a submissive role. Okay, and vice versa. To teach, how what is going on in the other person's mind. They'll realize it better. So give them real life, role play situations in the classroom. Let them see, where I'm standing, where I can go right or where I can go wrong. Make multiple people do it, and then ask in the classroom, which response did you like the best, or which do you think is a more appropriate response. Add your own comments about it. Okay, you can do that. A lot of games about life skills can be taught, again, about problem solving. A lot of it can be done. You can have, debates. You can show them video clips about certain problem solving. Next slide. So in social skills, they should be taught effective communication. Like I talked about the assertiveness, interpersonal relationships, how we talked about in emotional quotient, empathy, and self-awareness. Next slide. Cognitive skills, we should talk about problem solving, decision making. A few children are very poor at decision making. They know what I need to do, but they will not do it. Okay, they are afraid. Probably, they've been brought up that way in the family. They are not encouraged to take up decisions. Creative thinking, again, giving them problems and telling them to solve it in different manners. And critical thinking. Next. Coping with stress is a life lesson that all children need to live, because learn, because let them know that they are going to deal with stress. There's not going to be a life without stress. I see these days children, coming and complaining, oh, I had a full day class. I feel so stressed and feel so tired. It's as if, they're doing something new and something amazing. Let them know that this is a part of life. And this is not something that, we have to complain about. Yes, you can complain about it once in a way, but it shouldn't be a daily cribbing as if they are doing a favor on society. And coping with emotions, like I talked about in EQ. Next. I'll give you an example and then I'll end my talk. Like in a classroom situation, you can introduce anger as an emotion. Okay. Give this example of a situation wherein boy A is eating his favorite snack, which his mother has packed that day. And boy B, he comes and snatches it away from him. And he eats a bite, or he doesn't eat also, but while returning it, the leftover snack, he drops it by mistake. And, there's all sand on that snack now. The boy A cannot eat it. So give them a situation like this. Okay. Then ask them to express, their own responses. Discuss the consequence of each response, what is good, what is bad about it, and then discuss about the best possible response in that case. So in any classroom situation, you can come up with these ideas and make them role play and do it, or just ask them their own responses. Usually what happens is that we see the quieter children, they don't want to participate in these discussions. You can even give them the option of writing it and giving you their responses. Next slide. So in conclusion, I would like to say that childhood disorders are very common, but they are often not diagnosed timely due to various reasons. Teachers, with the help of mental health professionals, can help these children get timely help. There are few psychological issues which can be addressed by increasing resilience in children. Since we know that academics alone does not help us survive in real life situation, and that's where our EQ lies. Is it not imperative for us as a society to impart these life skills to children and do something about it in the curriculum itself? Thank you. Thank you so much. I hope I've not exceeded time, sir. No? Are there any, is there a Q&A session?
1 hour and 15 minutes, Madam has provided us an ocean of information and knowledge. I think others would have taken 4 sessions, Madam. Is it not? Last year also we have experienced, but what to do? Madam will have only this much time to spare with us because her patients will be waiting there in Apollo Hospital. Now it is the session is open for you people. You can cite your own examples and what.
Thank you very much, ma'am, for your enlightening presentation. I was associating every sentence of you with one of my students there. Probably I am not a psychiatrist or psychologist. I might not have dealt with it in the way you deal. I would like to quote a few of them, ma'am, like this convincing the parents about an identified learning disorder. We find it very difficult. The parent is not ready to accept. Even if you tell them with the kind of knowledge that we have, the parent is not ready to accept it. He may say that in the previous school, the boy was able to write up to 100 with spellings, and after coming to your school only, he has become like this. How to go ahead about like to convince them regarding the learning disorder the children are facing?
So the easiest thing that you can do, okay, one is like talking about it, and the second thing is the assessment. Refer them for assessment. The assessment itself will tell them. Okay, it's a very easy way to tell them. See, no parent wants to accept, and especially for a child who's intelligent enough in other things, they'll just say that he's being lazy. Now, so how I explain to them, okay, I mean, besides the assessment bit also, I explain to them saying that this is a certain disorder which happens because of the developmental problem in the brain itself. And it has nothing to do with you not teaching or the teachers not teaching or anything else happening around him. But the child, in spite of the fact that he's very intelligent in other spheres of life, he can manage his life well, he can do this, do that, whatever examples you give, but he probably lacks the analysis to, how to spell certain kind of words or write things fast compared to other children. Now, you must have noticed that, as a child, when he was growing up, he was okay. But you're noticing this only in the past 2 or 3 years because initially the difficulty of education is not that much, and hence the child could cope with his intelligence. So I'm not saying that the child is not intelligent. Again, keep reinforcing that. But at the same time, he's having some kind of deficit in some kind of circuits in the brain, which is not helping him to write fast like other children of his age group or do mathematics the way other children do. And then get the assessment done.
Probably we need a better counselors like who can tell them in the way the parent understands.
Yes.
One. Yeah, OCD also, obsessive compulsive disorder. Like I suffer from something that I would like to tell you. Like if the currency notes are not kept in a proper order in my purse, in my wallet, I feel that like even while driving also I try to do that. Is it OCD?
So is it only to do with currency? Is there something else?
There are like a few things which are not in order. Like, I want the thing to be at that particular place.
Yes.
If I don't find that at that place, I get little disturbed.
Now, I mean, with due respect to all the teachers present here in the classroom, many of you have perfectionism in your trait, in your personality itself. Okay, that comes as a way in life because you all have to deal with and make children perfection. Yes. So there's a disorder known as OCPD, which is obsessive compulsive personality disorder, and there's OCD. Obsessive compulsive personality is a personality in which the person wants to do a certain thing a certain way. I want the mic to be like this. I want it like this. I don't want it like this. Okay, but I don't feel that it's causing a lot of distress throughout the day. In OCD, it causes a lot of distress in the person. So it keeps running in the mind throughout the day. It disturbs the person from concentrating on other things in life. And socially, also things become very inappropriate at times. Sometimes it goes to the extent that the family also starts getting disturbed.
Yes.
And so in that child, the example that I gave, it's causing a lot of academic problems. So he's unable to focus on his studies because of, doing these compulsions somewhere throughout the day. So that is OCD. This is OCPD.
Yeah, I got it now. I'm sorry, I'm taking a little bit time. This autistic spectrum disorder, there is certain level to which we can manage in the schools, normal schooling. Correct. We talk about inclusivity. We cannot deny admission to any child. Oh, I came across many such instances just after Corona, basically. I don't know, I have put in around 33 years of service, but I think for the past 3 years, I'm hearing about it a lot. What could be the reason? Autistic spectrum disorder to a greater extent, like children becoming very aggressive, beating up others, that cannot be dealt with in a normal schooling system.
Right.
And the parent is not ready to listen to us and take him away and put him into a special school where he needs to be.
So yes, autism, I don't know whether it's being recognized also a little more, because earlier our society was even more, our society has always been a very lenient towards mental illness in those contexts that, okay, the poor child, he cannot do well, so let him not be sent to school at all. So initially, earlier, the children were not being sent at all. Now these children, because, parents have gained some amount of education, they want to somewhere, put them in, or they're working, so they want to be engaged also, throughout the day so that they don't have to take care of the child entirely. I do agree with the fact that we talk about inclusiveness, and it does get difficult at times when you have to, manage these children in school, because it disrupts your other school.
Remaining parents have complaints.
Yes. So I think before admitting, because you don't have the choice of refusing admission, before admitting, you can mention it to the parents that I understand that these kind of children, your child may not be having it, but we have had experiences that, certain children, they become suddenly very aggressive and it starts disrupting the entire environment. At that time, are you okay to take the child away for about a few days? Okay, get him, his treatment or, whatever medicines that are required for him, and then bring him back once he can sit in the classroom and not disrupt the rest of the classroom. That's all that you can do.
And children who are very good at studies, training them to manage their success. That is another difficult task that we face.
Yeah. So that is where the life skills is going to come in.
Yes.
letting them know that academics is not the only answer to anything in life. I mean, I've seen the best of academicians actually failing in life. I mean, otherwise, why would I get those top scorers sitting in my OPD? So those life lessons are something that I'm going on stressing out that has to be taught to children.
Feel of success actually doesn't let them know like this.
वो ऐसे कर दे रहे थे
You try to tell them.
इसमें सेटिंग में कोई
I
प्रॉब्लम
mean,
होगा
I have one case of body shaming, like a boy in class 9th who is little hefty, happened to fail once and then second time he's repeating. We allow in Kendriya Vidyalayas only second option. Once he fails now also, then he won't be allowed. And there is another clause that 75% attendance is a must in class 9. So in spite of calling the parent and giving them some notices that the boy has less attendance, he has put in around 30% of attendance, and never he mentioned about this body shaming. And neither we, like any class teacher or subject teacher, could make out. They were considering one among the other children only. Now, ultimately, when his percentage of attendance is around 35 to 40, now he says that I was subjected to body shaming. That's why I was not coming to school. You have been asking me to produce a medical certificate. I gave you a wrong reason that I was ill. Even parent also says the same thing, that he was subjected to body shaming. Now he wants to give the exam. With 35%, we cannot allow him to give the exam. If he doesn't give the exam, then he has to go out because it's the second attempt.
It's a very tricky situation.
Yes, ma'am. Yes.
I don't have solution to that. But yes, I mean, if the child were to be more, I mean, if children are more sensitized in the initial phase itself, and they have that courage that I can go and report this thing to someone at least, that I'm not feeling okay.
We do have anti-bullying committee. We keep announcing in the morning assembly that any problem, one of these committee members, you can go and express.
So when the child is not attending the class, I mean, you know that the percentage of his attendance is already short. Okay, I think at that time itself, you know, the parents have to be sensitized.
They're done, man. They come, they receive a letter, they sign that we'll send him. He was not well only, they have been telling.
So then you can tell them that, you know, you have to go to a psychiatrist or a psychologist. Get us a letter from there. Probably we can help you out, otherwise not.
Yes.
That's the only thing that you can do.
And this mobile addiction that you talked about is very popular in most of the Vidyalayas. We don't allow them to bring the mobile to the school, but at home, I came across one case where mother refused to give. My own school, where he happened to beat the mother. And that was something that is little, I mean, difficult to digest for us. For my generation, it's very difficult to digest.
Correct.
So I asked him in front of the mother only. Even then, he was not feeling sorry about what he did. I was getting irritated, and mother was crying. Father works in CRPF, protecting our border somewhere. Right. And this boy is assuming the role of a male figure at home. Right. Another sister is there, mother, sister, and this boy. So he doesn't even take a glass of water. He thinks that the water should be served to him by a lady, like mother or sister. These are certain behavioral patterns that we see, ma'am, which I don't know, like, you know, beating up a mother, some of at present generation, I could not digest that.
Absolutely.
Probably because of my authority or my voice, I had to make him kneel down and feel sorry for it, whatever he did. I don't know whether I did correct or not. He was not willing to, but because of my authority, he did it.
Correct. Yeah. Emotionally, at an emotional level, he won't have felt the remorse.
Yes.
Correct. So when we are introducing, that's what I said now. Before giving that phone in any child's hand, I think those pros and cons and those rules have to be set.
Parents have to be very careful.
I mean, you see these days that in any restaurant and all, the child is not eating, they'll switch. I mean, a 2-year-old.
Even in the aircraft or even in the trains, they give them the mobile.
Yes. So I think parents are not putting in, they don't want to put in effort.
Yes.
So they just want easy things out, and they want.
And most of the times they don't have the time. Parents have no time. I mean, both are employed.
Absolutely.
They have to meet their ends and then.
Hello.
And in the co-ed system, and the girl comes with a complaint that the boy is staring at me. And that staring has no definition. Like,
Exactly.
you're together in a co-ed system. The boy staring at me, the girl staring at a boy. How do we make out? I mean, do we take it as a complaint?
So always ask the other person also. And again, not on the mic, not making it prominent. I'm
Yes,
just
yes.
pressing on it.
Taking them into confidence.
Yes. Yes. So always ask both the sides of the story before, talking to either of them.
Yes.
We cannot take decisions or we cannot take one man's word for it.
Nice. When I ask the
every
girl,
story has a
what do you
two-sided.
mean by staring? The girl says that he's looking at me. Looking and staring is.
So even the boy should be called and, he should be talked to
asked.
separately. Yes. We don't know what he's thinking and looking and.
And we conduct this menstrual hygiene and mood swings sessions. Right. And one girl happened to hit the boy on the nose.
For what?
And for no reason, I don't know what happened between them. When I called her and asked, she said, a mood swing. I'm undergoing menstrual cycle.
No, so that should be explained to them. That
it was explained. It was done by a doctor in the session. Probably after listening to that, she did.
No, mood swings are okay. Like I explained. Okay, mood swings are fine, but how we react to those emotions is important. So that should be taught.
And always, as you said, decision making has been a problem with them. They want to depend on somebody so that if they fail, they can always blame the decision was not taken by me, by so and so. I followed it.
So that also, plus as parents, I think we also, tend to make them do what we wish to do. Make them do. And that's how they also become dependent on us all the time.
Yes. Thank you, ma'am. Thank you very much. It's really enlightening. I mean, your case studies were wonderful. We could associate with a lot of cases. Thank you.
Ma'am, I have one issue. I got a call from a parent. The child is a boy child, and he completed class 10th in our school. And he's completed even 12th also. He studied from the same school. He's an intelligent boy. 93% and 90% he got both in 10th and 12th. He's a calm going child. Child left the Vidyalaya. Then parents called me, keep on calling me because the rapport we have with the parents. So once mother called me saying that the son joined in engineering. After 1 month, he wanted to quit engineering. And he applied for some distance course in BA. Then now he wanted to go for groups. He's intelligent boy. Then mother asked me, counsel the boy. And I tried to talk with the boy, ma'am. 2-3 times I have talked with him. He stopped again BA and again shifted to engineering. The boy is very logical. Whatever answers he is giving, they are much convincing. And the boy cries even after 2-3 days going to a college, he cries. And again he calls me. Then again, after 1 week, he's normal. He's getting around 9.8 in the first semester. CGPA, he got a 9.8 in the first sem of his engineering. But he is not happy with that. Then he shifted his career. Whatever he is doing good. But he is not constant at one place. And what the logic he gives is also absolutely sounding good for me, because I am not a mental health person, but since I am a teacher in maths, but still I read so much of texts in psychology. I just, as a personal interest, I read MSc psychology, some chapters also. So I asked the parents to get a need of a counselor or a psychiatrist, whatever they call, but they are not ready to take them. And I see that the child is not sick in the mental health also. So what guidance you give me for that, so that I can counsel the boy and take the confidence of the boy and we can lift the career of that boy.
I think the counseling is required for the parents here.
My parents are very supportive. They say wherever the field the child want to go, they are ready to take them.
So if he's going over there, then why do they want him to leave that course and come back?
No, he says that this college is not enough for me because I'm the topper. I don't think I don't want to continue in that college. Because some rules in the
If he's
college are
very,
not.
if he's very clear about what he wants, I think let him take his decision. Yes, he can take a career counselor's help and decide about those options. I think they should be allowing him to do whatever he wishes to do. If he's very clear about what he wants and he doesn't want, and he's taking his decisions,
The
I think
parents are worried whether he'll be maybe delay in the settlement of his life. That is the only worry of the parents. But the parents allow him to go whatever field he want to choose.
See, that delay of 1 or 2 years or 5 years after reaching this point in our careers, I think we all know it doesn't make too much of a difference.
Even the child doesn't want to be. He says that, ma'am, I want to settle in 21 years. By 22, I should be in a comfortable position.
You can make him meet a career counselor. If he's very clear about it, I don't think anything else that is required from the emotional point.
Okay, ma'am. Thank you.
Very good morning, ma'am. So I have two doubts, ma'am, to clear. So,
Yes, sir.
is there any difference between exposure technique and flooding technique?
Yes. So flooding is a type of exposure only, but usually we don't encourage flooding because the person will get scared and the next time he would just refuse to, comply with any therapeutic techniques.
Okay.
So it's, for example, a person is scared of a dark room, a child especially, the many of them who are scared of entering a dark room. So suddenly, taking him inside and then locking the door out from outside would be flooding. Okay, sudden exposure, which is like to the peak. Graded exposure would be, okay, I'll come and I'll sit with you in this room. Okay, 5 minutes we'll talk and then I'll go on the door and I will stand. So that is the first step. Make him comfortable with that step. Then the next step is, okay, you go and sit at the door by yourself. Okay, facing the lighted or the corridor portion. Okay, the dark portion is like behind your back. Slowly you face, the dark portion and your back is towards the corridor, the light portion. Then slowly, okay, you sit inside. Maybe I'll count 1 to 10. I will count it from outside and then you come outside. Okay, so gradually then letting him expose to that dark situation is graded exposure. Flooding would be suddenly exposing him to the peak most thing. So usually exposures are done in a graded manner.
So flooding is limited for phobias, like any kind of panic.
Phobias, you do use flooding, but flooding, like I said, people usually get scared and then they don't comply next time. They will not come with you. See, suddenly you're locking him up in one room and closing the door is flooding. In one day itself, you are exposing him to the worst. Okay. But graded exposure is like gradually making him realize that, okay, this is not that difficult a situation, I can face it. Okay.
Good, ma'am. The next question is how to deal with narcissistic personality mind parent. So
Narcissistic.
Yeah. So because parents are so like in the name of being strict and discipline following, so they are being narcissistic in my point of view. So since the student has the capability to shine in clusters, any kind of extracurricular activities, she's a topper also. Since I have dealt with the case, I'm a counselor. So the parents are like, okay, you have to be in the home only. You don't want to go anywhere. Since some complaints came talking with boys, so it's a co-education school. Since they have a complaint, some teachers committee call parents and they made a big chaos. So how it is affecting? So students facing depression phase and everything. She's crying. So what are the depression symptoms you shown? Like 2 weeks, it is prolongedly happening. So the parents, how to deal with the parents? How to go with the parents? What suggestion we can give?
So usually in this case, the parents actually need a separate counseling. I mean, you don't do it in front of the child because sometimes children may take advantages and sometimes parents may take advantages of what you say. Okay. So always talk to the parents separately. Let them know that, okay, talking to boys, I mean, what are you scared about?
I did, ma'am.
Yeah. So what do they say?
I did. They are not accepting.
No. Talking and asking them that regarding talking, that girl talking to the boys, what are they scared of? What are they afraid of?
I don't want my girl to indulge in any kind of this.
What are you afraid of? Is the next question.
This like normal proud like culture things will be there. No point.
Okay, so even if culture is there, I mean, what exactly are you afraid of that that will go wrong?
They are not saying that. I asked everything.
Ask them.
They are not saying that.
Ask them the question.
They are not pointing out. They're simply blaming the student.
So you sit with them and ask them in a very, very quiet manner that, what is your ultimate fear, that what may happen and what are you afraid of? Sometimes the fear may be genuine. We may not know, something else has gone on at home, and that is why they are being so protective about this child. They don't want her to, be talking at that time. Or it is an irrational kind of a fear that the parents are having, and they're saying, just any boy, nothing is allowed. You have to make them realize that, okay, this is a situation wherein she's studying in a co-ed, there are classmates, she will have to talk tomorrow. What do you want her to do? They'll say, okay, we want her to be an engineer or a doctor. So in that situation, wouldn't she be talking to other people? Okay. So there, don't you think that, she'll come across other men who will be working along with her? Shouldn't she realize at this stage only how much and how much not to talk, rather than suddenly exposing her to that situation? Find out what their ultimate fear is. You will come to know a solution to that.
Sure, ma'am. But in this process, they are not like aligning with the process. So they are sticking with their point. And is this okay to hold the student like, okay, you have to be in this stage only, go to school and then come back, don't go meet anybody. Is this okay, ma'am?
We are no one to say what is okay and what is not okay. Okay. We would want the child to come and, engage in all extracurricular activities. It is ultimately because she's a minor, ultimately, the responsibility lies in the parents' hand. There is a role up to which you can act. Beyond that, me being a psychiatrist for more than, 20, 25 years, I have realized one thing. My role ends at letting them know what is right, what is wrong, what is rational, what is irrational. Beyond that, you cannot do anything. Okay. There will be people who will take decisions in spite of you explaining to them. They'll be absolutely irrational, absolutely wrong. Let them do it. You're not a god over here.
Got it, ma'am. But the student is suffering, right?
Absolutely. I agree with that.
So it doesn't have a solution.
No, but like I said, if you ask them what is the fear that is not letting them, make their child interact with boys, probably you will have, a way to go about.
They know, they are since government teachers. They are like.
No, they know name. You should get an answer out of them. What
they
is
know,
it that
ma'am, what answer? We'll have a question towards the answers. They
know.
know.
Have you asked them this, that, what is their fear?
Okay. I will ask.
Find out. You'll get a way out.
I think let me also add, madam. I think madam's speech also recognized me that many of the Navodayas, they are not allowing girl to talk to boy to talk to girl.
Yes, sir. So now I have a particular case in my school. So I'm a Navodaya teacher. I'm an English teacher in Navodaya. The girl was with us since 6th class. Now she is in 10th class. 1 hour back also I called her to wish her. But she is very disturbed and teacher is also worried that how she will perform. Actually, ma'am, she was there with us from 6th class and she is a little bit dark complexion and with curly hair and all. And she has been there in the system for 4 years with the same structure and every physics and everything. But now recently, since 3 months, she has been complaining that her classmates are teasing her that she is like a Negro and anything dresses or anything she purchases, they say that those dresses will fit them, look them nice than her, like that she's complaining. And the most surprising thing for me is, so we counseled her. Actually, she went saying that she wanted some gap from school and she went home. She will stay there for 3 weeks, 3 days and she'll come back like that. She went, so okay, we also considered. But after going home, she was reluctant to come back. Then through phone, we talked over her and we told that it's only your feeling. What you are is you are. Why should you give importance for others and all? But the most worrying thing is, ma'am, she has been taken to a doctor and the doctor has introduced medication. But what I feel is, so is a necessity of medication for that or psychologically she can be through counseling and all.
I haven't seen the patient, so but there must be, and that is why the doctor would have introduced the medicine.
And now the problem is she's writing board exam and she had that dose of medicine. Maybe that is sedation or something like that, because she always complains that those thoughts are coming to her mind again and again. The bullying of her friends and nagging of her friends and all. But that is keeping her in sedation and she's not able to come into consciousness?
That, let the parents talk to the doctor. They'll reduce the sedative medicine. See, one more misconception that people have is that psychiatrists only prescribe sedating drugs. Okay. Now, initial part, whenever the patient is very anxious or not sleeping well, we do give sedatives. But beyond that, okay, it's not the sedatives that have to continue. If the patients continue it, it is that their free will. Sedatives, in fact, only for the initial part. Sometimes we don't even prescribe it at all. So they are only antidepressants. Antidepressants, not all of them cause sedation. There are only one very little few class of medicines which cause sedation, not all of them. Okay. So probably the parents need to go back to the doctor, explain to them, and the doctor will cut off the sedative medicines if required. Okay. So that she can remain more active and alert and give the exam.
My question is, does she require medication at all?
I cannot answer that because I haven't seen the patient.
Okay.
She may have required, and that's why the
Ma'am, good morning, madam. Hello. Hello. Ma'am, good morning.
Parents, they try to correct her every time, but she becomes aggressive. So much of anger issue she has, and she starts yelling and screaming, and sometimes comes to hit people. So after counseling, the anger issues has been reduced, but still, always she wants that her word will be the last word. So in this kind of a girl, like what to do? That is the question.
Right. So there's a lot of problem about the temperamental history of these children, a few of them, who act like this. And these are the patients, who go on and become borderline personality disorders later on. But yes, trying to, have some kind of emotional regulations on themselves is very important at that particular point. So you start with that. Nothing in her is going to change overnight. Okay. So have that and then sit and try to rationalize, each of her behaviors. At home, you can do a very, very simple exercise of, the parents and her talking about their expectations out of each other. Those expectations, again, should be very specific. They shouldn't be like, you love me and you care for me. I want that. We don't know what love and care, like I said. So have it in a very, very specified manner that, okay, this is what I expect out of my parents. And the parents giving you that this is what I expect out of the child. Talk to them, both of them initially separately, and let them know that, there will be some amount of bargaining that may be required. Everything that you ask out of your parents or ask out of your daughter may not be fulfilled. I always tell parents that, let us start ignoring the small kind of behaviors which are not causing so much of a distress right now. For example, she's not combing the hair the way I want her to comb. She's not wearing the dresses that I want her to wear. Or, she's not keeping her bag in place. She throws her shoes around. All these things can take a back seat when we are dealing with a case like this. Let us deal with, the more important.
Because she does not arrange her room. Parents are complaining when she comes back from school, she throws the bag somewhere, the socks somewhere. So she's totally disorganized.
So let us deal with these things later on. Let us deal with the more important ones earlier. So let the parents be quiet about this.
Very reluctant to take bath.
Yes. Very, very common
So
these
what
days.
to do?
Very common. So start with the modification of things which are required first. So say, the phone itself. Because you're afraid that, okay, she may be misguided on the phone or whatever, or she's wasting a lot of time on that, or, or take into consideration this having the last word.
Yes, that is that the parents are insisting. With phone also, parents are very supportive and friendly. And we teachers know that she is going to be the school topper or one of the toppers. So she is confident about that also. But when it comes to phone, parents, she gives away the phone. There is nothing to hide for her. But in that, the last word should be hers. She should not be corrected or controlled. I don't know. She troubles us teachers in school, troubles the parents at home. We really don't know how to deal with this.
So talk to the child separately, and the parents, let them know that, okay, this bathing and all,
Take a back seat.
Yes. Okay, leave it aside. Okay, she's not oiling her hair. She's not putting the band that she is the mother wants. All that can be, totally neglected. The first thing is her wanting to have that last word, or saying that I am right always. Okay, so explain to her that there may be 2 points of view. I mean, none of us is right or wrong, but at the same time,
And
you
a
may
very demanding child, sorry to interrupt. She'll sleep in few classes.
Yeah.
And straight away when we talk to her, she'll tell the teacher is boring, I'm not interested.
Very arrogant, yeah.
Yeah. Teacher is boring, I'm not interested. She is only reading from the book. I can also do that at
you
home.
can do some reward system with her, or take away something that she actually likes. She may protest more initially, let the parents know. Okay, but that is the way to modify the behavior of a child. Okay.
Right. Thank you.
Anyone online? That would be last question. These questions we have seen it, but they are not. I think it has been a wonderful session. We will congratulate for her, madams.
Thank you. Thank you.
Okay, yeah. Sir, you can say a few words about it.
Sir, I already spoke. You can speak. So thank you very much, ma'am, for your valuable time. As I said, we all associate every theoretical aspect of it that you are showing there on the presentation with some case of our own in our respective schools. So it's in some concepts, it is an eye opener for me and for the rest of my other participants also. So thank you very much, sir, for arranging ma'am's session. We thank you for calling ma'am here, because this kind of a session is required. I mean, practical difficulties, case-based studies. So thank you very much, ma'am.
Thank you. Thank you so much. Thank you, sir.
So we'll have tea time, and again, around 11:45, the other person has come. Within 10 minutes, we'll finish the tea. Seat, please take. And for introducing further, I'll be asking Nandana to come. So Chandan Jaiswal is an entrepreneur having background in psychology as well as management field. Please, Nandana, please.
Good morning, sir. Good morning, everybody. So we have with us Mr. Chetan Jaiswal, entrepreneur, thought leader in education, CEO and founder of Mike Pigo. Mr. Chetan Jaiswal is a visionary force in education management with a legacy spanning over 17 transformative years, dedicated to reshaping the educational landscape and championing holistic child development. As a leader with unmatched expertise, Mr. Jaiswal was driven positive change for thousands of students and numerous educational institutions, embodying a commitment to excellence that transcends borders and inspires educational leaders worldwide. An alumnus of the prestigious Cambridge Judge Business School, Mr. Jaiswal's approach is rooted in global best practices, marrying academic rigor with a compassionate, child-centered vision. Throughout his career, Mr. Jaiswal has held esteemed leadership positions, mentoring schools from their foundational stages through dynamic growth cycles. As director and board member for several leading institutions, he has championed innovative strategies that make a tangible, lasting impact. Mr. Jaiswal's vision embodied in his goal to reinvent education is both bold and innovative. His team operates on a sophisticated interdisciplinary approach that combines educational planning, management, psychology, and technology, providing schools uniquely powerful tools to thrive. Mr. Jaiswal's remarkable contributions have been recognized through prestigious awards and accolades like the Center of Excellence Trainer by Ministry of Education, Indian Achievers Award, Top 5 Startups in Asia by NASCOM, Top 5 Startups in the World, Best Holistic Development Program by Education Today, Best Child Development Program by Manipal Group, Innovation in Education Award by Manipal Group, and Certificate of Appreciation by Ministry of Education. Mr. Jaiswal's legacy is defined by an unwavering commitment to advancing educational standards, nurturing future leaders, and fostering a generation equipped to build a brighter future. Mr. Chetan Jaiswal continues to redefine the very essence of educational excellence, leaving a profound and lasting impact on the future of learning. Sir, we are looking forward for a fruitful session. Please join me in welcoming Mr. Chetan Jaiswal.
Can I use down? Can I walk down? Yeah. I can use that cordless, right? That's one. Yeah. Okay, very good morning all. I think we still have 10 more minutes before it reaches to afternoon. So how's your last 24 hours has been? Good? Excellent? Enlightening? Okay. So I'm going to ensure for the next 1.5 hours, the session will not get boring. It will become more interesting. I'm not going to tell you something. So let me give you some disclaimers, okay? It should not be after 1.5 hours, you're like, oh, this is something I already knew about it. There's nothing new I learned. So let me tell you, when we talk about social emotional learning, I hope I'm audible to the end. Yes? Okay, great. So when we talk about social emotional learning, something which I'll be talking about today, it's not a rocket science. It's something which all of you have been practicing throughout your career, right? But it's all about how consciously you'll be implementing whatever we discussed today. I'll not say I'll be telling you, but I'll be discussing today. Okay? Now, social emotional learning, raise your hands. Learning spelling is wrong, right? Yes? Very good. So intentionally, I have done a lot of mistakes in my slide. So I want all of you to be more alert. Now, here is the thing. Raise your hand if any of you have come across children who are excellent or they are genius in mathematics, but they are not able to control or they are not able to manage their emotions. They lost a game while playing during the recess period. Or you come across a child who is excellent in terms of creative writing, but they don't know how to work with the team. I'm sure all of you must have come across such kind of children, right? Now, these are children who are academically superb. And I feel every child has got some or the other skills, correct? Now, academically superb, but they are unable to manage their emotions. They stumble around in handling the setbacks, handling the emotions, or not able to work with the team. Now, intelligence is not about IQ anymore. It gets into emotional quotient, right? And especially when we talk about EQ, which generation of children are we handling? Gen Z? Okay, how many of you think it's Gen Z? Raise your hand. Gen Z? Gen Z? Okay, any other generation? Generation Alpha? Okay, so let me tell you. Don't worry. You know, you're in the safe hands right now. I'm gonna take you through complete generation shift. Okay? So when we talk about, it's a generation Alpha. Generation Z is already gone. Generation Alpha. Achha, now which is a new generation which has come? Beta? Alpha, Beta? Generation Gamma. From 1st of January 2025, we have welcomed a new generation called Generation Gamma. And next 4 years, you will be the one who will be teaching them. Right? If you think the Generation Alpha is so smart, so intelligent, let me tell you one thing. Generation Alpha, IQ is here, top notch. EQ is somewhere here, right? Now, as an educator, it becomes our responsibility. As we say, reading, writing, maths are important for success. Let me tell you, dear teachers, now emotion plays a very, very critical role, and that's where social emotional learning becomes a secret ingredient to make it the truly learning into a meaningful overall. So when we talk about social emotional learning is something where we're going to equip our children to navigate through the life skills, just not the examinations. And that's what it becomes very, very important that we as educator, we need to really understand what social emotional learning is. Now, before I deep dive into the topic, let me show you some of the analytics. Now, if you see children and young people over last few years, 1 out of 10 children between the age of 5 to 16, they actually have diagnosable conditions. That could be various signs. It could be ADHD, dyslexia, LD, whatever you talk about. There are a lot of challenges what children have been facing, right? But when we talk about 1 out of 2, all mental health problems are established by the age of 14. Now, let me ask a quick question to all of you. Okay? So I'll ask a lot of questions, so don't worry. You're going to be very much engaging for 1.5 hours. Now, which generation do you all belong to? It's okay, you not to feel old. We all are young, right? Okay, which generation do we all belong to? Mostly baby boomers or millennials, correct? That is where we come in. Now, did you hear about mental health? when you were in your age? No, right? We started hearing from when? Especially from Generation Alpha. Generation Alpha. Gen Z, trend was just starting up. Now, Generation Alpha was the time when we started seeing a lot of these challenges started coming up. Now, what are the elements of challenges? Because the environment started becoming very complex, right? It started becoming too nuclear. We started getting more into internet, a lot of things. It's not one factor, multiple factor comes in. Now, if I show you further more facts, look at this fact. Antidepressant prescriptions have almost doubled in 10 years. 2008, it used to be 36 million. Now, 2018, we have come to 71 million, which is 97% up. And if you talk about depression among young children, have also increased. As young as 7-year-old child is talking about, I'm stressed. They are not able to pronounce stressed. Right? So we need to really understand where I'm creating the foundation for all of you to understand what social emotional learning and why it's so much important. Now, this is current scenario of the schools in India. There are 1.5 million schools, out of which, if I talk about, there are 29,179 CBSE schools are there. I'm not considering any other board right now. Just for your information, I've got this analytics. Now, how many of the schools are SEL equipped schools? This is the question which we need to ask ourselves, okay? Which talks about how many schools have social emotional learning curriculum, first. How many schools have dedicated professionals catering to holistic development? And then comes how many schools have positive psychology framework? Now, these are the three very important questions before we deep dive into social emotional learning element, because these questions will create a base, especially in terms of what will be our approach of how we're going to integrate social emotional learning into our academic framework. Now, with this, let me give you some more facts. When we talk about social emotional learning, just for your information, globally, 74% of the educators are spending more time in teaching social emotional learning. On the other side, you see, only 22% of the educators all around the globe, they actually are very well prepared to teach SEL. Any idea why so less percentage? Is yours? Okay. Any idea why so less percentage? Sorry? Involvement is less, okay. What else? Good, you're thinking right. If I have to talk about social emotional learning, it's all about you. It's yourself. I always believe whenever I take workshop with the teachers, I always tell the teachers, it's all about your self-evolution, how you evolve yourself, how you become better than yesterday, right? Social emotional learning is all about yourself. And as a teacher who are able to practice social emotional learning on a day-to-day basis, they become the better ones and they come to 22%. If you think, oh, it's something I need to teach as a curriculum, you're falling into which category? 77, right? 74, and otherwise 22%. Now, what is social emotional learning? I broke it down in a more simplified manner, and tell me if you all resonate with this. According to, if I break it down, social emotional learning, first thing, as an individual, you want children to respect, right? And you want them to have their self-respect also very high, correct? That's one. Second comes empathy. Very, very important. Children should show empathy, understand what empathy is. Then comes what? Self-awareness. Should know about themselves. It's very, very important. And then comes to your collaboration, how to work collaboratively with everybody else. Teamwork, what we talk about. And then comes self-motivation. It's very, very important nowadays when the world is becoming very complex, that how you can actually make the children to be self-motivated. Then comes your social engagement. Now, as you know, that today's generation children, I'll make it, give you some examples also. I met my friend after a long time, and we went out for, we went to their house for dinner. He texted his wife, is dinner ready? Wife replied, yes, it's ready. Father sent a WhatsApp message to son, the dinner is ready. And he sent an Instagram ping to his daughter, come down, the dinner is ready. So the engagement has come down to where? Social media in your pocket, right? During our time, what used to be one loud scream, we used to be assembled there. Correct? So now it's important for us to teach our children how social engagement is so much important, right? It's just not for the conversation, building relationship. When I talk about respect, now identifying problems, analyzing solutions. This is very, very important. If every child can really connect and understand what exactly the problem is, how can I identify what could be the problem solutions, your 70% of your task as educator has been completed. Then comes ethical responsibility. We talk about society, what are your ethics are, correct? And then finally comes to international mindedness. It means now children do not look themselves as an individual citizen. They think they are a global citizen because they are connected everywhere else. They get all the information on their fingertips. So children are thinking from more of a global perspective. So as an educator, do you think all of these 9 elements are important? It is important, right? There's all 9 elements create a happy human. That's what education is all about, to create a happy human, correct? So that humanistic approach can only be achieved if you can focus on these 9 elements. Now, I'll make it more concrete. These 9 elements come into 5 categories, 5 domains of social emotional learning. First comes relationship skills. Like we have to teach the children how relationships are so much important, what friendship is all about, how to maintain a relationship with your family, how to have a relationship along with your teachers and with your coordinators, because this is where they understand. Can I go ahead? Okay. So when we talk about relationship skills, it becomes very important as an educator to teach. Now tell me, do we have any books on relationship? Any book which is prescribed by the board that you have to teach the children on relationship, reading through this particular book? Who's going to teach that? As an adult, it's a responsibility of both parent and teacher, correct? And how are we going to teach about relationship skills? Our experience, correct? That is the best thing what we can teach our children. Then comes to the next one, social awareness, to know about what's happening around the society, as I told you earlier. Self-management, self-awareness, responsible decision-making. These are the things which will really help an individual child get to know about themselves. Okay, I'll go furthermore deeper to get. It's not working. Slide is not changing. Can change the next slide? Yeah. So we saw that when we did a survey, because as an organization we work with a lot of schools around social emotional learning. So when we did the survey among all the teachers, we found out 9 out of 10 educators ranked these as the 3 SEL skills to learn. Do you all agree with this? Self-management, relationship skills, responsible decision making. If children can learn, I personally feel all the 9 are important. But as educators, the first primary domain was given was these 3. Because these 3, if a child has learnt it, it becomes very easy for an educator to manage the whole classroom. That's where your classroom management strategies can be more effective. Now, this is where we come down to. These are the few generations which we have talking about. And we are talking about Generation Alpha. Now, Generation Alpha, let me give you some of the facts for all of you to get a better understanding. Generation Alpha is the most smartest generation of all our human history, right? Now, Generation Alpha also has a focus point of only 8 seconds. How many seconds? 8 seconds. Generation Z had 15 seconds. As millennials and baby boomers, we can sit for 15 minutes with focus point? Yes or no? Yes? You're seeing how the drop is happening? That doesn't mean that Generation Alpha is not smart. I said smartest generation of all the time. Now, this generation has an excellent grasping power. For this generation, 8 seconds are enough for them to really make a decision whether I want to focus in my classroom or not. This teacher is going to make it more interactive, more interesting topic or not? And that's where social emotional learning becomes very, very important. First element is empathy is key. Connection. I always say, to handle or to work with generation alpha and upcoming generation gamma, it's going to be connection before correction. Connection before correction. And that's where empathy comes in. That's where children starts connecting with you more in terms of understanding how my teacher is teaching, what mental health is all about. And they're very much aware about mental health because this generation is growing up in the trend of mental health. Then comes to authentic connection. It's all about meaningful experiences. I'm sure all of you must have experienced when you teach in a classroom. It's an experiential based learning, right? We talk about it. If you see in the latest curriculum trend also, we're talking about experiential based learning. How are they come? After looking at the research that this generation is moreover experiential based learning. They ask for logic. Then comes to growth uncertainty. Now this generation gets really motivated with innovation and motivation is required. This is the very generation who's very smart, who knows that I can do multiple things. Now here, creativity becomes very, very important. Creativity is the key to connect with this generation. And lastly, it comes to mindfulness. Now, we used to take around 22 to 25 years to get our first paycheck. Correct? Most of us. But today's generation, their paycheck is started at the age of what? 10, 12, 14. All thanks to the technology what is around. Correct? Now, this generation is not thinking about monetary side. Let me tell you, dear educators, this generation is already a born millionaire. By default, they're going to make a lot of money. But what they are looking at is in terms of mindfulness. They're very open to learn about mindfulness. And this becomes a responsibility of whose? As an educator, it becomes our responsibility. Now, the question is this a rocket science? It's not a rocket science. It's something which you're already practicing it. The only thing is you need to be more mindful and more conscious of implementing these. Now, as we have seen in the new education policy, are we very familiar with this? It's very familiar, right? And it's compulsory. Or if you see, even in NEP talks about reducing exam stress, counseling support, holistic well-being, the final goal is what? A stress-free, inclusive, and student-friendly education system. And that is what we are supposed to create. And that can be achieved through social emotional learning. Now, let me give you an example. Core values. Everybody has got core values here? Yes? Your own individual core values. Like, let me talk about my own core values. I believe in time management. Like, you have to give time punctuality. First, I believe in terms of self-awareness, to know about myself. I believe in terms of giving more importance to the knowledge. Keep adding knowledge to myself. So these are my 3 core values. Now, as a teacher, it becomes my ethical responsibility to pass on this information or this practice to my children. How would I do that? I can showcase them that, see, I've been coming regular to the classrooms. I've been very time punctual over last 10 years, over last 15 years. This is what has really helped me to grow as an individual person. Correct. Now, this generation connects the storytelling. That's all about, right? So you have to connect. Now, if I talk about the 3 things which I spoke about, it's all about knowledge, time, right? And self-aware or self-care. It connects to your self-awareness, self-management, social awareness, relationship management, responsible decision-making. Yes or no? Everybody will be having those core values. Those are nothing but your own principles. Now, how this connects on an outer circle? Look at the outer circle. As an individual, it really helped me to be having more civic literacy, knowing about what's happening around the global awareness. If I go furthermore down, it really helps me to have more critical thinking or inventive thinking. It also connects to something called a communication or collaboration approach, which I'm trying to work around. Finally, as an individual, it makes me self-directed learner. It helps me to be more active contributor. It makes me a concerned citizen. And also, it makes me a confident person. Now, these are the elements which makes a overall holistic development which we talk about. Yes or no? Right? So this is what social emotional learning can do a magic, provided as an educator. First, we accept, we practice, and we know what exactly we need to pass on to our children. That's why I told you starting only, it's not going to be rocket science. It's the most easiest thing, but only thing is we need to be more consciously practicing on a day-to-day basis. Now, any of you who has experienced social emotional learning in a classroom? Anybody? Yes? So if you see, when we implement a social emotional learning in a classroom, what happens? A classroom becomes more of a safe place. It becomes more of a caring place. It becomes a place where children don't feel shy away. They are opening about themselves. They are speaking up without thinking somebody is going to judge them or somebody is going to label them. Now, that's where you see you actually provide more of the competency of social and emotional, the 5 elements which I've spoken about. It creates more of a greater attachment to school. You've come across those children who say, Mama, I want to go to the school. Why today Sunday is coming? I want to go to the school. I have come across those kind of children who miss school so much that they wait for summer break or winter break to be shorter period. Why? Because there's a greater attachment to the school which comes in. Then there's a less risky behavior. If children love school, do you think their behavior will go up? The less risky behavior is going to come down, right? Because they want to be participating. It comes from their wish and will. I want to be part of that particular classroom. And that results to caring, capable, responsible, motivated students, better academic performance. Dear educators, we need to bring excellent academic record. It's the most easiest thing you can do with this generation. With our generation, it was a difficult task. But with the current generation, it's very easy. And that's why I always keep repeating connection before correction. If connection can be built, children will follow you. And that's where you can see the result coming out in terms of better academic performance. And I've seen not so good in terms of academically, the children who are not able to do so well. Once the SEL was introduced to them and the approach was changed of an educator, we saw a change within 6 months. A drastic change happened. Now, these are the few skills, and you need to tell me if this is what you're teaching in your school. Read towards your left. Listen to others. Say please and thank you. Follow the rules. Pay attention to your work. Ask for help. Take turns when you talk. Get along with others. Stay calm with others. Do the right thing. Do nice things for others. Have you been repeating these kind of sentences regularly basis from lower grade to a higher grade? Yes. What exactly are you doing? Subconsciously, you have already been implementing SEL in your classrooms. You're actually talking about self-management, relationship skills, self-awareness, and responsible decision making. Now, if I go furthermore, these are few more areas, and you can just go through it and tell me if this you have been doing it very regularly for the higher grades. Be positive about the future, make other feel better, stand up for others, stay calm when pushed or hit. Yes? All of you must have done this. Now, this again connects to social emotional learning. And if you see this SEL domain, you're actually touching base to all of them. So subconsciously, you're already practicing SEL. The whole idea about this session is that henceforth, we become more conscious about which domain we'll be helping our child out. Now, SEL is something I personally believe there are a lot of reading material is available out in the market. I mean, online and everything. But I personally believe SEL should be designed by the educator by themselves. Why? Why? You know your children. Okay. What did I say initially? Core values. Your core values. You want your core values to be passed on to your children? Right? Now, let me tell you one more thing. How many of you remember your top 3 best teachers of your life? All of you? Okay. 3, 1 or 2? What are the names comes to your mind? 3 names, 2 name or 1 name? All the 3 names? 1 name, 2 name? It's very debatable question, right? Okay. Now let me tell you, if you think about those teachers, you will think about their core values. Yes or no? Correct? We actually do that. Absolutely right. Somewhere their core value was inherited in us. It was passed on to us. Which is what? Social emotional learning. This has been there. The only thing is it's more direction thinking rather than doing it subconsciously. And these are the few topics, like I've just written down some of the topics, like what you can think about, what you can do it, like this for the lower age group. Who am I? Especially the younger children. They don't know. They get confused, right? To know, explore about them. How do I think? How do I feel? How to build a growth mindset? And you can actually break it down in terms of identify your strength, explore your personality, establish your values. And these are the subdomains you as an educator can further make it down because you know what your core values you want to pass on to your children. Now for this, do I need a presentation? You want, you can do it. Or can I do it storytelling? Certainly do it. Right? Or can I do it in activity based? 100% you can do it. It's all about wearing a green hat, which is nothing but, green hat is nothing but creativity hat. I told you initially, right? Alpha generation, they get impressed by creativity and innovation. And that's what we are supposed to do that. Similarly, for the higher age group, there are some more topics about what I have written down. How do I think? How do others think and feel? Diversity, not division. How to work in groups. How to make decisions and responsibility in the real world. These are few of the things which I felt as an educator, we need to pass on the information to the children from lower grade to the higher grade. Again, the domains can be subdivided based on what your core values and what your principles you want your children to be learning it. Now, these are just an example. When we talk about SEL skills, you can actually work on the progressive skill sets. So grade 1 to grade 12, you can have your topics. You can actually come out with the simplified activities based on, as you rightly said, we know our children pretty well. We know what their skill sets are. What kind of complexity can they adapt to it, or what they will be able to practice in a classroom. So based on that, you can create your own curriculum and that you can start implementing. Now, one very important thing. I see, most of us, any new habit we need to implement. Like for example, morning walk, controlling sugar. It becomes very difficult. Why? Why? Because there's a change what we brought in. Now where the issue happens, consistency. 1 day, 2 day, we have done, 3rd day, we have done, 4th day, back to the square one. So dear educators, the key lies in consistency. If you really want to see the result of SEL, the consistency should be maintained. If that has been maintained, you'll automatically start seeing the result within 45 days. And I'll tell you the logic of 45 days later on at the end of the slides. Now, as an educator, we have our own indicators. When we do an academic briefing, or I would say when we get the academic result, first unit test, second unit test, third unit test, what do we see? We see performances, which comes in marks or in terms of how the child has been able to perform or extracurricular activities, right? Which gives you a baseline, correct? Now, in the second stage of second unit test, you already have set the goal for every child. That these are the 5 students who are going to perform very well. Now, but these are the 15 students where I need to focus more on. And out of those 15, there'll be 5 students who I have to work individually. These are nothing but indicators what you've created. Now, dear educators, you can have your own indicators. See, now negative is a very harsh word. Again, I'm saying. Instead of negative, you need to use an improvement indicators, okay? So positive indicator, improvement indicator, look at the domain and the descriptions. Like for example, respect for elders. Description, as per me, child is polite, respectful, and obedient towards elders. What are the positive indicators? In the child, what have I observed? My observations led to the child is polite towards elders, child greets people who he or she sees, the child does everything that elders ask for him or her. Improvement indicators, the child is not polite. No code provided. The child does not listen to guidance of elders. Now, these are the remarks are actually given out by whom? By whom? By us. By us. As an adult, by us. By either by the teachers or either by the parents. Now, parents might not be aware about this. It becomes whose responsibility? Teacher's responsibility to communicate to the parents. And these indicators is something which you can design by yourself. Is it something very difficult? Something very difficult or easy? It's not very difficult, right? If you know your core values, core principles, you can easily define it. Okay. Now, let me give you an example. So, where you see the star mark, that means I've changed the name. I don't want to reveal the name of the child. Okay. So, this child, RV, I'll call her RV, Bangalore-based child, 5-year-old. And you know how when the young children are, they want to throw their tantrums. They don't want to sit at one place, right? They start crying, and it's early emotional regulation, which is very, very common. Have you all experienced that? Yeah, my friend didn't come, I start crying. My teacher didn't come, I am not very happy, right? That's what happens. Now, this child, what teacher had experienced, that the child is not able to express the emotion. When you're not able to express the emotion, what happens? You throw, right? Or you start getting into more aggression. Now, we introduced SEL, and when we introduced SEL, we started helping the child. Let's do breathe in, breathe out. The question is, Chetan, she's just 5-year-old. How can you teach her breathe in, breathe out to a 5-year-old child who's not able to sit in one place? So let's do an role play. Let's do with an animal breathing. And when the child started getting into that particular phase, we made her sit in a calming corner. We started showing emotion cards. So dear educators, again I say, it's a consistently we have to keep on performing these activities. And we saw after around 4 months that RV was able to sit down, she was able to express her emotions that I'm feeling sad or I'm happy. Yes. Correct. Yes, you're right. So it's all about how we make children to express. First is to know your emotions. Second is to express it. Now, the teachers noticed that 40% of her emotion regulation was controlled. Now, I'll give you another example. This is very common, and I travel a lot to different places. And I was traveling down from Pune to Bangalore. I was taking the flight, and 7-year-old child. And I'll tell you, it's not related to SEL, but I'm just telling you where exactly this example is coming from. Now, as a parent, most of the parents, they run away from where? The minute they see the toy store, Hamleys. Correct? The Hamleys are there. Okay, let's run because my child is going to run for, I need this toy. And it's become very expensive. No doubt about it. Now, what happened? This parent, he immediately got his son, made him sit at one of the corner, and he said, you sit here. And both the parents were busy over the phone. So father was speaking over the call. Mother had just, speaking over the call, and she walked away. The 7-year-old child comes and says, Papa, I need to talk to you. And Papa said, I'm busy over the call. He come back again and says, I need to talk to you. Father lost temper. And he said, I told you, you can't see. I'm talking over the call. Please go and sit over there. Son come back again. And he said, I need the toy from Hamley store. Now this time, father lost it. And he said, we are going for a holiday to Goa. We were not aware about where they were going. That's what happens when you react. You don't respond to the situation. So he said, we are going to Goa and I'm going to lock you in the room or I'm going to cancel the whole trip. Sit down. I'm not going to get you anything. And see, I'm finishing my call. What do you think the child would have done? What do you think? Got angry? Cried? Okay. Lying on the floor? Okay. Okay, good. You're thinking right. Any more? Yes. Let's go back. So I'll tell you the answer what this generation gave. Why I'm giving this example is I'm just trying to tell you this generation is so smart. It will surprise you in all the elements. The boy said, purchase me the toy. Okay. What did the boy say? Because his father had threatened him twice. I'm going to lock you in the room. He said, Papa, don't forget it's your holiday too. This generation is a born negotiator. You cannot win. The minute child said, now child got the pulse of his father. He saw my father is screaming, everybody is seeing me, trying to shame me. What he did, he even spoke more loudly. Let everybody hear about my statement. Father got up, he went to the Hamleys, he got 2 toys, not 1, 2 toys. Sit down now. What I'm trying to tell you is, this matter could have been handled more easily. How? This generation is very smart. They are logical thinkers. And that's where social emotional learning teaches about logical thinking. I told you, right? Your core principles, self-awareness, social awareness. If father would have told, dear son, I know we're going for a holiday. I just need 5 minutes of your time. Let me show you my time. Look at my watch. It's exactly 5 minutes. And after 5 minutes, I'm going to spend time with you. Do you think the son would have created this whole ruckus? No. And that's where I'm saying, as an educator, as a parent, we need to be more mindful about our own actions. And that's where social emotional learning becomes more effective, 22% only, because those are the people who are working mindfully on those elements. Okay. Now I'll give you another example. There's another child called Ria. Cities are real, names are not real. Let me be more clear. Okay. So the 8-year-old child, and especially this child, has social skills and self-regulation becoming quite challenging for her. Especially when you're 8, 9 year, grade 2 to 5. This is the age when the children are very excited. Oh, my turn. I need to speak. I have the answer. Ma'am, why she's not looking at me? Patience starts going lower and lower. Now they want to gain the attention of whose? Teacher. To gain the attention, what will I do? Disturb the whole class. Throw the item. Right? I'll raise both my hands. I'll run around the whole classroom. What happens in return? We start disturbing the whole classroom. Now, this was observed by the teacher multiple times. While this was getting observed, teacher had given warning. Ria, sit down. Don't run around. Why are you disturbing the whole classroom? I will not allow you to speak in the classroom. Now, this was constantly happening, which started aggravating the child. Furthermore, now when the child started getting aggravated, we saw the child was actually becoming more aggressive. That aggression was coming out in terms of disturbing and hitting, pushing other children in the classroom. So the minute teacher introduced buddy chat is where, okay, you want to talk? Since you're not getting the turn, talk to the other classmate. I'm going to allow you. Discuss about your answers. In this way, the child who is not opening up can sit down with this particular child. Right? It is helping both of them. It's just being more mindful. Now here, the child started doing reflective journaling about their emotions. Let me write down about my own emotions. This also helps the child to write it down. If you're not able to speak, let me write it down, my thoughts. Now this started helping the child in terms of resolving conflicts. And we saw after around, say, 6 months, there was a 30% improvement in the child. So social emotional learning also helps the children in terms of social skills and self-regulation in this particular grade. I'm sure you must have come across this. Very common. Yes or no? Very common, right? Okay. I'll give you another example. Grade 6 to 8. This is again an issue. Managing stress and anxiety. This age. It starts, right? Especially now, this is the time when academics takes the front face. Now academic pressure starts building up. So we talk about this particular child, Kabir, in Delhi, one of the school. Very bright child, very smart. Very handsome, very smart child. And this child started complaining about stomachache. Common, right? Or I'm getting nausea. I'm going to faint. Or I'm getting too much of palpitation. So this was a child. Teacher was also getting surprised that how come you're doing so well? Surprised us, you do very well. In the classroom, you answer all the questions. Why are you getting so nervous? And the child started showing a lot of self-doubt. Not having that confidence in the child. And this is where, when we started showing the child, let's do deep breathing techniques before you get into it. Let's start gratitude journaling and get into self-affirmations. Do you all practice positive affirmation? How many of you believe in affirmations? You believe? Okay. Now let me tell you negative affirmation. How does it work? Okay. Just few days back, I don't wanted to go to a family function. Okay. I traveled back to Bangalore. I was traveling and I was pretty tired and exhausted and very lazy I was feeling. But I don't want to lie. So somewhere I started thinking, I'm actually feeling feverish. And I thought this almost for half of the day. By end of the day, actually I got the fever. Right? So what you believe, what you think It transforms into a reality. And this is something which is tried and tested. If you don't believe, try this out. You can see the result within half a day only. So self-affirmation, it really starts helping the child. The question is, Chetan, what kind of affirmation do I have to teach? It's up to you. Positive affirmation, right? How you want to teach them. What are the traits you want to teach them? So this is something which really helped the child. And we saw the child actually reduced by 25%, which is a good thing. Started feeling less anxious. Mother also said, now my child is able to sleep very well during the examination times. So social emotional learning helps in all these elements. If I talk about higher grade, this is very common nowadays, future readiness and emotional resilience. I was doing a career counseling for one of the child yesterday only. And, the child is in grade 12th in one of the very leading school. And child had an argument along with his parents. The argument was, I want to get into economics to do international relationship. And parents wants the child to do marine biology. Right? Because I know my child. You don't know anything. I know you're very good in marine biology. The child is like, no, that's an area where I had an interest, but now my interest is inclined towards getting into international relationship. This is where I want to get into it. This is very common nowadays. Yes or no? Have you come across this? Conflict of interest which comes in. Correct? Which is very, very common. It's very frequent also now, which is leading to what? Emotional resilience, a lot of ups and downs of emotional side which comes in. Correct? Now, as an educator, what we started seeing for Ananya, 16-year-old child in Hyderabad, started feeling that she's making some wrong choices. Am I making wrong choices? Self-doubt. Do my parents are thinking right that I am not still confident to take the decisions? Or do I have to stick around to the decision what they are making it? See, I'm not saying whether the parent should make or the child should make. The whole idea over here is that as a child, you should be having a good emotional regulation. So what we did was we actually got into a mentorship for the child. Again, social emotional learning is what? These are things, right? Provided a nice mentor. This is the mentor who will help you out. Help them to explore more careers, get into career counseling by the counselors. And that really helped the child to get the better clarity. Now, these are nothing but the social emotional learning initiatives as an educator, what you can take it up. Now, do you all agree with this? Schools are the first line of defense. Yes or no? Correct? Okay. Now, future ready schools focus on social emotional learning as much as academic success. Dear educators, as I said, when baby boomers and millennials were studying in a school, it was predominantly academic. Why? Because we used to learn social emotional learning from where? From the home or the environment what we had. And another thing, very good point what ma'am has given, because we used to go out and play. Correct? We used to watch Mahabharata on Sunday morning, 9 o'clock. Vivid Bharati, 5 p.m. Right? Chitrahar on Wednesday evening, 8 p.m. Yes or no? Correct? Now, the minute I take out my smartphone, I can see whatever I want to see it. Right? So it becomes very, very important as an educator that we have to integrate social emotional learning into a regular academic. Because please understand, IQ of the children is probably very high. EQ is where we need the nurturing has to be given out. Okay. Now, these are the 5 steps according to what I have been thinking about how to really implement well-being in a school. Now, since all of you have been going through a lot of sessions over the last 1.5 days on mental health, if I have to say, first and very important thing is your overall whole school approach has to be taken up. It has to be evidence-based. If I talk about social emotional learning, it is an evidence-based program. Now, when we talk about mental health and well-being, it's an evidence-based program, right? Now, as an individual, you need to look in terms of leading the change. First is, what kind of transformation can I bring it in my own teaching or learning style? First. Second, as a principal, what kind of change will I be able to adapt? Then comes in terms of policy making, working together as a team, my counselors, my special educators, my coordinators, how are we going to work together as a team? What kind of policies are going to help them to integrate the social emotional learning into my school? The third element comes understanding the needs. Now, we need to understand the classroom need, individual child need, come with a remedial action plan and start getting executed. Now, I'll tell you, I'll give you a very thumb rule, okay? Very simple thumb rule. If you want to see in your school, how is your holistic development or your mental health or social emotional learning is getting accepted? It's called IVR, okay? What is IVR? I is for identified cases. If you think your counselors and your teachers are able to identify more number of cases, that means the children are very open to talk about it. Then comes R. What is R? What is R? Referrals. The teachers are able to give the right referral cases to the counselors and to the team. And V is very, very important. What is V? Voluntary. Very good. So voluntary cases. If you think children are coming forward and they're saying, I need to talk to you, I need a help, I need a support, this will really help as in, as a school to see if my voluntary cases are going up. That means children are able to understand as a school that my school is more of a happy school, a school where I can express my emotions, the school where I feel safe that I can say and do anything. This really helps you to see understanding the need. Then comes your promoting well-being. Now, well-being should become part of your school culture. Yes or no? Correct? Now, imagine if you're not happy with your job, would you go next to the office? You might have to give a notice period. Don't say, I'm saying on the records. What makes you happy? Children? Children? Okay. Does the school environment also makes you happy? That's the most important thing. Correct? So if your environment is not very happy, would you like to continue there? No. So it becomes very, very important that it should become a culture altogether. If I'm happy, my children should also feel happy. My colleague also should feel happy, right? Then comes your supporting staff. As education leaders, we need to ensure that my whole staff has been supported, not in terms of curriculum, professional development, but overall well-being development also. Now, these are the 5 elements. If you are able to implement, you can see the overall well-being of the whole school happens. And dear teachers and principals, when we talk about giving children about how they should become more concerned about they should become more independent about their own individual well-being, from where they're going to learn? From us only, right? Okay. Now, this is a checklist, or I would say a cheat sheet, what I've created. Now, this cheat sheet is all about self-evaluation, where it's a key for leaders and vision for social emotional learning. If you really want to implement and integrate social emotional learning in your school, what you should be doing it. First, foremost thing, does or could this impact on emotional well-being and mental health experienced? Now, as an individual, whenever you are implementing or introducing social emotional learning or the mental health program, the first foremost question as an individual you need to ask yourself, is it really going to impact? Is it really going to add value? Because it's a time, effort, monetary which comes in. Yes or no? Correct? Second question which comes to you, what would this look like in an emotional well-being promoting school? If my school becomes an emotional well-being promoting school, how will my school look like? As a leader, you need to envision that, because this will give you a broader spectrum of your vision, that how will I be able to achieve that goal? Then where could we make some adaptations and change? Because we need to bring certain changes while we are trying to implement social emotional learning and well-being. Then comes are these approaches aligned and do they reinforce one another? So these are the few thought-provoking questions. Now the question is, Chetan, you have asked us to think. Is it my responsibility just to think? Or do I have to involve my team members? So this is something food of thought. As a team, you need to have a brainstorming session. Now you can actually focus on strategies, structure and systems, policy, monitoring. These are the 4 domains which I have always seen it really works in a favor for the school team to implement and successfully execute social emotional learning or the mental health program most successful manner. Strategies, what is my value and mission? Without that, things cannot get executed. Second comes, what are my school priorities are? Might be my priority is just to promote counseling, or my priority at this point is to really help the specially able children, or my priority is to bring that kind of happiness quotient in my whole school. Then comes related to the second point, third point comes financial implications, because financials are very, very important. So you have to think whether it's falling into the budget. You have to make certain changes to create a social emotional learning experience room. It costs you. Then development programs, school ethos, culture, behavior. Now policy is very, very important. Policies need to be introduced in your school, which you already have it, in terms of ensuring this is constantly being implemented and executed, and what has the outcome has been given out. Monitoring and structure system will help you to really execute, and these are the few audit areas which you can create. Now audit becomes very, very important to see whether the quality of social emotional learning, what you're trying to implement, are you able to get the result or not? If audit is not being executed, you will not be able to see, is there any value addition? The program has got it or not? Now, as an educator, I personally believe that you should also look at bird eye view vision when I talk in these 4 areas. Tell me if you all have been doing this. At risk students, that means the children who are at the risk, you do coaching, you nurture them, you counsel them. There's a behavior advisor and there's a mind first aid. You've been doing this regularly? If not, then this needs to be executed. The next phase comes resilience and emotional well-being. I'm sure this has already been executed in terms of peer mentoring, curriculum, assembly, anti-stigma campaigns need to be done. Then comes your staff professional development, which is all about CPD programs, staff awareness, staff well-being, and staff counseling. And finally, it comes to student in needs, which is nothing but the children who require one-on-one sessions, which need to be done. So these are the areas which gives you as an educator bird eye view, overall view, that how my school social emotional learning is getting implemented, executed, and the framework creates a more structured base for the upcoming future sessions. Okay. Now, so far, whatever I've spoken about, you'll be thinking social emotional learning. Is it just emotional? Is it something which is gimmick, or is it really required for us to implement? Right? Now, I'll tell you, it's just not the emotions, it's neurological. Now, I'll explain you how it is. Now, if you see prefrontal cortex, okay, prefrontal cortex, amygdala, and hippocampus. These are 3 very important domains, right? Now, when I talk about prefrontal cortex, which is nothing but I name it as a brain CEO. Why brain CEO? It takes all the decisions, executions, functions, which it does, right? And then comes what your amygdala, it's all about emotions, aggression, feeling sad, feeling very happy, excited. When tantrum starts coming out, where from? Emotions. And then comes your hippocampus, which is nothing but memory bank, happy memory, sad memory, right? So it is all 3 of them are related where you can actually get it done from social emotional learning, which I've shown you the examples, all the cases. So it's actually neurological. It's been proven that you can actually rewire every child behavior at any given time. It's not a very complex process. It is just as an individual educator, you need to be getting involved. Now let me show you another thing. So good news is our brains are neuroplastic. That means they can be rewired. Let me give you another example. Now, you might have come across or seen or experienced, suppose a hand is broken. What's going to happen? I'll go to the doctor, then a plaster will be put, correct? Say for 30 days or 40 days, whatever number of days. Am I able to move my hand? No, my hand is stuck in the same way. Now, when I go to the doctor to open my plaster, what do the doctors tell me? Physio? Why physiotherapy? Movement is needed. What will physiotherapy do? bring back, who will be there with me. Now he or she will ask me to move my hands. Correct? I can also do by myself. But why do I need physiotherapist? Professionals, right? They will tell you how many angles you need to move day 1 for 5 days, how much weight you need to lift. And then they go to the next week. You have to go furthermore down. Within say 2 weeks or 3 weeks, you are back to your angle, 100% angle. Yes or no? Correct? Now what happens during this whole process? Your muscle memory starts getting regenerated. Okay, fine, I need to lift this glass. Correct? Now this is what we do as a social emotional learning program, as an educator, all of you. Okay, you can rewire the child, any behavior, any age group, it is possible to do it. And we have seen the result coming out. So it's scientifically been proven that it can be executed. Okay. Now, a lot of things are said done from school point of view and all. The Chetan, whatever you're speaking, neuroplasticity, neurological, but is it really adding value in the real life? Google as an organization has been focusing not in the IQ segment. EQ is their predominantly very, very important area. I've just taken an example of Google. Apart from Google, you talk about any Fortune 500 companies or any company nowadays, they're only talking about mainly, we need people with higher IQ. IQ is something we know that children are very smart. Now they came out with a mindfulness program for all the employees, which is all about search inside yourself, because they know as an individual, you can be more well-balanced personality. It'll be easy for you to give your 200% of your productivity, not 100, 200% productivity. At the same time, you can balance yourself out. Now, similarly, there's another university. Have you heard about this university? Yes, Yale University. Now, Yale University Center for Emotional Intelligence, they actually built an emotional intelligence school community. Beautiful community they created. And I would encourage all of you, if you would like to try to implement this in a classroom. They made a mood meter. If you look at x-axis and y-axis, low pleasantness and high energy, high pleasantness and low energy. Very simple. Now, let me show you how does the whole thing works. Suppose if a child is having high energy and low pleasantness, what's going to happen? What's going to happen? High energy, but low pleasantness. Angry, I'll throw things. Correct? Low pleasantness, low energy. What's going to happen? Disinterested. I'm not interested. Whatever you're teaching, I'm just yawning. Right? I'm just seeing here and there. That's it. My body is here, but my mind is somewhere else. Okay? If the child is high energy and high pleasantness, what's going to happen? Cheerful. Participative in the classroom. Does it connect? It's connecting, right? So this is something which you can, as an educator, we can pass on to our fellow teachers, to our whole education batch, in terms of how they can gauge, how they can create the mood meter of a classroom. So I'll tell you, during my school days, so I have studied in 13 schools, by the way. 1-3. Okay? And out of 13 schools, I was actually kicked out of 3 schools because of bad behavior and poor academics. And now you shouldn't say, oh, that's the reason why you came to education, Chetan. So I'll tell you, the whole thing is, as an educator, I believed one thing, that we all need to, if we can connect with the child, it becomes most easiest task. So I remember very well when we were in grade 8A, that was a section, and my maths teacher, we all used to be too scared of maths teacher. Anybody maths who teach you here? Okay, all of you. Okay, so now also you're afraid? Virtual high five. Okay, so I'll tell you now, what used to happen was, the teacher used to always say, oh, you're going to grade 8? Take a Ceradon tablet. It's going to give you more headache, because that classroom is the most notorious classroom. When the grade 8 came to grade 9th, again we were labeled. That, oh, this is the grade. Oh, you're going to be class teacher for this grade. You're gone case. Now, the whole idea was, I don't say that we were very notorious children. Of course we were. And the current generation is also very notorious, no doubt about it. If we can gauge the mood of the children, and as an educator, we change our emotion gear and get into the classroom, you connect, you vibe, you resonate, and you're done. See the magic. It's a beautiful magic. I'll give you another example. Now, there are two ways, okay? I'm giving you an example, okay? One example, this teacher used to walk in. She came to the classroom. You know, as children, what we do? We keep screaming, shouting, talking, everybody. For those few seconds, we make the teacher as a ghost teacher. We are not able to see her. Correct? Now, this teacher used to walk in. She used to keep both her hands up. Okay? And her fingers used to be open. And she used to start closing one by one each finger. By the time she used to finish the first hand, by the second hand, we never seen her going to second hand. We used to all quietly sit. Now, this was one scenario. Okay, if you ask me that what exactly happened to all of you, why you were sitting so quietly? Because we didn't knew, because she used to walk around. We didn't knew where this punch is going to land. So we were scared about that. Okay. Another teacher, we saw her coming from the balcony. She's walking down. We opened the book. We have cleaned the board. We're just sitting over there, and we immediately get up in the sink and say, "Good morning, ma'am." And we start with the classroom without any hassle. You saw the magic? You want the first teacher or second teacher? Second teacher. It's not by the fear, but by the connection. That connection comes through having a social emotional learning approach. That means my core values need to be passed on to the children. Okay? Okay, you might have to change again. I think the battery is low. Okay. Yeah, it's going. Thank you. So now we're going to look beyond taboos. Now, what are the taboos here? What is the taboo do you face in this? What is the taboo? One is a counselor as a taboo. Do you see that as a taboo? Yes? Any other taboo do you see? The parents say, "Oh, how can you send my child to the counselor?" Do you see my child as a problem? Is that acceptance? Is that a taboo? Very much correct. Okay. For a teacher, do I have to add this into my plan of action? Already too much pressure is there in the curriculum. We need to. Okay. Now, if I tell you that it is actually part of your whole curriculum system, okay, and I'm going to prove it to you now. Left side, can you see academics? Right side is your behavior. Both of them go hand in hand. I call it as a multi-tiered system, which you're already following it. You have tier 1, tier 2, tier 3. Correct? Tier 1 is all about 80 to 90% of my children in the classroom. We look in terms of what is their standard base of learning after unit test 1. Yes or no? You get the baseline? Now let's look at the behavior side. 80 to 90% of the children having positive behavior support and school climate. You connect the dot. Okay. Look at the tier 2. 5 to 10% of the children who are not doing so great, you get into a small group. Let me create the small group of the children and let me help them. Reinforcement is given out to them. Similarly, the children who are not able to do behavior wise, what do you do? You also create the rapid response team. Okay, let me help the child out. The child is immediately not able to regulate their emotions, not able to sit at one place. Correct? Similarly, tier 3 comes intensive, which is all about 1 to 5%, where individual intensive instructions and learnings are given out. Similarly, you do it on the behavior side. All of them, they work hand in hand, which you're already doing it. I don't say that this is something which you're seeing for the first time, as I told you initially of the workshop, that this is something which you're already practicing it. But what's more important is you evaluate, do profiling, which is nothing but defining, then you analyze, and then you implement, and then again you evaluate. Yes or no? You're already doing this, right? So if you see academically, you're already implementing, and take my words, you're already doing behavior side also, but might not be consciously. So if you go in a more structured manner, you can actually see in tier 1, tier 2, tier 3, in all the approaches, you are implementing multi-tiered system for academic and behavior. If this can be executed, you can actually see the kind of change what you're looking in terms of getting the positive psychology framework among the children. Okay. Yes, come. Yes. No. No, absolutely not. I have seen. Okay, so let me give you a couple of more examples. Certainly, more than happy to hear. Okay, let's do one thing. Let's now take a pause for a few minutes, and let's share the examples. So I have come across quite a few children. I've seen some of the cases where the child has performed very well academically. Graduation they have done from a esteemed university, and they landed up getting into criminal records. Yes, it is there, correct? And generalized way, correct? So, and I've also come across the students who have been performing on a regularly basis, like top 3 or top 1, but emotionally they are very, very weak. And if you look in terms of society tendency, it's a children with a higher aspiration. So it is nowhere related to it. On the other hand, I've also seen the children who are not performed very well academically. Slowly they have grown up to be. But again, it's a good behavior. So it works. So let me give you another thing. Okay. Let me give you another example. I think very, very interesting question what she has asked. Has good behavior is related to good academics, right? Okay. Now I'll tell you. SEL is what? Social emotional learning. It talks to you about introspection. Somewhere it talks about self-reflection. Self-awareness comes, okay? So let me give you an example. I will just take 2 minutes extra on this particular side. Is that okay with all of you? I hope the workshop is going interesting. Yes? Great. Okay, we Indians have one tendency. You know what the tendency is? So whenever I travel, I ask all the parents and teachers, are you enjoying the workshop? The answer comes like this. So this is very confusing for me. Is it yes or no? So give me verbally yes or no. Correct. So, and this also. So I'll tell you, if I talk about, right, I mean, I have studied in 13 schools. Okay, 3 schools I was kicked out because of bad behavior and poor academics. The irony was I went back to the same school and trained the teachers. Now, I failed in grade 12 in, I'm in mathematics. That's why I'm scared of maths. Okay, my father got me into engineering. He said, you have to be an engineer. I said, okay. And he said, I think if he's seeing me, I'm sorry about that. So he said, mechanical engineering you need to get into. So, but I said, I'm interested in computer science engineering, right? Now, by then, my behavior, it had become a rebel child. Aggression. Why? Because so much of failure, so much of throwing out, confidence has gone low completely, no friends around me, because bullying and everything was happening around, correct? Now, he said, get into MBA exam. I said, okay, fine, let me write an MBA exam because I have to ensure it's my father's wish and will. I wrote the MBA examination and my ranking was equal to Aadhaar card ranking. And I don't shy away, I tell it very honestly. Now, when I wrote that exam and I was like, now what to do? Now that's where the behavior transformation happened. Experienced that you failed so many times. You have been thrown out of the school. What about your self-esteem, your respect? Correct? Your about your self-awareness. You don't know about yourself. You don't know about your strength and your weaknesses. It took me almost 8 to 10 months to transform my behavior. Now that's when my behavior transformed into a good academics, landed up into Cambridge. It's a matter of 8 to 10 months. Introspection, then finally got into psychology. So it's a transitional change, the shift. And introspection is the key. If you can bring that introspection key among your children, your classroom management is just done. You need not to worry about that. Okay, so that's how it works in your behavior and academics both goes hand in hand together. Okay. Now, this is my favorite slide. The era of social emotional educators. Okay. What do we call ourselves as an individual? Even if you're principal, first thing comes to yourself as what? Teacher. Correct? Teacher is outdated. Then we call what ourselves as facilitators. Outdated. Just like generation. Then what do we call ourselves? Like next one. Motivators, mentors. Outdated. How many generations I showed you initially? They were on 6 generations, right? Now, as per the generation shift, there is a outdated happen. Now, let me tell you, now it's a time. We need to call ourselves as social emotional educators. Social emotional educator. That is where we have elevated ourselves to. Correct? It is because now children IQ level is already very high. But AI cannot teach EQ, can it? It cannot. Machine learning? No. It is humanistic approach as an human, as an individual. Can I teach social emotional learning? And as a teacher, you should call yourself a social emotional educator. That I am the front line for my children. Okay, I come back to this slide. Remember I told you the 90-day rule? It takes 21 days to form a habit or change a habit and 90 days to form a lifestyle. As an educator, if we can really get to know about my own core principles in social emotional learning and start implementing and executing not in our children, but in my day-to-day life, okay, then I'm going to learn something new today. I'm going to regulate my emotions pretty well, right? I'll become more ethically, more responsible for my society, right? If these are things which you start practicing it, you will see a transformation among whom? About myself. I always believe practice. Yeah. Other one, preach one. What is that? Preach what you practice, what you preach. And that's very, very important, dear educators. You need to practice first before you preach. If you can't practice, if you can't become master, then we're not supposed to be called ourselves a teacher. Correct? And this is where I say to all the educators that 90 days first you practice, it's the right time because now the new academic year is going to get started. So you have actually a 90 days with you to transform yourself, get into that 22% category. Okay. Now, how does the teacher SEL skills is related to SEL teaching practice? As a teacher, you are focusing on these 5 elements. These 5 elements do not go anywhere. Okay, these are the common 5 elements. You have to teach in 2 areas, social teaching practice and instructional teaching practice. You're already doing instructional teaching practice, yes or no? Right? But we have to add one more feather. What is that? Social teaching practice. If you get into social teaching practice, you see student-centered discipline, teacher language starts changing. Okay? Responsibility and choices, warmth and support starts coming. And that's where connection happens. Now, on the other hand, for the instructional teaching, you see children are more cooperative. Their classroom discussions are happening. More self-assessment and self-reflection happens. They are more balanced in terms of instruction-wise. They show academic press and expectations and competency starts building up. Now, this is the transitional change as an educator you bring in the minute you add one more cap, which is social teaching practice. Now, is it very difficult? It's pretty easy. It's all about how you practice and how you get the classroom executed, okay? Now, these are few of our findings. As I told you, as an organization, since we work with more than 500 plus schools, so we know over the last 10 years how much social emotional learning creates an impact. Now, if I tell you, almost 96% of children have shown a change about self-aware, importance self-aware, which comes in, okay? If I talk about 8 out of 10 children have seen a transition shift happening in terms of how to control my emotions. Okay. Now, 53% of the children have been able to find a tune with their emotions. So there is a shift happening. Now we are talking about, this is something, a database of almost 48,000 students, which I'm talking to you right now. So a significant amount of data over a period of time of one whole academic year. Now, is social emotional learning just helps in a regular classrooms? It also helps you in a supporting additional needs. It helps you to achieve your long-term and short-term goals. It helps the child to increase their self-esteem. So what, even if I have certain challenges, right? It really helps a child to explore more, become more confident about themselves. And we have seen it. There's a transition happening among the children too. Now, I believe and I personally advocate a culture of care need to be introduced in a school. Now, this care is related to in terms of when we say C is for commit, that means the kind of staff what we are hiring. The staff should be hired or pay based on skill and experience, regardless of what disabilities, regardless of what race, ethnicity, gender should not be coming over there. Then comes A is attract. See, I'm telling you about care. It's because we need to create what kind of environment? Happy school, right? Social emotional learning school. So attract is where we attract the employees, the teaching staff, which actually looks in terms of creating inclusive workspace, which is free from harassments or in terms of bullying. R is for retain. You need to retain the staff, which is already high performing, and you should be looking in terms of remove their barriers. And finally comes to E, there's nothing but empower. Empower each and every employee to promote culture of diversity and inclusion. So this is the first step. If we can create a culture of care, you're actually having the environment where everybody connects with your vision, the kind of vision what you have, you're going to lay down for the whole academic year. Then, post that, you need to have from periodic interventions to embedded culture. This need to be brought in. How this works is philosophy tools like your research, presentations, your protocols, what kind of support you're going to provide. Now, dear educators, I told you it's a most scientific program. It is not something which is being created. So you have the research and presentations which are available. Its first thing is you need to be convinced. If you are convinced, then it's become easy for you to convince your whole team down the line. Now, next thing comes. Now, even CBSE or NEP, everything has got what? Manual book, correct? We all have our policies. Why? Because this documentation creates a foundation base for us. And this is what it creates your philosophy tools to create as an SEL advocate school what I have created. Next comes to your mapping tools. You need to be looking in terms of how you're going to be evaluating your children overall progress, how you're going to map it down, how you will be ensuring that there is an overlap and gaps have been identified and reflected and worked around. Assignment tools, it's protocol and process to support each and every stakeholder. And then comes your scope and sequence. What kind of curriculum I'll be following and which will be part of my timetable. Why I'm showing you all those things, once again, I'm saying SEL can only be adapted by the children through whom? Through by us. When I say us, I'm including teachers and parents, both of them. Why? Let me tell you one more thing. Children are excellent in mirroring. Yes or no? Right? I think one of you also said, I still remember my teacher and I practice his or her style. Right? So mirroring leaves a last longing impact. How a teacher walks, how a teacher sits, how a teacher speaks, how their body language is. Right? I want to adapt. I want to take it forward because why? Because that teacher is my role model. Absolutely. And that's the beauty of SEL, which creates that kind of stronger impression about you as an individual. Now, if I talk about teacher-led, system-led model, which is towards social emotional learning, I'm repeating few slides in a different way. I hope you would have noticed this. You know why? The reason I'm repeating all these slides, sorry, so that the retention rate is more longer. We don't forget later, okay? That's the reason why. Now, teachers social emotional competence in well-being, which creates a healthy student-teacher relationship. Okay, it creates an effective classroom management. It also creates an effective SEL implementation, and which will result into healthy classroom environment, and students are social, emotional, and academic outcome you're gonna see. If I have to say other words, staff is happy, students are happy. Right? I can't more simplify than this. So this is how the correlation works. Okay. One more thing I'll tell you. I'll give you a very fun fact. As an individual, how many times do you say no in a day? Depends. As an individual, for yourself, professionally, personally, how many times do you say no in a day? Sorry, professionally, personally, there's no chance. Okay. So I'll tell you, in a day, if you analyze, okay, in a day, if not verbally, but within yourself, no. Right? Might be you'll be saying 5 or 6 or 7, whatever number of times, whatever numbers times. How many times do you say yes in a day? Many a times? Less times? Debatable? It's okay, you need to answer to me. Answer to yourself. Okay, so let me tell you. How does it work, okay? Let me tell you how does it work. Our brain always captures the lesser, it takes the first. How many letters no has? How many letters yes has? 3. If you always see, your brain will immediately incline towards what? No. Okay. So what I'm trying to tell you is that as an educator, if you become very conscious, you know when you have to say no and when you have to say yes. Especially with our children, no is a trump card. No is a trump card. It cannot be used every given time. No, you can't do this. No, you can't go out. No. Because no is the most easiest way to escape. Right? Instead of that, we need to get into responding situation, not reacting. Reaction is where we come out to be no. Don't do this. No, can't do this. If you keep on putting that particular hat, our creativity hat goes out and I wear the emotional hat. Right? So we have to get into responding. Responding comes through thinking through, taking a pause and then responding to it. This is the very important point I'm telling you for teachers, social, emotional competency, well-being, transiting into student, social, emotional, academic outcome. That happens only through connection. And sorry? Okay. I'll give you another example so that this example embedded in all your heart and mind as you leave the, for lunch. Now, tell me, as an individual, as we start growing up and up, I mean, we become a more mature, more wiser, and a lot of wisdom comes to us. We react very regularly. Yes or no? Yes, it happens. Why do we react? Because we are not able to regulate our emotions. Yes. Okay. Now, I'll ask you a question. Hear my question very carefully. It's a fun question, okay? Making it a little lighter. I know all of you are hungry. I'm just closing the session. Don't worry about that. So making it a little lighter. Tell me, you want to react. In a day, is one situation comes up. When you want to react, but you're unable to react. You respond. When is that situation happens? You want to react, but you're unable to react. And you respond. What did you say? I didn't hear, principal. Okay. Okay, that's professionally. Is there anything else apart from that? When the needs doesn't get fulfilled, okay? But no, when do we actually, we want to react, but we are not able to react? When is the situation comes? Relatives, okay? Relationships, could be husband, wife. Okay, so I've got very funny examples, okay? I've got answers like in-laws. We want to react, but we are not able to react. Right? My bosses, principal, management, I want to react, unable to react. Correct? So we respond. But we react in front of whom? Very regularly? Children. I will react because I'm not fear about anything. Yes or no? Okay. Now, don't worry, we are closing the session. I know we are excited. Now we are reacting. Okay, let's respond. Let's respond to the situation. Now, think. Okay, there is one person who is not in your close circle. All the people whom you have spoken about are the close circle people, your family, relatives, neighbors, boss, management, everybody are your close circle. But there's one person whom you want to react, but you don't react, you respond. Who's that person? Right? No, we react to them. Children are the one. Okay, I'll say the answer, you'll say, oh, I'll tell you the answer. It's a housemaid. She says, tomorrow I'm not coming. Your anger fumes up. About to say, face has become red. You turn back. You take a deep breath. Social emotional learning is happening, okay? Right? Take a deep breath. You start counting backwards. You look at her and say, it's okay. Because you've already thought about who's going to go out and run and search for another mate, right? What I'm trying to tell you is, the educators, that social emotional learning is something which you practice on a day-to-day basis. You have been practicing it on a regular basis. And it's all about how you practice and how you implement. You have been doing it, but consciously, if you implement and execute, you see a transformation happening, not only your children, but in yourself. Okay, that's the, and if I say you can create your own dashboards to really know and understand, because quantifiable way is a future which leads to. It should be data driven, like how you take out your marks, first, second, third assessment, how much the progress is happening, you can actually quantify it. And this can be done by Microsoft Unilever or any other way, or you can create your own dashboard if you're able to do that. I promise this is the second last slide. I've been shifting the slide and I'm telling you I'm closing it. I'll come to the end. I'll tell you about that. Now, so I'm more of a research-oriented person. I was doing a lot of research and I found out these are the few countries, they have some good name in the education system, whether it's a Finnish education, Singapore, United Kingdom, or South Korea. They have been implementing and executing social emotional learning for more than a decade. And what are the areas they are focusing? Empathy in classes. They talk about financial literacy. They talk about digital well-being. That's Denmark. Singapore talks about the character and citizen education. If I talk about United Kingdom, well-being for education return, and South Korea, creativity economy curriculum. Again, the best part about this whole SEL curriculum is it's very open. It's your creativity skills. It's your thinking skills. It's your vision, how broader and how bigger your vision is, and where you would like your children to learn and improve and inculcate about social emotional learning habits. So if I have to say, it's not about infrastructure. It's not about curriculum. It's not about resources. It's all about happiness. The whole objective is happiness. Are you creating happy human beings? And that is, can be done, can be achieved through social emotional learning. If you can create a happy human being, your purpose as an educator has been fulfilled. If you're still creating a rebellion child, you need to think through where exactly things are going wrong, right? And yeah, so I finished the whole presentation on social emotional learning, what we have been doing. I hope everybody had a good learning. Yes, I'm open for questions. Yeah, MyPigu. What's the name of MyPigu? Okay, great. So as I told all of you that I studied in 13 schools, right? I had my own, I mean, I never had that kind of trauma in my childhood days. It was a lovely, happy childhood. But I personally believed that every child will require certain support, certain help in some or the other way. And when we talk about mental health, when we talk about certain conditions which are very serious, I don't want to create a taboo. Already taboo is there. So let's make it more fun, more of curiosity, with a name called Pigu, which does not connect to psychology, right? So it's all about connecting to psychology in a more fun element way, where you're not getting labeled that you're going to MyPigu counselor or a special educator and you're going to getting a talk. Now, there's no meaning of MyPigu as such. The Pigu word was defined from a cartoon character called Pingu. Used to come during 80s and 90s. It was a penguin show, and that's how the Pigu word came out to be. Yeah. Any questions? Any questions? More than happy.
The happiness curriculum.
Yes.
So what do you want to tell about that? Whether it is SEL fully based, or have you researched on it, sir?
Yes. So when we talk about, okay, let me give you, there are 5 elements of social emotional learning which we spoke about, right? We call it, correct. So if I talk, correct. So it's all about like when we call it as a value education, moral education, social emotional learning, happy curriculum, happiness curriculum. You can name it whatever you want to name it. Unless you're able to meet the objective of these 5 elements, till then it's completely okay to call whatever you want to call it. Where the most important thing comes is consistency. If they're able to implement consistently and they're able to evaluate the outcome, then they can see how much is the overall curriculum getting executed and outcome has been derived. So you can name it whatever it wants to be named. So they're able to see the result. Because result is something I can't say until they need to say and they need to experience that. So if they're able to do it, great enough. But as far as what I have seen, happiness curriculum, it touch bases to all the 5 elements. It does. So again, it depends, sir. As I started the whole session, I said, it's my work to do. It's my passion to create an impact. That's where differentiation comes in. If I connect, I see the result. If I don't, I need to revisit. Any questions here?
Could you listen to that?
Yes. Certainly. Okay. Okay.
Sir, actually, SCL, there are so many models. Like, as you said, KSL is there, rulers approach is there. Like, we have EMC square framework. But as you said, many countries are developing their own SCL programs. We also have a lot of SCL programs in our country by NGOs, but most of them are based on the KSL framework, which is an international framework, but a Western philosophy. So we are just trying to develop a model which is based on Indian philosophy, because our Indian culture already had SEL rooted in its traditions. So we have also come up with a similar framework which has different dimensions, 5 dimensions, which are very similar, but one of the dimensions that is different from this is nature or prakriti, because that is missing from most of the frameworks that we studied in the Western context, because our culture tells us how a person has to create a harmony with the nature, and that itself helps. That's what I think ma'am meant when we go out to play, we automatically develop SEL skills. So that's something that we are still developing, but we have not reached a position to, completely share it, but maybe
Beautiful.
we'll come up with something
Very
like
good.
that.
So I'll tell you, Gurukul system,
Yes, exactly.
during
That's
our,
what we are.
early days. So I'll tell you,
Yes.
we are actually the educators. We are getting back to Gurukul system, by the way. Okay. Even the Western education has been adapting to the Gurukul system. What we had developed under the tree, we used to learn from the nature, is there something what Finnish education also follows it. Okay, let's take the children out, let them learn how the ants are moving, where do you see the leaf, what is the color of the leaf, how the teamwork happens. Everything is something from the Gurukul system. So it's absolutely right. Nature is very, very important to be added up.
And I have one more question. Like, as you said, we should focus on evidence-based SEL.
Yes.
So as teachers who are practicing in the classroom, and we also talk about, and NEP talks about 360-degree holistic report card.
Yeah.
So hopefully we will have SEL components in the report card as well, along with the academic achievements. Yeah. So what are the, like, I would like to know some assessment tools or methods that a teacher can utilize in their own classrooms. Like, you have spoken about SSIS, but it's more of a rating scale which might require professional help and might not be very accessible for a normal teacher who's taking a classroom. And one more challenge that I face is, how much can you depend on self-rating scale for SEL assessment? Because a lot of social desirability comes when you depend on SEL. So as a normal teacher who is not having a proper psychology background, but wants to assess a child's SEL progress that they have made based on their own SEL programs, what tools, simple tools that they can use, which they can document as well?
Okay. I think it's a very valid question. And if I have to answer, I think first basic thing is all the teachers should know about the basic milestones of the children. Age appropriate milestones, what children have been able to achieve, something every teacher should know it. Like, for example, if I talk about a 3-year-old child, don't expect the child to write the whole sentence, but should be able to hold pencil. Now, these comes through a classroom observations for any teacher. If she's able to observe the child and she knows about the age-appropriate milestones, then it becomes easy for her to do first step evaluation first. Second comes in terms of not the self-check. We do, activity-based approach in a classroom, right? Now, there are certain rubrics as a teacher, you can create your own rubrics. Those rubrics could be, is this child able to work in a team or not? Right? As you rightly said, not many teachers are aware about the technical knowledge of it. So simple rubrics can be created. Right? Then the third element comes, the child has to do self-evaluation. Not the teacher evaluation. Because if teacher is doing checking, might be there are certain elements the teacher is going to miss out. Now, based on what topic was taught, the questions can be created by the teacher. Like, for example, giving a story and asking, where did you identify empathy? Empathy is one of the SEL skills which need to be taught, correct? So now options are giving 4 options. Based on the answer of a child, you can get to know how much knowledge the child has gained from the last session of empathy or what friendship is all about. So these are the basic rubrics which can be created by the teachers without having any psychological knowledge or knowing about any batteries can be conducted. For that, I think the experts are there in a school as a counselors and special educators who can get involved in that. So that's what I would say, just to simplify. Any questions from all of you? Yes, sir. Yeah. Right.
It is, I feel that most of it is being, scope for it is being killed mainly because of the advent of technology. Everything is available to the child on the click of the mouse.
Correct.
Whether it is Chat GPT or DeepSeek, whatever you may name it.
Right.
So our days, like, olden days when we were growing up, all this was not there, and we started thinking over, trying to find the solutions for a given problem.
Correct.
Now the child refuses to think.
Correct.
How do we induce them to think for a innovative solution to a given problem?
Right.
Or a creative way of dealing with certain things? Right. We do have in the curriculum what is called multidisciplinary project, and we have some investigatory projects, but everything is cut, copy, paste from the social sites, like.
Okay.
So how do we tap their creative ability?
Okay. Good. Very good question, sir. So I usually, I think throughout the session, you must have seen I've used the word hat, right? Red hat, green hat. These are nothing but 6 thinking hat concept, which I personally practice a lot. So green is nothing but creativity hat. Now, whenever I speak to educators, I always say the most difficult hat to wear on a daily basis and every hour basis is the green hat, which is nothing but creativity hat. And creativity hat is something which children are looking forward from a teacher. Now, from AI generated image, I can get on volcano. How does volcano looks like? I can get a motion image also of a volcano. How does the eruption happens? Correct? Now, here is the thing, best part comes. As a teacher, look at the slide. Volcano is coming, eruption happening. What did you learn, dear children? One way. Dear children, there's a volcano over there. There's an eruption happened. And guess what? Let's get into imaginative world. Imagine if you are going at a speed of 40 kilometers and there's an eruption happens and you see a smoke coming out. What's going to happen? How fast can you run into a town? How can you save the people? What you have done? You get into imaginative way. You got into creativity way. You got into your voice modulation. The children start following up. That's why some movies we enjoy the most. We're sitting at the edge of the seat, and some movies are like, we know what's going to happen. So it depends as an individual how you bring your emotions into every classroom, and that's where your creativity goes to the next level. So this is what we are supposed to do as an educator. What happens many a times as an educator? I know, I understand. I'm also a teacher. I also go and teach in the classrooms. A lot of classrooms I take up with the children. And it becomes very difficult task to have that high energy level every time. Not possible. But I think it's our duty. How we change the gear of the car. Change the gear of your emotions. Come back, bounce back. Before they enter into any classroom. 5 minutes late you are, no? That's okay. But go and bounce back into higher energy, your higher emotions. You'll see your creativity is going to flow out like this. It's because of your low energy, the creativity becomes a question mark. Now let me tell you another thing. How many of you use Chat GPT? Is your dependency has gone high on ChatGPT? It's gone? Okay. I'll tell you honestly, I uninstalled ChatGPT recently. Okay. I'll be very honestly, I'm telling you. Okay. Because my dependency had gone so much. Happy birthday message in a fun way. I had emoji. Used to come from where? ChatGPT. Somewhere I felt my creativity is getting killed. Yes. So as an educator, now these are the things. So these are the things which as an educator you can teach your children. And the best way of teaching is not by telling verbally, making them experience. Come, let's do a role play.
Never speak in English, not even a single word, unable to draft letters. Whenever I ask him to please note down, he says, मैं वहां जाऊंगा सर, वहां जाके ले आओ. मेरे को पता नहीं था क्या है ये इतना बढ़िया सा लेटर टाइप करके ले आ रहा है. Then I came to know, I asked, what is the technique? Then I had come to know this chat
In a
GPT.
class of 40, even if a single child is there who does it on his own,
Correct.
then you can put it forth and say that.
Exactly. Sir, by default, all the children, okay, from the age of it's okay. By default, the children from an age of 3 and above, they know how to use a social media. When I say social media, YouTube comes in. Okay, they know how to navigate. They know how to click on skip button. 3-year-old child I'm talking about. Okay, as the child grows up, like Discord. Have you heard about Discord? Discord, only few of you are aware about. Discord is a messaging app, okay, which is very encrypted. What most of the children are using more than WhatsApp. You're not aware about that, but there are a lot of such apps are available. You cannot avoid children not to use it. What we can showcase that during our time, what we had the power, that they have not experienced it. Like how role plays can really help the children to overcome any obstacle of like, being more introvert in a classroom. Can I participate? Oh, my classroom can be so fun. Harvesting. I can enact in a classroom. Right? Correct. We used to do that. So we need to be implementing the same things. We can bring more, of course, you all are doing PBL method, right? Project-based learning. So that project-based learning can be enacted, can be implemented, can be executed in a more fun manner. And let them use AI also. I don't say don't let them not use AI because AI is the future. You can't completely, you cannot stop. You cannot, ask them not to do it. Dismiss that. It's all about as a teacher how much you're able to promote the well-being. Yeah. Absolutely. Correct. Correct. So I think the main issue first is come from as an adult from our side, how much we being creative, how much we are able to connect with our children. Then it comes towards the children's side because children will be reciprocating and resonating for what you have been giving in a classroom. Good. Okay. Can you go back to that brains? Very good.
To take care of me the same way.
Good. Now, if you see prefrontal cortex, right? This goes on till the age of 25. It's, till the age of 25, it completely get developed. So till the age of 25, children need that support, that nurturing has to be given out to the children. Now, it depends as an educator, you want them to depend on AI or on a humanistic approach. AI is going to be part of it by default. You can't dismiss it. But how much humanistic approach can you provide? It depends on your side. Because connection before correction is what I believe in. Right? Regarding your thing, I'll tell you how you treat, it reciprocates. Okay? So it depends on how you connect with your child, how you are able to treat, how they are able to experience your parenting. You will experience their child, when they become parenting. So this is how it works around, sir. Any questions? Anything else? Oh, I forgot there was an online.
Hello, sir.
Yes, sir.
Two questions I am going to ask you, sir. First one, assessment tools, easy and simple, she has asked. And you have said storytelling and relationships, you can ask questions, comprehension questions, and we can improve social and emotional skills in which we can do it. But is there any substantial evidence to report in the progressive cards?
Substantial evidence to
Report in the progressive card.
to report and progress.
Progressive card reports.
See, it depends on
See,
format.
we
to format.
require substantial evidence
Correct.
to award marks.
Correct. So I'll tell you, sir. Format. Like for example, we follow a different format altogether. We have a complete rubrics structured format where we record each and every child their progress on physical, social, emotional, cognitive, language. These are the 5 domains. Now, all these 5 domains are interconnected. Okay. So how a child is able to perform in physical domain under their age appropriate milestones will be connected to their social emotional aspects of it. Now, these are the standardized rubrics which are already available. Now, depending on school to school, if you are able to put those rubrics in your school, it can be put in evidence based. Now, the question is
it common in national words?
Yeah, evidence. I mean, your rubrics are common. Age
Rubrics are
appropriate
common.
milestones. Age appropriate milestones are common. But age appropriate milestones will be more than 15, 20 based on your school, based on your ethos, based on your vision. What are the top 7 you want to follow for your school? That's how it works.
Okay, sir. Okay, thank you. Next question, sir. Children of any generation learn what is available in their environment. Is it okay, sir? The
Right.
skills they learn, the abilities they learn, what is available in their environment.
Mhm.
If AI is available, internet technology is available, they will learn it.
Correct.
Cultivation is not available in their situations, in
Correct.
their environment, they will not learn it. So what wrong in learning AI,
Nothing
what
wrong.
wrong in science and technology, and why they are blaming younger generations?
Nobody is blaming anyone.
No. The problem is that we have learned something and they are not able to do it. What is this, sir?
Okay, so let me put out in this particular way. The point is pretty valid. Every generation, has certain ecosystem, resources for them to learn, inherit, practice, and go forward. Now, if I talk about baby boomers, okay, baby boomer was a generation when they saw more of a liberation was happening. Okay, but they were not. I would not say they were not jealous about the millennials because they were exposed to the technology. That's where phone was coming up. That's where it was becoming more of social media's first seed came in. Then came Generation Z, who started growing up with social media, and now Generation Alpha, which is getting into more robust, more diversified technology. As we get into baby boomers stage and Gen Z and Generation Alpha will be taking care of Generation Gamma, things will be keep on changing. Things will be keep on evolving. No generation is going to blame any generation why you are getting that exposure. I never got that exposure. The whole idea over here is being more mindful. Too much of sugar lead into diabetes. Too much of screen time, what's going to happen? Headache, eye power will go up, you'll not get a proper sleep. Anything which goes too much is not something helpful for you. The whole idea is how to bring the balance. So nobody's saying no for AI because AI is the future, but being more mindful about using it. Like as I told earlier, I became so dependent on Chat GPT that I also started asking Chat GPT, type me a happy birthday message. Such simple, which became a daily task for me.
Does it mean we have to create a balanced environment for the children?
For everyone.
It matters.
It matters for everyone, not for just children. For us.
For
as an
everyone.
adult.
For everyone.
For everybody.
So it is responsibility of the teacher and responsibility of the parents. Adults. So why to blame the children?
Nobody's blaming children. The whole idea is we as an adult. That's what I started when I started the whole topic.
I am asking about in the classroom or in the school premises. It is a responsibility of the adults and teachers.
Correct.
So there is nothing wrong with the children. So the things are always with the teachers and the parents. So children are not listening is our mistake. Children are not getting our points is our mistake. So we make the children to tune with us.
Correct.
So how to tune the children along with us is important. So we are learning here that one.
Correct, sir.
Yeah,
Right.
what I am saying is, so don't think negative of the children.
We should not.
Present generation or older generation.
Okay.
If you have enough time, you make them teach what you have, the abilities, the potentialities with you. If you have enough time. If they are learning something that is not your abilities, your potentialities, let them encourage them. Okay, sir.
Correct.
So from the very beginning, I'm observing here, children are adequated, children are taking these addictions, phone addictions, technology addictions. It is common for them. Let them use it. And if you have the capacity to turn them to your abilities, your capacities, potentialities, you can turn them, no problem at all. So it is responsibility of the children and the parents to create such balanced environment in the school premises, in the home premises, by the parents and by the elders, by the adults. So that concludes. Okay, madam.
So if I have to summarize, I think I'll tell you who labeled the children are bad. No. Hear me. Hear me question very carefully, okay? Who labeled that children are bad or they are addictive? Who? Did children label to themselves? Who? Adults. I'm not saying teacher labeled or parent labeled. It's adult. It's never been a problem with any children. Children are very pure. They will learn their limit. I told initially, children are very good at mirroring. They will mirror the way you sit, the way you talk, the way you behave. They learn from where? Adults. It's very simple. And that's why I said, as a teacher, if you can
have to make our teaching learning atmosphere into a happy school. Thank you very much, sir.
Thank you from the institute side also, sir. Within a shorter time, you could make it possible. Thank you. Thank you very much.
I want you to listen to the poem. In an anxious hour, nor in my book can I take delight, nor sitting in learning's bower, one throw with the May. How can the summer arise in joy, or summer fruits appear? How can we gather what grapes destroy, or bless the mellowing year when the blats of winter appear? Thank you, one and all.
Friends, we will start our today's afternoon first session. I think the countdown started now. We have only few hours to leave, is it not? We are fortunate to have our own internal resource person here, Professor I.P. Gaurama. We request you, Madam, you please take a chair in the dais. I request Anusha to introduce Madam. Madam, please.
Good afternoon to all. It's an absolute honor to introduce Dr. Gaurama IP, Professor and Head of Department of Extension Education at Regional Institute of Education, Mysuru. Dr. Gaurama has an extensive academic background with a PhD in Education in Learning Disability and multiple postgraduate degrees, including MEd in Special Education, MSc in Psychology, and MSc in Counseling and Family Therapy. She also holds a PG diploma in hearing impairment and a certificate in guidance. She has 35 years of extensive teaching experience at various levels, including school, undergraduate, and postgraduate levels, working with B.Ed, M.Ed, M.Phil, and PhD programs. She has worked extensively in inclusive education, supporting students with disabilities and guiding teachers and parents in tackling learning issues and to cope up with regular school subjects. Dr. Gaurama has authored books, contributed to research articles in national and international publications, and presented at conferences at the state, national, and international levels. She has also completed 10 research projects and served as a consultant on 4 educational projects funded by government and international agencies. Her work has taken her to Greece, Cyprus, Bangkok, the USA, and South Africa, where she has shared her expertise on various issues concerning education of children with disabilities and teacher education for inclusive education. Notably, Dr. Gaurama is a recipient of the prestigious Fulbright Fellowship in 2022 in the category Professional and Academic Excellence, during which she worked in Florida Center for Reading Research, Florida State University, USA. We look forward to hearing from her and gaining insights from her vast experience. Please join me in welcoming Dr. Gaurama. Welcome.
The day is getting warmer, and let me say warm good afternoon. So Mysuru is unusually getting hotter. It's not only Mysuru, I think everywhere we are facing the same situation. Anyway, we need to learn to cope with the existing situation. That's what is the lesson 1 of mental health and well-being everywhere. Sir, your name? Arvind. You're from Diet Nizamabad. Okay. This afternoon, hope you all had good lunch. Okay. Today, as soon as Arvind sir came here, he wanted to recite a poem by William Blake. And really, I thought that's the best way to begin this afternoon session. Yeah. And very much, is it because of this topic you thought of? Okay. Okay. Really, it was so touching. It was so touching. When I was, let me just, so we are, this curriculum and pedagogy, as we are all concerned with the school and the related areas, maybe at the administration level or at the teaching level, directly or indirectly, we are concerned with the school students. And one of the models which is being practiced so widely now is the whole school approach for mental health. And we know school is a wonderful place where we can give this initiation into we call it as literacy, mental health literacy. It's not just awareness. It's not just mental health awareness, rather it is literacy, because literacy is a little more than mental health, where you are able to mobilize something, take action towards it, and empower yourself, know what to do if I have this problem. It's not sufficient to know that this is the kind of problem we have, but a proactive approach towards requires mental health literacy. And as teachers, for especially the young children, I think we are at a most advantageous place of being inside the classroom, having an autonomy of creating our own learning space for the young minds with whom we deal with. Yeah. So this topic is very dear to me, because I always feel curriculum, through curricular objectives or curricular goals, what we say, as teachers, we have freedom to choose the pedagogy. What experiences we give to students is totally on us. Maybe at the higher level, planning, curriculum, textbook, everything is planned, and that comes to us as teachers. But we do have the scope of adapting the curriculum to the local situation, to the classroom need, and pedagogy we are totally free to do, though there are some suggestive ways which is given. So when I heard Arvind sir reciting that poem, I thought how well this is being thought of to put in the curriculum and how a teacher can deal with it. See, the idea of putting that in the curriculum is a wonderful idea. And yeah, and how I deliver it, how I transact it in the classroom is again a matter which I can take into the mental health perspective of the children. So today morning, I was just looking at a 9th standard. The Karnataka teachers may be able to relate with my example easily, but I don't want to keep the other teachers of the other states of Karnataka away from it. I'll tell you what it is. It will be there in other languages also. So I was just, because I go to the DM school here, you know, there is a demonstration school here. So I go there and we can choose the subject to teach there. Whichever subject we want, we can choose to teach. Just out of, like you have to find some, just like that you can go and teach. So actually I am trained, sir, you were telling, Markandeya sir was telling yesterday he was here from 86 to 92. Am I right? Because 80s, no, it has an association. That's why I remember. Because I left in 85, this institute. Yeah. And I was here from 92 as a teacher in DMS. So, but during that phase, I was not here. So when sir was telling about this, his learning here, I was also thinking like how we associate our learning. Memories come there, and 3, 4, 5 of you I remember were telling like it's homecoming, Make, and all those emotional aspects were coming in. These actually add calmness to us, these thoughts. So today morning I was 9th stand. See, sir, I wanted to tell this actually. I was trained here to be a science teacher. And I was teaching in DM school, I told, from 92 onwards. I was teaching maths. Because maths teacher was on leave. It was a leave vacancy. I joined there. I used to join whenever she would go on leave. But somehow I thought I was out of Mysuru or Karnataka for 10 years in RIE Bhubaneswar. Anusha said so many things, but she didn't tell that I was in Bhubaneswar. And when I came back, when this opportunity came, I thought I was deprived of speaking my language. I thought I must teach Kannada. Then which class? Then I was going through the books. I talked to the teacher. I selected 9th class. Because any class is enjoyable. Then today morning, I was just seeing, I was teaching one poem. I'll come to it later. But how curriculum and mental health are related, just to tell that. Really a wonderful beginning by Arvind sir. I really appreciate. I thought, my God, this is not coincidence. This is beyond coincidence. So many things happen at the universal planning. You know, what do you call that? There is, yes, really, it's celestial. It's not that. So when I was looking today, the first lesson in Kannada textbook of class 9, the title is Rama Rajya. All of you will understand this. Rama Rajya. Rama Rajya, ideal, yeah. But let me not say it is utopian. It is written by Vidwan Rangnath Sharma. The Kannadigas will associate. He is a great language scientist who has contributed much into Kannada literature. That first lesson Ranganatha Sharma has written, and the part selected is Rama Rajya. which is about Bharata coming into forest to tell his brother, come back home, come back and take the kingdom. I don't want this. And that was the portion which was selected there. It begins with how Bharata was looking, the kind of cloth he was wearing. He was not wearing any royal robe. He was wearing a very narumadi, we say in Kannada. And Rama could not recognize him. He had changed with grief, not eating food regularly because of brothers. So Rama could not recognize him, and the conversation starts. So many, each paragraph is a wealth of mental health. Okay, so many things. I'll just come to one or two aspects of it. The last ending of the lesson, it says, because initially Rama asks questions, how is the kingdom going on? Kushala prashne. Matte enu andre, how you are taking care of the kingdom, and some lessons. Like I remember one or two. As a king, how you should be, whether you are caretaker. Now he is the caretaker king. One or two of the things, caretaker king or king, whatever it is, he says, he asks questions, are you able to wake up from your sleep at night at time of need? That means one who is in public life, who is in public service, cannot enjoy Kumbhakarna sleep. You have to be alert in your sleep also. What a wonderful lesson for governance. Then the beautiful things are there. I can't tell all that. You read, okay? Then in last paragraph, it says, there are 14 qualities for you to be successful in ruling. So 14 qualities are listed. When I read it, everything applies to all of us for a better mental health. We may teach the lesson, like this is what Bharata says, this is what Rama says, he was what kind of dress he was wearing, what was the question he asked, what did Bharata say? That's the end of our teaching. So how we choose to take that pedagogy. See, when sir was narrating, the emotion which was there, that communicates so much. So in some of you have done PGDGC also, some of you were telling. So I remember in that guidance counseling book, in one of the skills of counselor, which is very essential for teachers, though it is a counselor skill, it's very essential for teacher, like your listening skill, responding skill, expression skill, like this. So I was just looking into that. I'm surprised, and even now my surprise continues. It says in the expression, 7% of our expression is from our words, what we say. 58% is gestural. And 35% is our tone. So that means very less we communicate with our words. So when a curriculum is being transacted, the gesture of the teacher, the tone of the teacher, everything matters much more than the words. So what curriculum gives is very minimum. Maybe the goal is there. The curricular goal will have, I have given Ramarajya lesson that the citizens of India will learn these governance and all that goal is there. But as teachers, when we communicate it, it just happens as content communication. It may be the example, not just language. Let me just finish the language. I took one poem. The name of the poem is Nannase. My desire. Yeah, Nannase. I actually contacted one Telugu sir here, Professor Harinath. He is a professor of Telugu. And Dr. Prasad is here, who is faculty of Malayalam. So we all sat together. Before I went there, I was talking to them and asking, Nannase means the poet has expressed her desire, what she wants to be. The beginning says, Badukabeku, ಅಡೆತಡೆಗಳನ್ನು ಎದುರಿಸಿ ಮುನ್ನುಗ್ಗಬೇಕು. We have to live. That means when we have come to this world, we have to live. ಬದುಕಬೇಕು. ಅಡೆತಡೆಗಳನ್ನು ಎದುರಿಸಿ ಮುನ್ನುಗ್ಗಬೇಕು. That means obstacles are compulsory, inevitable. Obstacles are sure, inevitable. Yes, just because adetade is there, obstacles are there, it doesn't mean you don't live. It doesn't say you don't live. You have to munnuggabeku. You have to cross that and go forward. All these things communicate a lot. And that poet in that poem, she writes about how she wants to be a person of helping so many people. Like she says, like I want to be the batti, the wick. I want to be the wick which burns itself to give light to others. I want to be in the soil, a tree, to give shade to the people who come looking for it. So totally the idea is to say that my life, I want to be of use to others. So we all know happy hormones are secreted when we do things for others biologically. And this type of poem, when we narrate or discuss and do at length, students also develop that kind of thing which is good for them and for their society. But it depends, curriculum is there, but it depends on the pedagogical approach. What approach you follow? How do you teach it? You read the poem, make them read, question, answer. That's also pedagogy. How? Synonyms. So you do that. So that is where teachers are in a wonderful position to really take mental health lessons through the, and we don't have to do anything extra. No, Telugu sir, na. No, I didn't come to it. That Telugu sir, I discussed. He said, so sorry, did I communicate anything? Telugu sir ke saath I discussed. I asked, what is there in Telugu? He gave me a beautiful poem. I have it in my phone. Malayalam sir gave one, Telugu sir gave one. I want, because it's class 9. Just teach it and my emotions. I just wanted to bring the contemporary situation. Telugu sir gave me a poem which is written in 1908. Okay, where one poem, I asked them about their desire, where it is there. It is in the textbook. It is about a person. The poet is saying, I can read it if time permits. It says, you will find it. Telugu people will very easily find it. It says, I don't want to be at the feet of the king asking for benefits. I don't want to go behind a rich person asking for money. 2-3 things like that. I want to be, yes. Soldiers serving the motherland. So I was thinking, see, that was the time when India was under the rule of somebody. And how that poet, say, because Raja having money was big that time. But the poet says, yeah. And in Kannada, K.S. Narasimha Swami has written, which is, he is that romantic time poet. After independence, before freedom, our mental status was different. And see how the time changes. K.S. Narasimha Swami writes, Hakkiya hadige taleduguva hu nanaguva ase. The beauty of nature. I want to be the flower. which will be singing for the moving with the wind and all these beauty of nature comes there. See, sir is singing. So nice. Yes, that is also part of pedagogy. Yeah. So everything. Oh. Anyway, we all object that here. But no. But in Kannada, there is a poem which says, the success of the flower which is blooming either to the hair of the woman or to the feet of the god. ಕನ್ನಡದಲ್ಲಿ ಇದೆ ಅಲ್ವಾ, ನಂಗೆ ಮರ್ತೋಯ್ತು ಅದು ಹೇಳಕ್ಕೆ, ಇದೆ ಅದು. So every content is chosen in the curriculum and the framework, keeping these as curricular goals. English, how pedagogy can bring it out, because only teachers can do that. Even that Robert Frost, the woods are lovely, deep and dark. Yeah. But I have promises to keep, miles to go before I sleep. See how much it communicates, no? Yes. Every content. So when it comes to, we can take science, social science, or everything. Yesterday I was observing a class of one of our students, macro teaching they practice. So students just took 2 lessons. So today morning when I have to think of this, I thought how those lessons can be taken with this mental health perspective. That is harmony, confidence, humbleness. Humbleness is something which is so much there in science and literature. Lots and lots. ಮಂಕುತಿಮ್ಮನ ಕಗ್ಗದಲ್ಲಿ ಒಂದಿದೆ, ಇಳೆಯೊಡೆದು ಮೊಳಕೆ ಒಡೆಯೊಂದು ತಮ್ಮಟೆಗಳಿಲ್ಲ. The seed which germinates through the soil, it doesn't make any noise. ಬೆಳಕೀವ ಸೂರ್ಯ ಚಂದ್ರರ ಸದ್ದಿಲ್ಲ. The sun and moon which comes daily gives so much, they do not make any noise. ಫಲವೀವ ಮರವದ ತುತ್ತುರಿ ಇಲ್ಲ. The fruits which gives it, ಹೊಲಿ ನಿನ್ನ ತುಟಿಗಳನ್ನು ಮಂಕುತಿಮ್ಮ. What humbleness lesson it is teaching. These are all there in school books. They have chosen, selected. Yeah. Anyway, let us, this science lesson I'll just give as an example, and then quickly we'll pass on. Whatever I have in the slides, I have told already. Don't worry about slide 315, I'll let you go. One student was teaching about the transport system in plants. The transport system, okay? You know what is transport system. So the root absorbs water, but it reaches everywhere to the tip of the leaf. And the leaves prepare food, but it is reaching every corner till the deepest of the taproot in the plant. So there is a transport system and there is no clash. The xylem, the vascular flow of xylem, see again, it is anti-gravity. It goes from bottom to top perfectly. It perfectly it goes, no accident in between. No, even if hurdle is there, it knows how to shut its mouth and reach its destination or do its work. Its work is supplying water for photosynthesis. So phloem. So the leaf will prepare, then again see, one is going like this, one is going like this, just like our highway. But absolutely, it knows its duty, it knows its route, it happens in the same way. There is no clash. How beautifully nature has kept the design, which we can learn from. And one student was teaching about respiration in human beings. This, when air comes inside, so the lung knows to separate oxygen, and the cavity knows, the chest cavity knows how to adjust with the pressure of lungs. See, the lung, the pressure inside the lung and the pressure of the chest cavity has to balance. Otherwise, it will blast. The diaphragm does that job, moving up and down as we breathe in and breathe out. How cooperative it is. And when you think of this respiratory system and circulatory system and excretory system and all that, lot of coordination we learn from that. But in just this, taking in of oxygen and giving oxygen, the organs are so well planned and they are functioning so well. Yeah. And really that mechanism of diaphragm, which increase and decrease the pressure of the cavity to suit the pressure of the lung, is really so beautiful. It's designed so much. We need not take much time in the class to explain all these things, but we just have to draw their attention into those points. That's all. This xylem phloem also, we don't have to teach about road transport, this transport, all the, not much is required. Just to draw their attention about the harmony with which things are happening. Every lesson you choose, you get to see these. Yeah, so much it. So you do good karma, bad karma. So Newton's law is simple, but you should put the children to think about it. If we just do it as content, that's all. See something. ಇದು ಆಗಲ್ವಾ? Next ಮಾಡಿ. I remember when I was a small child in school, primary school, there was a lesson, this good karma, bad karma reminded me of that. The lesson was Pratidwani. Pratidwani is echo. It's very nice. One boy runs out, he goes to the woods and he'll come home running, crying. Somebody in the mountain is scolding me. Somebody in the mountain is giving, okay, he'll say. Then his mother will ask, what happened? What did you tell? And all that. Finally, he comes to know that whatever I say, hey, you, this idiot, this, that, if you say the same thing will come back. So it is like Newton's third law. Okay. It doesn't work. Is it working? Okay. So with little background, so we know the type of situation our youngest generation is in our schools today, because they are having, it is, adolescence is the stage of stress and storm. It's a well-known statement, but the present condition is adding to that because of the variety, opportunity, information overload. All this is adding to the stress and storm of that extreme level of competition. So what is our concern? All this is affecting the learning of our students. So I just want to bring in a little bit of NEP, because NEP is really giving a very focused attention towards curriculum and pedagogy for different stages, right from foundation stage. It talks, it relates, anything they say, you think little more, it relates to the child's comfort, the pedagogy, the developmental stages, the cognition, the child's physical health, child's mental health. So stages of schooling, the way we have to deal with children, utmost care is given not for cognitive development, but for happiness of the child. The comfort of the child is the focus. So that is where we have to think of NEP when we are relating curriculum and pedagogy to mental well-being. So of course, pandemic is one, but I think we have forgotten pandemic. We need not talk much about it. But pandemic is something which opened our eyes towards the youngsters more, because they were the sufferers. So this is just a little bit about, this is a study, the reference is here, which gave what are the factors at the secondary school which affect the mental health of secondary school students. So this is based on a large survey. They have identified, see, there are social factors, biological factors, and psychological factors. I was just looking into these factors. Okay. So which of these are independent variables, and how it affects, because independent variables, we can change it, we can control it, we can manipulate it. So what is that? Which are those variables which are affecting in the secondary level, which a teacher can change? With that intention, see, grades in the social factor, grades is one. I think as school teachers, we have a big role in it. Giving grades is okay, but how we talk about it, how we project it, that affects the child. So that is one of the major factors which we can tackle. So NEP again comes to our helps when we go for holistic 360-degree assessment. So grade not just for math, science, social science, but for every personal quality, not just for every personal quality and subjects, but also for the talent. Every child has, every one of us, why child? All of us have some talent, but it is not recognized in the school context. NEP has given way for it. That is why that freedom to choose from vocational areas, art, sport, that gives confidence to children. I am good at sports. Let me take sports as a subject, which is no way less than science. So that's beginning now. Our schools may not have changed because the society has to accept that, and we have to come to that level, but definitely it is going to change with this. Art, we have a provision of choosing from art, and there are interdisciplinary areas. We don't have to be stuck with math, science. I like math, but I don't like calculus and trigonometry. So that option is there in the interdisciplinary basket of subjects. So I can take that. Science, I like science, but I don't like to do these chemical equations and calculations. I don't like. So environment education is a wonderful interdisciplinary option which is given. So this, how we, NEP gives us space to move away from this grade, or every child will feel good grade in some area or the other, that gives them confidence. I may be good in environment education. I may be doing a very good project. I may be producing something, because assessment is not just paper pencil, but performance, and 360-degree assessment also means that assessment is done by even community members. Maybe again, the sir is not there. Utopian idea. But when idea is there, it will slowly come down. We will all change. It may be, I am hoping by 2040, that reality we may be. I want to live till then to see that situation. Yeah. Oh, thank you. So psychological factors. There's no peer is one factor which we can pedagogically we can tackle it. The peer group. Peer is a wonderful resource for learning. How we make use of peer for learning, that will reduce this psychological variable which is affecting the mental health of children. So this is just to draw your attention what we can control through curriculum and pedagogy. So these are some instances which I have taken. These numbers are very, very worrying. See, the death of adolescents, 10 to 90. Everything could be prevented, but it's a, see, 3,000 every day. It's a big concern. See, the leading cause of death was road traffic. So xylem and phloem should really help us to have our sense when we are in the road. And most of the mental health, they say half of it will start by the age of 14, which is mostly undetected because we never think that children, maybe no personality disorders, origin is adolescence only. If we can identify, help, so our area or our possibility is curriculum and pedagogy. We can address it. We can talk about it. We can develop mental health literacy among them that will make them empowered to take care of themselves. Problem is there, but problem solving, they become solvers of problem. So the window of opportunity. So let us give support to our children. Can that go, Anusha, or parent Nandana? That the top bar. No, it's no. I just wanted the top portion to be. Yeah. Thank you. Thank you. You go to that. It's a knowledgeable person to. No, back. Okay. Okay. I'll go back. This is not. No, the difference between a knowledgeable person and a loving person, the knowledgeable person can show us how wonderful the world is. But the loving person only can show us how wonderful we are in the world. So as a teacher, we really have to be, we may be knowledgeable. We should be knowledgeable, no doubt about it. But more than being knowledgeable, it's important to be a loving person because they become self-learners. If we create that opportunity, if we are loving, if we are developing that confidence in them, they become self-learners. They don't need us to give them information and develop their cognition. The world has enough opportunity to develop themselves. So we have so many people like Mother Teresa who have shown us the simple ways of doing great things. Many such people are there. I just have put her. So very little, I have already talked about it, the NEP perspective on curriculum. You can remove NEP or you can keep NEP because before NEP also these thoughts were there. It's not, but NEP has stressed on it again because it's required. It's still not done. It is not reached the level where it has to reach. So see, 1964-66 commission report and the 68 policy also has mentioned about the importance of the child-centeredness and all that. But now we have further emphasis on these things, including all these things. capabilities of learner. Which capacity we are not saying. It may be some skill. The child may be interested in something very different, in a martial art form. There are very beautiful martial art in every region, isn't it? It's all dying. Who is learning all those things now? The schools are closing. But NEP says that can also be a curriculum in that art form. So develop that. That has significance because it has knowledge also in it. There is a lot of history. There's a lot of knowledge in every art form. We need to bring it out, construct into a curricular form and help children learn that. I was just reading about, I know in Karnataka, this Yakshagana, Mate Kerala-dalli Kathakali, Bharatanatyam, that is the, Kalaripayattu is another one. See, lot of sciences there in Kalaripayattu, the movements, the body and the rhythm. Yeah. So actually yoga, already they have put that in NEP, NCFSE. Yoga has already come. But they have kept it open. We can put anything depending on the, I don't know, Manipur, one art I was... Manipuri, it's not dance, it's a martial art, Thangta. It's a wonderful martial art, just like the kind of different martial arts which we have here. It seems it has a lot of cultural relevance also and geographic significance. Everything will have there. So all that will be revived. So capability of the learner. If a learner is capable in that, why not develop in that? That possibility is there now. Ultimately, we know one of the aims is economic participation, just like cultural participation, democratic participation, economic participation also is one of the aims of education, which we have to see that our children, because this is what gives them confidence. Many children in high school, I have seen, they're so much worried that we were never worried in high school what I'll do, where I'll get job. These girls also will be worried where I'll get job. They're students, no? A kind of students. So I have seen the research scholars, the major worry is where will I get job, when will I, they're not worried when will I get married. Actually, that should be the real worry. Oh. So, high school. Changes, the pedagogical delivery changing with the stage of development. In foundation stage, what is that? Helping them for their overall development that way. For a secondary stage, how it should be, the inquiry driven, curiosity fostering, that type of a pedagogic delivery. Respect towards duty and value. See, when we, through curriculum, lot of these things we have to bring in as per NEP, and the possibilities are there. Assure cognitive development, the 21st century skill and all this. And of course, child should be happy. In Delhi school, there is happiness curriculum, no? So, hope it will continue now. Happiness. Yeah. And then going back. Why principal is sad? See, there is stress on indigeneity, and NEP might have said that, but we all know how much we love our socio-cultural context. Our learning becomes meaningful, and our learning becomes connected to our context. It has more meaning. That is why when we give examples, at least if we can talk about the local context, children will relate it easily, and there is happiness. Socio-cultural, the background of the child also. If we give school, yes, and no, they feel that, oh, the school is giving something no, which is dear to me. Many people, especially in Mysuru, how many typical Mysoreans are here? I am not. That's why I'm asking. Any typical Mysorean? Anyway, even if you are there, typical Mysorean, no, they'll say, "Ivulu ಸ್ವಲ್ಪ ಇದ್ದಾಳೆ." The typical Mysorean will say, if some drops of rain they see from far off place in Chamundi Betta, they'll say, "Oh, male barta ide," they'll not venture out. But Kerala people know, they always walk with one umbrella. These are the two important. Yeah. So, see, umbrella is invented. So, why fear rain? The next step is dance in rain. So, what skill we have to nurture through our curriculum and pedagogy is responsibility, because learning also, it's not the teacher who is facilitating learning. Children are learning. We have come out of the zamana of teacher is a facilitator, teacher is a guide. We have come out of it. Teacher is a learner. Teacher is a co-investigator with them. They are the main. They learn. They have that capacity. They have to take that responsibility. So through conducting experiments, through giving projects, what happens? They own the responsibility of doing something. Through that doing, the learning happens. Learning is always appreciated by everyone, I have realized. One example is just 2 days back, I think Tuesday, our institute is running I think 2 Lakshadweep people were here. They're not here. Oh, tell them their absence was conspicuous. Because, noted, because you remember what he said yesterday. We are trapped here. So they have escaped now from the trap. Anyway, the Lakshadweep, yeah, really. Why I thought of this example, I don't know. Because I remember one person, no, they used to call him, they were here for 6 days for another program. And one person was called as Amitabh Bachchan of Lakshadweep. No, the they were just, I was telling about the 6 days program of library science, okay? It's a certificate program in library, school library. So they learned library automation, online search engines, and how to install it in their schools. Complete digital library. 3 days they learned in the lab here, okay? In the valedictory, the way they expressed happiness over those things, all like, age is like around 40, 50. So I really saw the happiness of those teachers because they learned so many things new. So that means learning is something which empowers us, which gives us so much of happiness and satisfaction. Learning. So children will have it double than what we have, because we have so many other things. But children have only that. So if that learning, I have realized, if you give project, if you give them something to do on their own, there's a lot of ownership. They enjoy doing it. they come out with that pleasure of that they did it, they learned it. So learning is not just the content, they learn everything. How to talk to others, how to go about, how to find out something, everything they learn. So this in that program, and everybody were expressing, I realized there is no limit for happiness. The ultimate happiness, I think, when something is learned. So we have forgotten it. We have covered it with in heladu dust, doolu. We have covered it in this mad world. Where is the life we have lost in living? There is a ये है ना, क्या है? Where is the knowledge we have lost in information? Where ultimately it is in Kannada also. There is a beautiful line by Basavanna. Dinavella kurulaayudaitu attu attalilla unisu unalilla. I have been searching for firewood whole day. I did not cook. I did not eat because I'm busy with searching for firewood. So we are losing the essence. So we have to dust ourselves away, and we should really prepare food and start eating. What our soul really wants is that knowledge is empowerment, knowledge is enlightenment. So we should see that every day we do something which gives us some new learning, which will brighten our soul. So caring about others, these are the skills to be. See, through pedagogy, we can do all these things. Caring about others, problem solving, moral values, character development. These are the skills which need to be nurtured among our younger generation. So this is some guidelines on lesson plan development. So communication, we have to encourage. Communication is something for interpersonal relationships. We need communication. See, inside the class, we can give some task, group work. They enjoy the communication. They develop their communication, and communication is not just for language. Communication is for emotion. It's for emotional stability. See, have we not realized when we say something, we feel so relaxed, so relieved. So we have to communicate. Yaudu heli? Kannadana? Oh. Really, every piece you pick, you have something there. Thank you. So, see, we have to encourage interpersonal, that is outside classroom also, and this exploring the surrounding, because they get connected to the nature, and also they know not just the natural world, the social world also. We have to connect our students. What they see, they have to record also, which whatever form it is. It may be narration, it may be written, it may be drawing, it may be gestural. They have to. This is another pedagogy, discussing with parents. When I taught that poem to 9th class students, Nanna say, I told them, you talk to whomever you know, either in person or phone, to your relatives, or you know somebody in your surrounding family. You find out if they know any story or poem through which they have expressed their desire. So that is the way they get connected to the elders, and elders also love participating in the, we call it as intergenerational dialogue, which is something, one of the reason for deterioration of mental health. I need to go to them and talk. I learn so much from that younger generation. And they should also come to us. We should have that cordial communication, or what is that? Dialogues. It may vary. The idea may vary, but still it is interesting to know each other's viewpoint. The classroom environment also, at a physical level, it should be comfortable. When Girish enters, it is an indication, non-verbal indication of concrete, not a small way, no. So everybody will notice. Now I have to stop. See, can we develop friendship, love, and acceptance? Recognize the strength of every child. You observe when a child who is not noticed much, if we give value to what the child is good in, the child is very sensitive. If we simply say this is nice, they know that we are simply telling, it's flattery. They will know what they are really good at, and we should identify that which gives them a lot of confidence. And as teachers, if possible, we should give little time other than the classroom. Sometimes for the classroom, because in the timetable, my time is that, you take that time not for the content, do something else. You take them out if it is a manageable class. Even at our level, I have seen my students enjoy that. If I take them outside, they enjoy. That is, yeah, they love that informal time. Classroom, the timetable, the room itself. Just, 2 days back, I have class here in room. Back, sometimes when I need a PowerPoint and all that, I take the students here. That day, I didn't have time, PowerPoint or anything. I went there. I just came and saw this room was open because one program, that library program was going on, but they were using the other rooms. They used to come here at times. This room was free. That was just, I told that room is free. Should we go there? Suddenly, all those, they took their, we will go there. So just coming from there, that room to here was enjoyable for me. Huh? Yeah, oh, there are a lot of ways with which we can develop their identity. We know adolescence is the stage. So towards talking, that's what, communication, which we were telling. Talking in pair, small group is one of the pedagogical processes. Give some question. Instead of asking question directly, we can just say, talk to your friend, and then you say. They're so happy to do it because partner in crime, even if I say wrong response, I'm not the only one. The pairing is a beautiful way, and they like also monotony breaks, no? So even, I'll say 30 seconds, talk to each other. Oh, they love it. There'll be a buzz, and answering becomes better because it's a collective answer. Collaboration, yeah. There was a question.
There was a question in communicative English, a factual passage the children had to write about how to make a cup of tea. When I read the answers, I could understand that my class 10 children haven't gone to the kitchen at all. So what I did was, with my 9th standard, I told them, okay, tomorrow we are going to prepare tea. So group of 4, you bring all the ingredients. And yes, they prepared tea and they wrote. Then I told, okay, now you write a factual description about how you made a cup of tea. Before and after the experiential learning, the difference that I could see, this is what about pedagogy. It's just about writing we assumed that children of class 10 will know how to make a cup of tea. But they did not know. They were putting 3 tablespoons of tea leaves. They don't know how much sugar, add sugar. But actually, when you write a factual description, you have to give the exact amount of what is added, how much milk, how much water. Actually, the children did not know. So when they actually did it practically, I think all the children in class 9, they were able to do that. I mean, write the factual description about how to make a cup of tea.
description, but we don't see that they get that experience. Yes. Because we, as you rightly said, many things we assume. But that may not be true.
It may be too simple. Making a cup of tea is too simple for class 10 and we assume that they'll do. But they were not able to do it.
They don't know what they miss. Now tea is waiting. Anyway, tea, the talk of tea has come. The second indication to me. One indication, as you said, it was very, what did you say, sir? No, not Anil, sir. When Girish came, you said the concrete. Yeah. This is subtle. So let us start doing. Thank you so much for the lovely interaction.
Yeah, I think post-lunch session was very interesting from our own internal faculty having a lot of experience in this way. I hope there's still some of the doubts. No, you can have, all right, clap first. Yeah. Okay, correct. Yes. Yeah, correct. Because experienced practitioner, pedagogist, psychologist, counseling expert, all are in one. That's how the magic has happened. But still, some of the issues are there. You can ask, madam. Yeah, please.
So the anecdotes that you quoted is the main reason why it flew up so fast. Right. Yeah, ma'am. Like all the anecdotes I learned from Regional College of Education, Mysuru. I don't call it as RIE. I still call it as Regional College because while I was studying, it was RCU. So, ma'am, I have one request. Like, if something can be recommended to NCERT in designing the curriculum, there must be a subject on financial discipline to the children, ma'am. Yeah. It is there, ma'am. Financial discipline.
No, it doesn't say financial discipline. The name is something different, but the
see, the child
it covers all that financial discipline because literacy is a broader term.
You must have read that novel, The Rich Dad and Poor Dad,
yes,
written by Japanese writer. So some kind of financial curriculum should be there in the before 10th class when they come.
Yeah, it's there.
How to add value to money.
Actually, NCFSE, if you look at, they have given the areas. They call it as curricular areas. From each area, how much you can choose, all that is there. One, that interdisciplinary one is there, where this financial literacy is there. And they have also given freedom to the board or the group of schools to add to that also. So we can add, autonomy is there to add, and if what is required for our students, we can develop that. But the people will go by what is given there because it is existing, easily available. But we should really come out of our comfort zone and make our own curriculum. For example, Kalaripayattu, if you want to make it into a curriculum, or Thangta, if you want to make it into a curricular area, we need to work on it. We need to dig out the knowledge in that area. We have to bring the history, the culture, assessment aspects. That we have to, that is our role. That freedom is given now with NEP.
The new textbook in which the last lesson is about Ek Bharat Shresth Bharat. They have taken different. So in that, the teachers, like how you say pedagogy, we can innovate different things, not just stick on to the textual what it is. You can even teach them Kalaripayattu because there is something about coconut shell of Kerala, the art. So why not go to the dance forms and the Kalaripayattu if it is in a Kerala school or some teachers who are there who know about it. So that is what, huh? Yes, that is the project work what the children can do.
Very sorry, we forgot the online participant. I have forgotten. Big number is there. So any sharing from the online participants? Because the students in this class are dominating, over-dominating.
Any online participants? It's allowed to mute yourself now. If anybody wants to share or ask a question, kindly unmute yourself. We can.
Hello, ma'am. Hello, ma'am. Can you hear me?
Yes, sir. We can hear you. Please carry.
Sir, I am Rahmatullah from Lakshadweep. And nowadays, the number of hyperactive students are increasing. I think everybody have that concern. But teachers are very much difficulty in facing or handling such students. Is there any way?
Student?
Sir, could you repeat question? Which kind of students?
So hyperactive students nowadays, the number of hyperactive students is increasing. Is there any reason behind it? Whether it is the condition of our food problems or anything, or how can we handle this? How can we handle this type of students? Teachers are not at all aware of this for handling such students.
Yes, it's really a concern. We are also observing whether it is hyperactivity, more than hyperactivity. I'm also observing attention deficit as one of the major cause, and many cases it is associated with the higher activity level also. The cause maybe, as you say, food may be the cause, or the type of surrounding which we have. There may be many causes, but as a teacher, what we can do, we can just think of one or two ways of engaging students who have lesser attention span, and because they are associated usually all hyperactive students need not have attention deficit, but usually they are associated. So what we can do is we can identify their area of interest and give that pedagogical activities through that their interest area. We have to engage them, give them some recognition, value their work. All these things make them concentrate to some extent. Slowly we can increase that. But definitely with lot of love and acceptance, if we start, a good beginning will be made. We have to accept them. We have to, sometimes we even try this physically, you just hold the child like this for a while. It may be on the hand or on the shoulder. Just a touch and hold for reducing hyperactivity. So an adult together, like teacher can be together with the child. I was telling you how adult dialogue is keeping them hooked to certain tasks. Do a task in the presence of an adult. They love that. So that is one suggestion I'm giving. You can try out what the child likes. Take the child out of the room. That is also one lovely way of keeping. But when you walk out, it's nice to hold the hand of that child who's hyperactive. They love that. But we have to see, some children may not like that. We should not force.
Yes, ma'am. One instance has happened. One teacher, actually, the teacher does not know whether he is a hyperactive student. So he sent me as a HOD. He sent to me. So what I have done is, as ma'am told, I take him to our vegetable garden and pluck the vegetables and doing such things, he finds very happy.
That's really nice to know. See, lot of botany, reproduction in plants can be, we don't have to teach. Take them to if the garden is there, they can propagate also. Cutting, through seed, through layering, through grafting. They can do it. They don't take, it doesn't take much time. Actually, in 1 second, you can just make a hole in the soil and put one seed. It keeps doing its job. Only thing is, maybe one corner of the eye, we have to see whether water is given there or something has destroyed it. That's all. It'll be doing its work. So let them do. As ma'am was talking about a chance to make tea also. Sometimes we think, hey, this sounds very silly. Should we do it? We think, but all these things are essential now.
Thank you, ma'am. Thank you, ma'am. Thank you very much, ma'am.
Any more questions? Online or offline?
Hello, good evening, ma'am.
Yes, ma'am.
Ma'am, I'm speaking from Andaman. My query is, our focus even after NEP in a big way has not shifted from achievement in terms of success in competitive examinations, right? So how do we convince the students and parents that the success in competitive examinations alone is not parameter for success in life, and that the alternative areas can be explored and they are equally worthy? How do we convince parents and students?
No, really a very relevant question, that because these are one of the reasons for deterioration of mental health also. Unnecessarily, they will worry so much about the competitive exams. And as you rightly said, they don't see any other option other than what they are aiming at. But really, it may take some time, but right from their school age, NEP has given that option. Give them more options to look into vocational areas. We can identify what they are good at, what they like. More than anything, we give them an opportunity to know their own strengths and weaknesses by participating in vocational areas. They will know, oh, this computer software, I'm not good at it. They realize. Then they can tell their parents, I don't want to go for computer engineering. They will say. So it might take some time, but you open up other options to children and conduct certain school, the career development programs in your school, so that parents also become partners with you, because you need the community. If not parents, you can do it with a community around the school. The society has to accept. It will come slowly, but definitely you can give wider options and give chance for them to identify their own strength.
Yes, ma'am. Thank you. But don't you think that we need to do some exercise to change the mindset of the society as well? Because wherever we speak about careers, career counseling and things, at the end of the day, we land somewhere near these competitive examinations, monetary benefits, things like that. So don't you think that there is a need for an exercise to change the mindset of the society at large?
You are really asking a very basic question for which there may not be a easy direct answer. We all have to brainstorm and come out with certain ways of changing the mindset of. One of the ways of changing the mindset is the new policy and its implementation, where disciplinary boundaries are blurring. You choose from vocational area, you choose from physical education, art. There is no hierarchy in discipline.
That's true, ma'am. But at the same time, when we encourage them to go for unconventional options, at the same time, what happens is that the world out there, they have a specific, kind of, what should I say, stigma, something like that about what the children choose. So probably there needs to be expansion of the, to broaden the vision and the mindset of the society, isn't it? So obviously we as teachers will be, it is in our hands to do a lot of things related to this. But even then, what I mean is from a more authoritative side, or from the side of the government, or from the board, etc., etc., you are at a place where you are part of policy making in education and things like that. So probably that may be a very important thing. Thank you for your
No,
response.
thank you so much for this suggestion. Really, this can go as one of the outcome of the regional consultative meeting, a public awareness, public education about these matters. The coordinator is also here. I will also support him in preparing the final outcome draft. We will definitely submit it. If not today, let us hope that it will happen slowly.
Thank you, ma'am. Thank you so much.
Who will be saying a vote of thanks to Madam?
Good afternoon, one and all.
Sorry, sir. I am on behalf of Madam. I am proposing this vote of thanks. Gaurama ma'am, this is my second workshop with you. Last January 2024, inclusive education, I was here in RAE for a 5-day workshop. So I'm very pleased to be here and listen to your words of wisdom. Actually, the whole session was like a very funny session with a lot of learning. So that's what we were discussing, that our classroom interaction also, if it is like this, absolutely there will be zero mental stress, and a lot of mental health and well-being will be promoted in the classrooms. Thank you, ma'am, on behalf of all the participants. Thank you for your very interactive session and giving us a lot of inputs. Thank you, ma'am.
We'll be back by Uh, Dear participants, we will start the last session of the day. We have an online presenter, Dr. Jitendra Nagpal. Sir, are you available? Nagpal sir? Nagpal sir, are you available? Not there, no? Just call. Sir, yes, sir. Please join online.
Just I'm coming.
Yeah, no issue. We will do screen sharing. Online side of the
Namaskar, sir. Anil Saab, namaskar. Good evening.
Namaskar, sir. Thank you very much, sir.
Good evening to all of you.
Yeah. Sorry to disturb you on your busy schedule. Sir, we have the participants here.
Don't take much time, sir. We can start straight away.
2 minutes only will take.
Okay.
They are principals, vice principals, HMs, then diet principal, diet faculty, principals, SCRT faculty, then teachers and NGO representatives.
Achha.
There are around 35
Do we have?
people.
Did you get my the PPT I sent you? So there was some problem from this side.
Yes, sir. That is with us. No
So,
problem. Only
will
from
it be
our
possible
side.
to have a screen sharing, sir?
Yes, but it is in PDF. So we will be only seeing your PDF. Your face, seeing it will be difficult. That's what our man told.
Oh,
If it would have been PPT, then we would have been no problem. We will do that, sir.
We'll see. I mean, only thing is, I'll be able to see that, no? Right.
Yeah. We'll do that, sir. A brief introduction, I think, sir.
Very brief, sir. Very brief.
Backbone of Manodarpan program. Sir is representing the ministry also. I think, I'll request Yashoda to briefly introduce, sir.
Okay.
Dr. Jitendra Nagpal is a renowned psychiatrist and a program director of Expressions India, the national skills, values, and school wellness program. Under his leadership, Expressions India conducted over 6,500 workshops, training programs, and community seminars, impacting students, educators, and professionals across the country. He currently serves as a senior consultant psychiatrist and head of the Institute of the Mental Health and Life Skill Promotions at Molten Medicity, New Delhi. Dr. Nagpal has played a key role in shaping policies and programs for adolescent well-being, collaborating with the institutions like WHO, CBSE, NCERT, and various ministries of Indian government. His work from school mental health initiatives to corporate workshops on work-life experience. Beyond his professional achievements, Dr. Nagpal is a passionate advocate for child and adolescent mental health, serving in multiple advisory and serving and leadership roles. His efforts have been recognized with prestigious awards, including Delhi State Child Welfare Award for the contribution to child development. We are privileged to have him here today to share his insights and expertise. Please join me to warm welcome Dr. Jitendra Nagpal.
Over to you, sir. Nagpal, sir.
Am I audible, sir?
Yes, sir.
I won't be visible, no? Am I visible there?
Yes. Now, okay. It has come.
So I'll keep requesting you to forward the slides, no, because there are only few of them. So you
yes.
can, yeah, we can go ahead.
Yeah.
Thank you for the introduction, and most welcome all of you. And it's an honor to be part and parcel of this prestigious training institute at Mysore, the RI, and also the honorable faculty, the leaders at the Mysore institution. I am very proud to be associated with Professor Anil Kumar, Professor Gorma ma'am, and many others who I have maybe not met directly, but it has been a great journey to learn and, come closer to understanding the vision and the mission for all of us together when we look at overall mental health and well-being. We can move forward, sir, one by one. Yeah. I also personally feel that the bigger the challenge of our human resource in teachers and our human resource in overall mental health and well-being, the partnership is very important at this stage in the implementation of the NEP 2020, because a large number of students who are suffering unnecessarily from emotional behavioral problems, they are not being addressed. They are unable to reach out for the necessary help to be given to them. So as I was privileged to hear the inauguration in the morning, I wanted to share with you that a lot of effort has gone in by the government of India, NCERT, RIs, to make the Manodarpan accessible and available to the large majority of the student body in our country. We can move it, sir. One by one, we can move ahead. I'll tell you where to stop. Yeah, we can spend about yeah. That's all. Slow, sir. Yeah. What I'll try to do is also to highlight. Will it be okay to be bilingual, or largely we focus on English speaking here, as you say? Right, sir. The link between overall health and overall education, along with the economy of the country, is astounding. There's no doubt today that health education and overall education in the academic scenario of our country, we find a lot of positive cycle of learning where health and economical growth is also created. Now, how does that happen? If you see this wonderful combination of how education, economy, and overall human health is integratively linked with each other, we will realize that if you want to look at economical growth, if you want to look at the success of a nation, we truly have to focus on the health as a component, mental health as a component, and also maybe overall physical and social health as a component of our daily education. Next one, sir. I request all of you to spend maybe maybe 1 minute only comparing the two. We had the national health policy in 2017 and we have the national education policy in 2020. If I can request one of you to read it loudly, can I have the privilege to hear one of you? If you can read this loudly for us, if you have a mic with you. A lot of the combination that goes in making of a education policy and a national health policy actually defines the holistic approach to education in our classrooms also. Yeah, if anybody would like to.
Yes, sir.
Yes, sir.
Yeah, about the National Health Policy 2017, greater emphasis to be placed on investment and action in school health by incorporating health education as a part of the curriculum, promoting hygiene and safe health practices within the school environs, and by acting as a site of primary health care. And about the National Education Policy 2020.
Wonderful. Okay. Yes, sir.
Yeah, children are unable to learn optimally when they are undernourished or unwell. Hence, nutrition and health, including the nutrition and health, including mental health of children, will be addressed through healthy meals and the introduction of well-trained social workers, counselors, and community involvement into the schooling system.
So may I request you to tell us vision of the policy and vision of the national education policy. Actually, it is on nearly the same, isn't it, sir?
Yes, sir. So both are interrelated, relating it work. Promoting hygiene and safe health practice itself is also a practice of nourishing and
right.
What is called? Yeah. Thank you.
Thank you so much, sir. I think that was a wonderful way to tell us. Maybe go to the next one. We'll go to the next one. Yeah. You will be surprised. India is the known capital of the non-communicable diseases now. And what are the non-communicable diseases? Ladies and gentlemen, teachers, dear principals.
For example, diabetics and hypertension.
Anything more, sir? If we can recall, we will try to make this session a more interactive one. I am worried because today India is heading to become the national global capital for non-communicable diseases. And mental health problems are the single largest component of the non-communicable disorders. Now, this is Government of India data which is coming to us, and the NFHS survey has happened. The NFHS 5 survey has also happened. So, can we recall any more non-communicable disorders? So, what does non-communicable disorders mean to us? I think we will just have a very brief brainstorming on the fact that these are the terminologies which children are going to ask us tomorrow.
Maybe they are posited by the lifestyle issues.
100%. Very good, sir. Excellent. So today we are discussing basically mental health as a lifestyle problem. Mental health is not a area which is affected by only the virus or the bacteria. Of course, if you have a chronic viral infection, chronic tuberculosis or typhoid or viral fever or COVID-19, the mental health will get affected. But by and large, non-communicable disorders, as sir is saying, these are lifestyle disorders, lifestyle problems. So what are the other lifestyle problems which the 21st century is facing, especially the children who are going to the school? Any other examples? Is obesity a problem in some urban cultures? Childhood obesity. Is substance use a problem? Use of drugs which are for illegal purpose. So any other problems like this? Is cancer a non-communicable disease? The answer is yes. Yes. And we have come across thousands and millions of cases of cancer rising in India at a very early age. We call them the childhood cancers. So hypertension and diabetes are only the window of the non-communicable disorders. So let us be very, very clear that we are going to have a mental health crisis if we are not going to be managing the overall non-communicable tendency in our country. Because how our lifestyle is, how much of attention is given to our diet, how much of attention is given to our sleep pattern. Are you coming across or hearing a lot of cases of children who have very poor sleeping habits and very poor dietary habits? Are you coming across anybody you know you would like to share any case over here, sir? Anybody in the audience?
Yes, sir. The children develop dark circles below the eye due to lack of sleep.
Yes, sir.
Use of mobile in the night time.
Even spoiling the eyesight.
Yes, sir. Eyesight
completely spoiling the eyesight and damaging the nerves which are going from the eyes to the brain. The connection between the eye and the human brain is through the optic nerve.
Yes,
we are finding children having damages in the optic nerve by excessive use of devices in the late night. Yes, anything else? Any other cases you have come across? What about the lost sleep?
And decreasing.
Pardon, sir? Yeah.
Lack of attention.
Okay. Okay. How's it? Yeah. Very good. Please mention few of them. What else? The complete life cycle approach is getting damaged. What we call as the circadian rhythm. Circadian rhythm is the 24-hour cycle of the human being. Now that gets affected because of the overuse of the social media, overuse of the computers or the devices. How much of sleep would be a minimum healthily required for a under 18-year-old or any adult for that matter?
7 to 8 hours is general.
Okay, 7 to 8 hours in the night, not in the daytime, isn't it? So are the students knowing that 7 to 8 hours or 8 hours in the overall 24 hours is not the question. It is the night sleep. It is the night sleep from say about 11 o'clock to 4 o'clock or 5 o'clock, which is the most important sleep of the human being. So the 7 to 8 hours of sleep in the night, not 7 to 8 hours of sleep in 24 hours. Because when the students are staying awake in the call centers or in the coaching centers or studying late in the board exams and they are not able to focus in the examination hall, the chances are they have not been sleeping for quite so many days. And early hours of the morning, 3 o'clock, 4 o'clock, they start feeling the sort of fainting or reeling sensation or any sort of a sensation which is causing a little bit of a dizziness or vertigo. Now these are the common complaints we see from parents of children who do not have a healthy night sleeping habit. So prevalence of non-communicable diseases in children and adolescents today, you can see what percentage it is. It is seen that from 2 to 3% to up to 10% of the children suffer from hypertension, diabetes, obesity, thyroid problems. You heard of thyroid problems? Any one of you? Is thyroid important for us? Is thyroid gland important in the body? Anybody?
For the metabolism, thyroid is very much needed. And if it is disturbed, the entire metabolism process is at fault, gets disturbed.
So, madam, what happens? You're very right, and thank you so much for that one line, very important answer. What happens when the metabolism is chronically getting disturbed for weeks together in a growing brain, which is just maturing brain? In the maturing brain and the maturing body, if the chronic habit of metabolism dysfunction is going on and on, what is likely to happen to the human emotional and human physical health? Yeah, you may go ahead, ma'am. Yeah,
A state of lethargy takes place, and they also get into depression, mood swings.
very important. Very important. Thank you for sharing. Most of the teachers are not aware in our country, and I think that is why the National School Health Program is now picking up as part of the overall educational culture or the well-being culture in the school. Because when you talk of mental health, the challenge lies in how we are able to actually even assimilate the food in the body, because the fundamental metabolism happens at a given rate, at a given intensity. And if the thyroid gland is not working, the basal metabolic rate completely goes haywire. The carbohydrate and the fats do not get digested, and they become part of the accumulation in the body. As you said rightly, it produces lethargy. It can produce irritability. बच्चे माँ बाप कहते हैं कि बहुत चिड़चिड़े हो गए हैं, वो बात नहीं मानते हैं, कहना नहीं मानते हैं, और थोड़ा हॉस्टाइल हो जाते हैं, डिफाइंट हो जाते हैं. So what I'm trying to say, ladies and gentlemen, we'll go to the next slide. A lot of problems come up because multiple problems are coming from the body. A lot of mental health problems come up because a lot of physical health problems come up from the body. And thyroid is the representation of that. When the metabolic rate of the body is not working appropriately, the chances are the other systems also will not work. The kidney function, the liver function, the cardiovascular tachycardia, very rapid heartbeat, all these are also going to be affected. So the message so far is that mental health is not about absence of a disease. Mental health, positively kept mental health, is not equivalent to the absence of a mental disease. Remember, promotion of mental well-being, it is equally important as academic achievement, or probably more important, because if I'm healthy, if I'm balanced, if I'm taking care of my body and mind, then I'm likely to be excelling in my academic pursuit also. And I'm not going to be having a body or a mind which is troubled, distressed, shaken up, disordered, diseased. So we are compelled to actually take care of our bodily and mental health if we want to be good performers in the institution, want to be good performers in the academics, or we want to be good performers at the entrance exam. So this is the message so far. Do not allow any ill health or difficult health to become more powerful than anything else in your life, because if you are having health, then you have everything in life. If health is not there, then everything is lost. So we don't find good health in many of the children who are brilliant, intellectually very high IQ children. They don't care of themselves, about their sleep, about their diet, about their exercise, yoga, meditation. All that is grossly missing in them. You all must be wondering why this slide. Today we are at a crossroad in our school mental health, the school mental health scenario. What you're seeing here is only from 2017 to 21. But now we have more data from 22 to 24, and then now we will probably get annual data in 25. Suicides in young people are a bigger challenge to any state government in our country. And especially, you have seen some of the best of the institutes find it difficult to cope up, having children who have difficulty in coping with the day-to-day demands of life, but they are okay with achieving 95, 100% marks in their IITs or triple IITs, or maybe even NITs, and many other wonderful central government institutions. So my question to all of you, ladies and gentlemen, we can move ahead from this slide, we can come to the next and next. Why is it so that some of the most brilliant students in our country are depressed, unable to cope up, and sometimes even feel like, eliminating their own lives. The most intellectually well-placed children in the best of our institutions. My question to you, and please feel free to give your own interpretation of the question, which is confronting all of us, including the policymakers and the planners in our country. You see the data over here also. This is the national data I'm showing you. And very, very importantly, mention on the bullet points, the very, very important data of child and adolescent mental well-being in our country. So first, let us have an opinion, at least from two of you. Why do you think very well-placed, highly intelligent children in premier institutes suffer from very severe emotional coping difficulties? Because you are so successful and so happy and so proud. But why do these children have to go through emotional problems? Is there something unique about them? Yes.
Well, sir, the process of selection into these institutes through coaching centers,
Right.
they're subjected to a lot of churning, and that leads to unhealthy competition, leads to mental disorder, and
Very
they're
good.
subjected to a lot of stress. And the expectations in the
Yes.
established institutes and their ability, there is a
Yeah.
mismatch.
My humble request to RIs, and especially led by Professor Anil Kumar and others, and Professor Gorima is there, kindly do help the teachers to do some very good action research on these topics. Why brilliant, successful, highly scoring children are equally or more vulnerable in the best higher education institutions? Because you said rightly, sir, the fierce competition will always be there. My question is, the competition will always come more and more. But when the best of the best students are joining in, say, one of the IITs, there is a sense of isolation. There is a sense of withdrawal into one's own shell. And we are away from our families. The immediate connectivity, consolidation, communication, compassion of the family members is not there. So we may not find equivalent to the family members, one can never equivalent to the family members, certain gangs or certain friends who could be hand-holding and shouldering our emotional well-being. So here you find that about 14 years time or 15 years time, the world is facing the peak point of mental health conditions. But as you said rightly, sir, the expectations and the dreams of the parents. Do you think that sometimes you come across in your institutional training or being a school principal, you come across parents who are very, very difficult in terms of pushing their own dreams onto the children, their
Yes,
own expectations, their own
yes.
comparisons between the brothers, sisters, cousins, and other friends?
Yes, sir.
What do you do? What is your advice to such parents who are living?
We advise
Yes,
them
sir.
as per the ability of the child, the way we assess the child throughout, like now from class 1 to class 10th, he's with us. And I offer even 11th and 12th through CBSE, but they don't join me.
I
They
see.
want to join a coaching institute in Kota, or they want to join a coaching institute in Hyderabad, where JEE is the main focus for them, or NEET is
Right.
the main focus for them.
I agree. Totally agreed, sir. Very, very difficult.
Yes, sir.
And do you think that somewhere down the line they don't realize the personality traits of their own child is getting very, very pushed into a tight compartment where the child is unable to relate to anybody because the pressure of the performance in the joint entrance or the NEET exam is very high. Even the law exam, sir, I've come across students writing the NLU exam, the NID exam, any of the even the CUET now. But somewhere down the line, the expectation of the parents being so a single factor, and the quota factory, you are aware, most of the children who attempted or completed suicides, they were actually not very sure of being accepted in their own family after spending 1 or 2 years in quota and not getting admission. So is that the purpose of schooling? Is that the purpose of schooling? Is that the purpose of joyful learning, celebrating learning? As Pradhan Mantri sir says, Honorable Pradhan Mantri says the joy of learning, the joy of exams, examination as an utsav, a celebration. You have to be an exam warrior, not an exam warrior. How are these things to be brought to the grassroots level in the school? That perception, that interpretation that Life is about enjoying every moment, enjoying every moment to scalable feeling. But today we find that most of the children are nail biting, thumb sucking, and so much worried and acutely panicky about the results because their marks are going to make the complete purpose of life. The getting high marks has become the purpose and the objective and the goal of life, not joyful learning, not ability to connect with their parents or friends, communication. So these are the parameters where we all need to work sincerely. Somewhere in the coming times, we'll be able to define these little bit more positively. So I wanted your opinion, especially in the. We can go to the next one, sir. Yeah. Yeah, and we have somebody reading the second point here. Second point, sir. Approximately 18%. This is about how much India is sharing the burden of world percentage of anxiety and depression in young people.
Approximately 18% of the global burden of depressive disorders and 15% of the global burden of anxiety disorders were contributed by India.
Okay. So 20% approximately is contributed by India. That means, and 40 to 60% of that contribution is under 18 years, the children. So we have to be very cautious and careful in the planning of our educational inputs in the schools, especially before we look at any other data coming from anywhere else in the world. We'll go to the next one, sir. Yes, sir. Very good. These are the left and right in the blue column. Yeah, so you see the left and the right one. You'll be able to see the. Can you read the different types of disorders we are coming across? Once on the left and the right. This is how we see the planners having this difficulty in.
Shall I read, sir?
Yes, sir. Please go ahead.
Towards left, bipolar disorders.
You are welcome to explain, sir. Welcome to explain, because this is only important for our knowledge. You can, whatever you understand by that terminology, you may explain in one line the name of the disorder. Yeah.
Bipolar disorders, then autism spectrum disorders. Let me read out, sir, first. Eating disorders, substance use conditions. You call it as substance abuse or use conditions, sir?
Now it is called world over. It is substance use, not abuse.
Use condition. Okay, sir. Thank you. ADHD towards right. ADHD, aggression and bullying, internet addictions, schizophrenia, development,
Okay.
and intellectual disorders.
Intellectual disabilities. How will, for example, sir, if I can request you to tell us what are these autism spectrum disorders? What does it mean to us? Why are they called autism? What happens in that, and how can a teacher identify early detection in the classroom, maybe in the foundational years? What happens? And this is gradually growing. We are coming across more and more, and many of the countries across the world, people are saying it could be the reason of even the vaccines which are being given in large quantities sometimes. So, from your experience, I request if one of you could like to share any of these one or two experiences and cases which you have come across, and you were instrumental in helping the family and the school. Any case, maybe substance use, maybe depression. It's so common, no? So you as a mentor, you as a interceptor, and you as a counselor, because I often believe that teacher is the best counselor, and any staff in the school who is sensitive and also taking care of the children compassionately is a good counselor. Yeah.
Yes, sir. Good evening. So
Please.
I'll go with the autism spectrum disorder. So which I have seen a second grade kid. So who is
I see.
socially lackable, is not like a normal kid. So
Yeah.
he can't able to speak, talk. So like less communication will happen with the peers. So this thing, and then repetitive behavior.
Excellent. Very good, sir. Very good. I think
So,
you've really nailed the whole issue, and it is so common. Yeah, please go ahead, sir.
so basically, autism defines like socially lackable and then less communication and repetitive behaviors. So little bit hyper also includes. So this
Little
is
bit hyper also.
yeah.
Right.
And then bipolar disorder is like episodes of mood swings. So
Okay. The high, the very high and the very low mood.
yeah,
Very high and very low mood.
by the manic, high manic or low manic. So episodes of mood swings, bipolar disorders. So
That is why.
substance use and eating disorders, like everything will come under like hobbies come under.
Okay, sir. Very good. Very good. And these are commonly seen, I would say, out of 100 students, we would see definitely in 2 to 3 of them, sir. Yeah.
Yes. So on the right side, ADHD, we all know.
What does ADHD mean, sir? And when do we not simply label a child as ADHD, and when do we care to diagnose ADHD? Sometimes children get a lot of complex if we are simply given some names like autism, ADHD, they feel offended.
Yes.
So when do we qualify a child for having ADHD, sir?
Nowadays, using that psychological terms, it's been a fashion in school also. So with many
Right.
students, it is going. ADHD is a lighter way, we can say, as an impulsive students. Whenever the teachers find students as like little impulsive, also they comes to psychological term ADHD, brand them. So yeah, ADHD. It is like a proper psychological term of attention deficiency hyperactive disorder. So this is the way. So impulsive, I think, is misconception like as an ADHD in my point of view.
You're right, sir. You're right. Only
Yeah.
thing is hyperactive and attention deficit. One is my mind is unable to focus continuously in the classroom for 35, 40 minutes.
Yeah.
I know we can all be disturbed by 40 minutes, but sometimes the child can be disturbing to the other children in the classroom by too much of movement. What you call as being fidgety, restless bacha hota hai na. So
Yeah,
maybe that is one of the
eating
reasons why.
tolerance.
Yes, sir. So I wanted to ask you whether there is a way to bring about a change in teachers to identify these early before wait for any sort of a diagnosis to happen. That is the purpose of school mental health program and even Manodarpan. The first purpose of Manodarpan was, as Anil Kumar sir mentioned today morning, to identify and intervene early before a situation becomes a problem unmanageable, and the unmanageable problem becomes a diagnosis. So, for all of these conditions which are mentioned as some of the common conditions seen in a classroom or a school, my humble request to you is anybody can tell us, for example, both a mixture of anxiety and depression, bechani, ghabrat, udasi, feeling sad, low, helpless. Where does a teacher keep a watch? How does a class teacher keep a watch? And when should a teacher ask the counselor or the professional to give some help? Can you tell us some example of teacher's role as a counselor, please? Yes, sir. Yes,
So
ma'am.
sometimes we see sudden withdrawal in the children,
Very good. Excellent.
especially when there is some substance use conditions in the classrooms and some secretive behavior and
Yeah.
not taking interest in school activities, or sometimes they even tend to steal things, no, for the for buying substances either from home or from school. They tend to steal things. So that is when the teacher has to intervene and find out if the child is actually into some substance use.
Absolutely. So the watchful eye of the teacher, sudden withdrawal for a few days, spending a lot of time not getting ready for the school, maybe spending a lot of time in the washroom. What about the behavioral changes? Not wanting to take bath or lack of sanitation, lack of hygiene, not brushing, not bathing. These are all seen very commonly by parents also. What about some of the emotional and behavioral changes you would see in substance use children who are starting to take some drugs which are not acceptable? Yeah.
They are very aggressive, sir.
Yeah.
Get
Okay.
either very aggressive or very
Withdrawn, depressed, Yeah. Okay. Anything else in terms of what would you see in a child who has uh, eating disorder? Nowadays, eating disorder in the urban culture is very prominent.
Yes,
Not
sir.
many.
About
Yeah.
eating disorder, generally we term three types, sir. Bulimia nervosa and anorexia nervosa and binge eating.
Excellent.
Anorexia is generally termed as those who doesn't eat properly because maybe due to they get weight and some may get ill health maybe get by eating fully.
Yes.
So some students will eat less. We observe generally in not it in may not be I'm not wrong. Women, adolescent women in the village also they eat very less as a fear of getting fat or obese.
Yes,
And
absolutely.
bulimia
Yeah.
nervosa is generally occurs while after eating they vomit, maybe because of some of the reasons. And binge eating is eating more than required, and they get obese or something weight gain.
Excellent. But you agree, sir, that bulimia and anorexia can exist in the same individual?
Yes, sir. Sometimes if they eat by unknowingly, they may
Yes.
vomit after the eating. After they get, अरे I ज़्यादा खा लिया इसलिए I will vomit.
They will start feeling guilty. They will start feeling guilty because they will say, I attended a very important marriage party with my friend. It was too tempting to have Mysore pak and double ka meetha and kurbani meetha. And the child ate about half a kilo of the dessert, went
Yes.
back home and felt that my weight will increase and suddenly vomited everything out. And the dehydration happened because all the liquid and the solid went out. The child fainted also.
Yes.
So it can happen, and the parents don't come to know because they are conscious about their weight. Some of the girls might be conscious about their overall weight and the figure, and how this can be a Western culture influence on India. Do you think eating disorders have been the Western culture influence on India traditionally? Yes.
Yes, sir.
Sir, I don't think it's a completely Western influence, but
Yes.
in our media and all, zero size, slimming,
Absolutely.
all these things are also contribute to a larger extent. So
Agreed, ma'am.
it is
Agreed.
not completely a Western imitation, and is taken from the media also.
You will be surprised, man. Now it is becoming a little less in the European world. It is higher in India now. Because you are right, because of the advertising media about the perfection of the looks and the figure and the zero size, and especially boys also. Boys also, the problem is not less. Everybody wants to be a Bollywood hero like Salman Khan or Arjun Allu. Everybody wants to become a top class macho in the school.
Pack and 4-pack.
So I only hope the teachers don't want to become like that because we'll have a problem otherwise. So it is somewhere parents also are aggravating the problem, ma'am. Parents also keep on expecting the ideal child, that my child is a very good looking boy. He is the best. He's the classroom. He's a very tall, handsome boy. So the parameters of looking good, somewhere have become illusionary. And you're right. This is not essentially coming from the West. Our own parenting habits, our own perception about the overall looks and how this can be, a beautiful child is a beautiful looks. No, a very, very wrong notion being sent across to children that a beautiful mind and a beautiful soul who thinks good for himself and others and herself and others is the most beautiful child. So the whole idea about culture, about their well-being culture, their own cosmetic looks has to be brought in a little bit of a valuable discussion in the schools. And a
Yes.
lot of children are having good debates on these issues.
Yes,
And
sir.
it is nice. Yes, sir. Any
As
examples?
teachers should, while teaching, we should encourage this beauty is ephemeral, short-lived. Beauty
Completely.
does not. Like Hema Malini our days, now Budima ho gayi. Those days, dream girl. But
Yes.
beauty doesn't remain. We have in literature also so many poems, and that's the basic idea that children, especially during 9th and 10th classes, teenage,
Very
we
good.
should understand that our deeds are more important. Our good deeds will remain forever. That's the message which teachers have to give, I believe, sir. Thank you.
Thank you so much for sharing that. Anybody else? It's a wonderful methodology you have suggested. Even a physics teacher or a Sanskrit teacher can bring the concept of how becoming rich and famous and looking beautiful is the idea of success. No, it is an idea of one of the ways of being successful is to carry your personality well, to carry your looks well, no doubt. But as you said rightly,
Musamandia's poem is there in 10th standard, sir.
yes, sir.
Way back when we studied those days, also even 30, 40 years before, even present, I think curriculum also it is still there.
Excuse me, sir.
Wonderful message.
Excuse me, sir. William Shakespeare.
Yes, sir.
All that glitters is not gold. Often have you heard that told.
Wonderful.
Many a man is life as soul, but my outside to behold. It clearly says the outward appearances are cheating.
Yeah, yeah, yeah.
So in this way, character is destiny. Our character decides our future, not the outward appearances or slender waist.
Yes,
There is a nowadays there is a principle that three C's. Three C's
Yes.
means cut, clarity, and color.
Yeah.
Cut means size. Clarity means appearance, and
Yeah.
color means outward appearance.
True, true. Yes. A very, very important, challenging part which the children are not made to be aware. And you are very right with these lovely examples of William Shakespeare and even what our very famous poets have mentioned. I'm sure when I think when Keats was talking about a thing of beauty is a joy forever, the second line mentions so beautifully that its loveliness increaseth, it shall never pass into nothingness. That means it's talking about the eternal, immortal beauty of the soul, isn't it, sir? And beauty of the work we do, beauty of the hands and souls we create for others, the moments we create, a chance for everybody to grow together. As Mother Teresa used to say that, okay, the purpose of life is to be happy, but the purpose of life is bigger purpose is to create happiness in everybody else around me. So I think education has got such a wonderful platform to minimize mental health difficulties and problems by clarifying. So I feel so clarified. Feel so clarified in the words. Anybody else would like to share such wonderful examples you are sharing, sir? What William Shakespeare said, what great poets like John Keats and John Milton said. I remember John Milton telling that the mind is in its own place. The mind is in its own place. It is we. It is we, the human beings, who create a heaven or hell out of it. माइंड कहीं जाता नहीं है, वो सर के अंदर ही है. इमोशंस, थॉट्स हमारा ब्रेन में है, बट उसका हेल बनाना है या उसका हेवन बनाना है वो हमारे ऊपर डिपेंड करता है. दैट मीन्स हमारा एजुकेशन पे डिपेंड करता है, हमारी एम्पावरमेंट पे डिपेंड करता है, एंड आवर एनकरेजिंग, एनेबलिंग, एंजॉयबल एनवायरनमेंट पे डिपेंड करता है. Whether the environment of the school and the family for me as a child is enabling, enjoyable, and encouraging. And that is what reduces the chances of mental illnesses and starts promoting mental wellnesses. So the only difference is between I and W. We are very close to mental illness and we go far away from mental wellness. We can go to we can run through a few of them. But thank you so much. This slide brought in a very good discussion about the common responsibilities of the teachers in early identification and intervention of all the common mental health difficulties. We can go to the next one. So in short, what we are trying to discuss today, that when a child is moving out of childhood, childhood is always there. How many of you still love to be the child? Can we hear some children here? How many of you feel like laughing like children and singing like children? Sometimes.
All of us, we are answering.
Wonderful. So at the end of the day, at 5 o'clock, do you feel like singing a song for yourself?
Yes.
So who is going to help us with a 30 seconds very interesting song? Anybody? All the teachers and principals who feel like children every day. The child is the father of the man. So we should not forget the child inside us till the time we are alive.
Sir, one song right by.
Yes, sir. Please go ahead.
K.S. Nisar Ahmad in Kannada.
Yes, sir.
ನೀ ನುಡಿಯದಿರಲೇನೋ ಬಯಲಾಗಿಹುದು ಎಲ್ಲ ಕಣ್ಣಂಚಿನ ಕೊನೆಯ ಭಾವದಲ್ಲಿ ಬಗೆನೋವ ಭಾರಕ್ಕೆ ಬಳಲಿರುವ ಮನವಿಹುದು ಕಾರ್ಮೋಡ ಆಗಸದಲ್ಲಿ ಇರುವ ರೀತಿ ನೀ ನುಡಿಯದಿರಲೇನೋ ಬಯಲಾಗಿಹುದು ಎಲ್ಲ ಕಣ್ಣಂಚಿನ ಕೊನೆಯ ಭಾವದಲ್ಲಿ.
Wow, wonderful, sir. Thank you. Thank you. In one line, what does this message from the song, sir?
If you don't say anything, everything is says your eyes.
Okay, wonderful, wonderful. एक ऐसा एक पॉइंट था जिसका एक गाना बना था सर. I'm sure some of you are fond of the singer Mukesh also. You remember Mukesh, singer? Some of you, the very famous Bollywood singer Mukesh sang in some other languages also. As you said about how the eyes can convey beautiful emotions, isn't it, sir? I remember a song which mentioned about तुझको देखा है मेरी नजरों ने तेरी तारीफ हो मगर कैसे ये बने नहीं ये नजर जुबां और ये बने नहीं ये जुबां नजर, क्योंकि ना जुबां को दिखाई देता है ना नजर से बात हो पाती है, बट जिक्र होता है जब कयामत का तो तुम्हारे जलवों की बात होती है, तुम जो चाहो तो दिन निकलता है, तुम जो चाहो तो रात होती है. It basically meant that even parents are not having enough eye-to-eye contact with children. So how do they communicate the love for children? You agree, sir? Parents and teachers need to have more eye-to-eye contact, more personal interaction, sitting at home, having dinner or lunch, at least one meal together. So these are the challenges you are seeing on the slide. The students today, when they are maturing from childhood to adolescence, from 10 years to 19 years, living with emotionality, living with the identity, my identity about who am I, what am I supposed to do, and living with my peer group. These are the three biggest challenges our teenagers go through before they start making their own opinions about careers, about their looks, about their friendships and challenges. So when we're talking about adolescence, so can we have one or two opinions? आपके ओपिनियन में सबसे अच्छा डेफिनेशन आपको एडोलेसेंस का क्या लगता है? Let us have 2-3 opinions. How will you, in your own subjective experience, and a definition, define adolescence? You all have gone through adolescence? All of us have gone through adolescence, sir?
In the book also we read, it is the age of stress and strain.
Yes. I'm unable to hear you, sir. Yeah. Okay. We are not able to, am I audible, sir?
Sir, yes, sir, you are audible.
So what is the understanding of adolescence in your opinion today? Adolescents in the world Entire world, India is having the highest number of adolescents from 10 to 19 years. So when we are maturing from childhood to adolescence, the charm and the challenge. We can have the next slide, please. We can run through, sir, quickly. Yeah, we can keep on running through. This is the example of how the world is changing, how electronic addiction has led to a lot of mental health disorders across the world, how the perpetrators of crime who are indulging in child abuse are becoming younger and younger day by day. We find 17, 18-year-olds, 19-year-olds who are perpetrators of juvenile sexual crime. Electronic addiction in children is linked to mental illness. It has been proven beyond doubt. Today we have so many of the students, so many of the young children who are addicted to mobile phones and devices, and they are unable to cope up with their day-to-day life also. Next month, sir. Next one. Quickly, we'll run through. What to do about bullying? As principals, how will you identify a bully in the school? Dear principals or teachers in your school, can you tell us how would you identify a bully in the school and what kind of a politely reforming action you will take on the bully? Yeah.
If you find the child being continuously absent to the school,
right,
not turning up because of, when we counsel him, we'll come to know that it is due to bullying that he was not coming to school.
Okay.
So, absenteeism in the school is one way to identify.
Good point. Very good point. Are we having enough conviction that most of the bullies have been bullied themselves earlier? Most of the bullies are people who have suffered bullying their life.
Actually, sir, actually, they say, express the same thing that when we were juniors, we were bullied. So we take it as a practice and we bully our juniors. That comes.
So these patterns of behavior, I wanted to ask you, ma'am, thank you for sharing. We're really happy. How will a teacher in the primary school, before that becomes a problem in the senior school, and it becomes a conflict of interest in the senior school and the problems of ego and violence and aggression in the school, we see in Delhi, we see every day. How can a primary school teacher trained by you can actually identify those early sparks, early signs of bullying in children who are from 4 years to 10 years before they become teenagers? So please kindly share from your experience, what are the common, maybe foundational years, in the foundational years, what are the common problems of behavior that children would be manifesting to be
Change
called
in
as
behavior, sir. Change in
junior
behavior.
children.
They may
Sir.
be aloof, and sometimes withdrawal symptoms also could be there. And they are reluctant to go to the school.
Yes. And many of the times they are, if they are in the school, they behave as if they are controlling the entire class. Those bullies they are actually part and parcel of the controlling group of the class and the corridor and the sections. So sometimes they don't have the remorse, they don't have the guilt, they don't have the the mannerisms which can allow for regular discipline of the school environment. So the school sometimes has to take the responsibility for constant coaching, for constant conversation, for constant caring environment where you can say assertively, that I don't wish to be troubled like this. Can a child be trained to be a little bit more assertive in resisting any sort of bullying? Can we do that through life skills education classes? How to teach a child to be assertive about not being, subjected to bullying. Is there a difference between being aggressive and being assertive? So when are we aggressive? When we say, no, this cannot be done to me. You better take care of yourself. And one is that I politely walk out and show my disgruntlement and my dissatisfaction at the behavior of a bully. So assertiveness training through life skills, aggressive denial, aggressive challenge through the moments like these are very important components which we come across every day.
Yes, sir. The foundational stages through role plays, we can show them like
Excellent.
how, yeah, bullying has to stop. What are the consequences of bullying and all through role play and dramatization that can be
Very
done.
good.
The foundational
Very good.
stages.
And so important, ma'am, it is also very, very important that in the early stages, before the the opinion making of the children is converted into a conviction of the adolescent behavior. Like sometimes some habits in the foundational years are amenable to change, but very difficult to change when the children come to the higher secondary or maybe the secondary schooling stage in their life.
True,
And
sir.
unknowingly, have you come across as a pedagogical warrior where role models in the family are sometimes responsible for creating bullies? Certain type of role modeling in the family.
Yes, sir. Yes, sir. Sometimes after using a substance, the father beats the mother up in the at home, which is constantly seen by the child, and that sort of behavior is there. Aggressive behavior is there in the school, and
Excellent.
for
Excellent.
similar for a very simple thing, they beat up children, use abusive language. So all that can be seen from children who come from such family.
Some dysfunctional families where
So yes, sir.
parents have a dysfunction, parent have a marital discord. There are poor role models in how the emotional regulation is happening at home. How are we role models for teaching emotional regulation? How are we the role models as parents to help children feel comfortable with the relationship between mother and father and not aggressive relationship? There the frustration, there the lack of security, emotional safety and security leads to certain patterns of behavior outside the family. And many of them are actually coming from homes where maybe the family is separated, the parents are not talking to each other, they are staying in separate houses. So these are very, very common histories we come across in children who are bullies.
Yes, in since we even see cyberbullying,
Of
which
course,
plays.
very important, very important. Yeah. And what is the kind of education you are able to give to students who are probably resorting to cyberbullying? What kind of norms and values are being taught to these children? Because cyber exploitation happens in a very, very big way. And now, of course, India is going to take a little bit more lesson of Australia. You know, ma'am, the Australia has completely banned social media for children below 16 years. It is legally banned. The children cannot buy, below 16 years cannot buy, cannot have an Android phone. And they cannot be on the social media converting themselves for playing on the the LinkedIn or the Snapchat or the WhatsApp. So they are to focus on certain sports and games, on intellectual activities, on better mannerisms of learning, teaching, sharing and caring, more values to be given. Because according to them in Australia now, the dangerousness and the damages have been so high that they are finding that unless some strict measures are taken, the youth will be destroying itself by the time they come to college. Thank you. We go to the next one, sir. Yeah. Yeah, we can leave it. This already done. We can just move forward, fast forward. We can move, sir, forward. Forward. These are the list of the, I suggest if all of you will be able to gather the information. These are some of the very important tools and measures India has carried out with some most reliable institutions in the country. So you have the NEP 2020 by the Ministry of Education. You have the World Mental Health Report 2022, which talks about the role and responsibility of every country towards promoting school and university mental health. The National Drug Abuse Survey of India, the ICMR, the NCRB, the National Crime Records Bureau, has told us and warned us about how the juvenile crime has gone up in the last 10 years. School safety and security guidelines come from the Ministry of Education, October 21, the guidelines which are released by the Ministry of Education for schools across the country are the security and the safety guidelines. My humble request, Dr. Anil Kumar, if this can be downloaded from the ministry website, or I'll send you a copy. Our honorable dignitaries coming from different parts of the country, they can certainly receive the soft copy of this, because it covers a lot of mental health safety and behavioral and emotional support which the schools and the family can offer to children. Yes, sir. Next one. Yeah, we can just go ahead. These are not important. Yeah. We can go ahead, sir. I feel you can go up. The childhood, yeah. Next one is, we already have. So anyway, the responsibility of the school today is a holistic responsibility, overall physical, mental and social development. Today, India is proud to also include spiritual development, values-based development, because as I remember, I'm sure many of you are familiar with the great writer Mark Twain. Is it okay? Mark Twain, right? And Mark Twain told us something what the challenges are seen here in the PPT. I have never let my schooling interfere with my education. Mark Twain said, I've never let my schooling interfere with my education. What did that mean? So I may get marks, I may get accolades, I may get incentive, I may get awards, but my schooling is very, very, very different and my education is different. Well, the schools promote education, but education can be a great amount of a garden where so much of fragrance about learning, growing, developing, empowering is growing together simultaneously. Right. So psychological and mental health issues not adequately covered in the NEP, referral and management issues of undefined children, identified children are not completed. Very important part. When we identify children who need a assessment for special needs, are you all familiar with the revised PWD Act of India 2016, where they have included 21 disabilities for inclusive classrooms, for inclusive schools? 21 disabilities have been included. Of course, if they are very severe at times, like the locomotor or the motor disabilities, then we need not push them into a school, regular school. But otherwise, active engagement and participation of the teachers, involving more and more database, involvement of recently introduced cadre of the CHOs is often lacking, and parental engagement in follow-up and compliance often lacking. Parents as resource people, parents as guardians of the school ethos and culture and behavior. So involving parents can be a star marker for improving the family life of a child. So parental management training is meant mainly for those parents who need an extra guidance for their children. Otherwise, parents are the best people to be their teachers in their life. And you are the best teacher to help knowing that your parents are the best teachers of your life, because they are your first role models. Your mother is the best role model. We are all believing that, but we all need to work hard on it. Next one, sir. Next one. One more. We can go ahead. Yeah. We can go ahead, sir. Ladies and gentlemen, I thought I will share with you this, but they're coming very often. But very important to know that today only you must have seen yesterday's news, how the IIT, the newer IITs are finding it sometimes difficult to bring in adjustment and adaptability of these young, very brilliant minds. So Quota 23 became the factory of suicides, and now luckily certain laws have come in. Under 16 years, please remember, under 16 years, children cannot join the typical quota type of a factory for entrances, because before that, then it is a legal permission required, because a lot of children do not study for their middle school and high school exams. Next one, sir. Yes, can we hear this from you? Can we hear this from one of you, please, loudly, before we stop and we open the house for a couple of questions? My humble submission was that You are the messenger, you are the guardian, you are the leader, you are the sentinel and the policeman and the gatekeeper for positive mental health in schools and the classroom. So wherever you find there is a ripple, wherever you find there is a method of trying to identify issues in your school, or even with the help of the alumni who can come and sometimes help in this process, please do that early. The Ministry of Education published a very good document, I will send it to Anil sir. Please have it from Anil sir, and Gaurima ma'am has been a part of that making of that manual, early detection and early intervention for common adolescent and children mental health problems. It's a 160 pages booklet which every teacher, every principal should have it on their desk, because you can get some basic answers, basic advice for parents, for teachers, for students, how to take care of their positive mental health. I'll send it to Anil sir. I'll send it to him and he will distribute it to all of you. But can we have somebody reading this for us in the end? Yes, sir.
The more we talk about these issues, share our views and experiences and learn from each other, the greater will be our chances of ensuring that our children have the fun-filled childhood they deserve. It is our collective duty to ensure that it is not overshadowed by stress and anxiety. Be it the role of technology within families, the importance of encouragement, enabling a clean slate for children, or rising awareness on mental health.
Thank you so much, sir. It has a very comprehensive outlook, and mind and mental health are not isolated from the health and not isolated from the Indian classroom. So I have a humble declaration that every teacher, every principal is the best counselor, because you are caring, you are compassionate, you are sensitive, you are inspiring, you have a lovely way of motivating every child in the classroom. The one fact I remember, many of the students who come back to us clinically, they have a feeling that the teacher does not look at them in the classroom. So I feel I could identify that very much with the student, because it happened with us also. So I request our humble teachers that let us be role models of watching, caring and smiling at every child in the classroom every day. It's very important to create a compassionate, understanding, non-judgmental and active listening environment for our beloved students and children in the class. Every teacher also needs that incentive and recognition. Appreciation is part and parcel of everybody's growth and development. Let us follow that diligently so that no child is left behind and every child matters is a very example motto for our nation. No doubt that disability would be an important area. Disability would be an important area for discussion. But considering so many disabilities, we can come about in talking about how the disability support is given by the government, by finances, by unique identification card for disability. Many of the parents do not know, but the process is easy. They can apply for a card provided there is a certificate available that the child is having some disability. Today, mental illness, chronic mental illness, long-standing mental illness is considered to be a disability amongst the 21 disabilities of the RPWD Act of India 2016. So with these words, I thank you for your patient hearing. I'm sure we have few comments and experiences sharing here. And we're so happy that many of you shared your experiences, including a lovely song also. I wish I could see more Kannada movies now. I was fond of Shri Rajkumar, but now I need to hear our very beloved teachers and how they can help us. Can we go to the next one, sir? There are a couple of slides which I thought that, yes, next one. Just keep it in mind as an important component. We already have discussed this, non-communicable, but this shows how the risky patterns are increasing. If you see the infancy, childhood and the adolescence column, we are seeing a large number of students who are victims of non-communicable disorders in 10 to 19 years, especially when the adolescents are not taking care of their diet, their sleep, their exercise, hygiene, yoga. The studies are inadequate. They are unable to cope up with the academic pressure or the board exams, because their basic health is negative in terms of overall non-communicable disorders. I think the last one, yeah. Do we have another one? We can go ahead. We can go ahead quickly. This is another PPT, but I think it has a. We can just go ahead fast. Yeah. We can wait here for a minute. Yeah, the next one. Yeah. I wanted to share with you the next one. Yes. Yeah. All of you are aware of these. Can we have any teacher here? Do we have any biology teacher also here? How some of the neurochemicals are influencing our emotional health? How dopamine, serotonin, oxytocin, they are influencing our mental health. So we are all indebted to our science teachers for bringing such wonderful research in our country also, where we are able to study the happy chemicals which are already there in the brain. But we all need to work together to ensure that these chemicals come out of the brain. So when we are doing some exercise or we are doing, see the achieving a goal, the activities are mentioned here. So when we customize activities of this nature to our children, we participate with them, we help them to participate, a portion or a segment of certain neurochemicals come out from the brain to make us happy, healthy, harmonious citizen of our country. Yeah.
రావద్దనేది కాదు టీచర్లు అందరూ తీసుకున్న నిర్ణయం పిల్లలు అందరూ బయటికి వెళ్ళినాకనే మీరు లోపలికి వెళ్ళాలి.
Yes, ma'am. Thank you. Yeah. So we can have anybody sharing with us how these endorphins and dopamines through some activities can be generated to make us feel confident, happier, and with positive outlook to life. Yes, sir. Please go ahead. You can read it for us.
Biology teacher.
Anybody?
Anybody from online? You can contribute.
Wonderful. Okay.
Online participants?
When you're eating good food, when you are achieving a goal, when you're completing a task that is planned, when you are taking care of your own self-care and activities and games, you are secreting dopamine in the brain, which is a mood elevating hormone. Similarly, endorphins are endogenous opioids, which are when we laugh, when we are happy, when we are having love and affection for the people we like, listening to music and watching a movie and feeling good about it, we have the endorphins or the endogenous morphine created by God inside the human brain. Oxytocin is socializing, meeting people, celebrating with our friendships, helping others for coming out of the pain. Well, oxytocin is the neurochemical which is going to be helping us. Similarly, serotonin for good mood, exposure to the sun, being with the people we love most, and mindfulness, feeling of being here and now, feeling of being here and now. These are very important components of our day-to-day living, and hormones are reflected through the process of our, day-to-day exercising as well as communicating. Thank you. Yeah.
Yes,
sir. Thank you,
very
sir.
excellent session, sir. We were feeling that you are with us here in physically present. You made it possible that, sir, through your interactive mode. I think now the session is open.
Next time I will come, sir. Next time I will come to
Mysuru. Yeah, sure, sir. We'll invite you.
We'll have more interaction and more activities. I could not do many activities because these are hands-on activities which one can do inside the small auditorium or whatever. And I think there are so many good ways we can interact better when we are offline. Yes, sir.
Anyone?
Good evening, sir.
Yes, ma'am.
Sir, in order to reduce the bullying, there is one slide which you have shown who is responsible. So definitely, definitely we all the adults are responsible, but my request to MOE is there should be a ban to some extent to the OTT content also, giving a lot of influence for that crime, sir. And
yes.
in the name of below 18 years, so many crimes the child, what we call that child is doing brutal cases, but still escaping. I don't know about the laws, but I'm a maths teacher, so I request there is a chance just reduce the age of 18 to some 14 or 15, so that if the child does a mistake, a brutal mistake can be punished, so that it will be eye-opening to the entire society. And I also request there should be a ban to some ads. Like previously it was fair and lovely, now it is blue and lovely. That change I could able to see in the ads. Why beauty is attributed to the color? Why beauty is attributed to the size? Why beauty is attributed to the ratio? And why the beauty products? So many so-called beauty products ads are in the TV, and I request that they should be banned in the advertising, either in the print media or the TV media or in the OTT platform, so that because a child won't own a phone, they take the parent's phone. So I request, if the parent is having a phone, definitely there is a chance, even for 1 hour, there is a chance that the student or a child watches the OTT content, which I have also witnessed. In some cases, the child has learned. So I request on behalf of all the participants and on behalf of all the parents, especially like, as a mother, I request you, there should be definitely a ban to the ads. There should some of the ads in the TV, because that electronic media is giving lot of influence, and there should be ban to the OTT content and print media also. Please take care of that, and there should be a change in the juvenile justice. I don't know whether I could able to ask this question or not. Please kindly consider.
No, ma'am, you are 100% on the line. I'm working with the Delhi High Court Legal Services Committee. I'm a member there, and the Juvenile Justice Act, the PWD Act of India for persons with disabilities, and very importantly, what we can do to bring about a change in some of the perceptions. I think the Juvenile Justice Act has also told us that it is not about only justice for children; it's also taking the children for trial in the and keeping them in the custody of the children homes before they become adults, because all of the kids are not coming across certain patterns of good behavior, so they obviously come under the purview of sometimes committing heinous crimes like murder, rape and kidnapping, and these are sometimes on the public schools also. So they are equally responsible for being told what is aware responsible behavior, what is aware and responsible behavior towards the fellow peer educators and peers in the classroom, and respecting mother, father, and the teacher. So these are part and parcel of the values based approaches in mental health. I'm sure you will be the most competent officers to define how this can be better integrated into the classroom learning. And thank you so much. Right.
Sir, like Australia, can't we implement the same?
Well, there are many suggestions. There are many doctors who have signed the petition and trying to convince the government in some way or the other. We need to protect our children from complete exposure to social media. I'm sure now the government has become stable. Hopefully, some things will be taken up in the few months. Definitely, sir.
And one more thing, sir, instruction from the top end that media should not be used in projects and our students' activities oriented learnings, wherein which teachers should not make a comment that it should be taken from the media.
Yes, absolutely.
That should be stopped, sir. It should be wholly through their experience or something like that, their creative thinking, like that also.
Yes, sir, and, I agree with you.
Yeah.
Public observations of these things can be a real nuisance. Yeah.
Yes. Please, sir.
Thank you, sir. We can discuss more and more. I know this is a very long and interesting topic. There is so much to share in terms of all the case studies and anecdotal records and whatnot in putting I hope the POXO Act will be covered in your discussions in the coming days. The POXO Act and what are the SOPs for POXO, the Protection Protection of Children Against Sexual Offences Act of India. These are very important reports which the principal or the counselor or the activity in charge teacher needs to compile and put it in a confidential record, because documentation means more than 80% of the case is done. So very important to document whatever we come across as the information about the child, by the child, for the child, or of the child by anybody. That is very important for class teachers and counselors and special educators to please keep your anecdotal records of the conversations with individuals, especially. Yeah.
Sir, one humble appeal from the stakeholders. So
Yes,
as these sessions are held for educators and students and all, can MOE plan a wider range of such sessions for the parents as a whole to educate them on these sensitive issues of how to bring up their children?
100%. I'm in favor of this, ma'am. This has been my first and foremost passionate subject, because parenting is not about school children. I think parenting is also about parenting your own parents. How the children are parenting their own parents, it's a lovely sight to see sometimes, when what wonderful teachers, what great leader teachers like you, when you teach the children, they go back and help their parents to understand the world better with more patience, more tolerance, less anger, more love for each other as parents and grandparents and teachers. Dear teachers, the students become the guardians for their own family, and they really need help. Today, if the confusion is about any mental health issue, it is more towards parents and the other elders in the family. They're not finding it easy to talk to their own children. This is a phobia or a fear we don't know. This is an anxiety or a resistance we don't know. But I fully agree with you that when we are looking at the new era of education, involving all the stakeholders who are part and parcel of the learner, which is a family, at least by rotation every month, parents can be by rotation, by class wise, they can have an exposure of the school environment and the ethos, and they become partners in participating in the school, not just watching the school and the child coming up as a development challenge, isn't it? So parents should be getting more and more platforms in the school, so that they feel encouraged, they feel compelled to become part of learning process of the child's life, especially about parenting, about grandparenting, about the love and affection and care and compassion we need to have for each other. The schools are a wonderful platform for disseminating the art and the science of good parenting.
Okay, thanks.
Thank you, sir. Thank you.
Yeah, it was been wonderful, sir. Within a short notice, you could agree and come on online. Let me ask our participant to provide a vote of thanks.
Thank you, sir. Thank you so much.
I take this opportunity to thank you, sir, on behalf of all the participants. And we got a valued information and also policy matters in this regard. I'm hoping that a happy environment will be created in the days to come in all the education system and schools. Hoping that happy India is going to create in the days to come. Thank you for
wonderful, wonderful, sir.
Thank you.
Thank you, ladies and gentlemen. Thank you. We shall meet again
you,
online, offline, and we shall continue. So many topics are there, so many areas are there. We're always there to work together and improve our own lives also. And
Yes,
please take care of your health, your mental health, your well-being, because teacher is the next to God. And if teachers are next to God, then I think we all need to first take care of our teachers also. Thank you.
Yes, sir, surely. And the document what you were telling, sir, please share also.
I'll send it to you, sir. Please pass it on. I'm sure they will all appreciate. They can also have their discussions in the staff room and the schools wherever they are. Sir.
Yes,
I'll just send it to you. Thank you, sir.
Thank you so much, sir. Thank you. See you then. Bye.
Thank you, sir.
Thank you, sir. Thank you. All the best.
So, what
Thank you, sir.
Thank you. Thank you, sir.
Whatever they prepared, we were asking. So, I think we are closing the day today. I hope it was again a wonderful day. Isn't it? We got too many good experts. Tomorrow, I think we will have first starting with the today's presentation. I think who is voluntarily contributing? Any one of you, sir, who can voluntarily contribute some few words? Shall you have a team, sir? Both of you do it. What is there? Telangana group will do morning at 9:50. All right. Yeah. Then we should. No, I forgot to tell him that I am really proud of our group. Yeah, really, because how you were responding to his questions. You all have a little back, a little. Yeah, he is a popular figure. Yeah, close to. Yes. Yeah. They can influence the people. Very popular. Yeah, and particularly from health ministry. Under that, he was a consultant. Yeah. Yes. Yeah. Correct. Good. Yeah. We should thank them because they were agreeing, to come over, online or offline. No, I really proud of you people also, madam and all.